Good morning. We'll begin with the first session for the day very shortly. All of you are requested to please take your seats. कुछ ही देर में हम आज के अपने पहले सेशन की शुरुआत करेंगे. आपसे अनुरोध है कि आप अपना अपना स्थान ग्रहण कर लें.
Check. All right, ladies and gentlemen, would like to request you all to please get settled down as we are about to begin with our very first panel discussion. I request each one of you to please get settled down. Thank you so much. देवी और सज्जनों, आप सभी से निवेदन करना चाहूंगी कि आप सभी लोग अपना अपना स्थान ग्रहण कर लें. हम कुछ ही देर में हमारे सबसे पहले पैनल डिस्कशन की शुरुआत करने जा रहे हैं. आप सभी से निवेदन है कि आप सभी लोग अपना अपना स्थान ग्रहण कर लें. धन्यवाद. Once again, I request all the people in this hall, I would like to request you all to please be seated and get settled down as we are about to begin with our very first panel discussion. यह उपस्थित सभी अतिथिगण से मैं निवेदन करना चाहूंगी कि आप सभी लोग अपना अपना स्थान ग्रहण कर लें. कार्यक्रम की शुरुआत करते हुए हम हमारे सबसे पहले पैनल डिस्कशन की शुरुआत करने जा रहे हैं. धन्यवाद.
Good morning, ladies and gentlemen. It's a bright and sunny morning today. And inside this hall also we have some bright faces. So I welcome you all to day 2 of this conference. Day 1 highlighted the promise of innovation. Today is about shaping its purpose. Day 2 invites us to ask how technology can deliver equity, access, and outcomes at scale. On that note, let us begin with the first panel discussion for the day. The moderator for the session is Dr. Pinky Jovel, IAS, Secretary Medical Health and Family Welfare and MD NHM UP. Ma'am, please come upon the stage and deliver your opening address.
Good morning all. So I welcome on behalf of State of UP and NHM all the dignitaries here and fellow colleagues and officers from the other states. This conference is very important for starting the future of health with respect to AI. So this is the second day. I think hopefully yesterday we had the exact context setting and how we are going to go ahead with respect to AI. This plenary session is about leveraging AI tools to strengthen India's healthcare, empowering human resources for health, scaling of telemedicine and remote care. This session explores how AI-driven tools can strengthen India's healthcare delivery by empowering the frontline workforce. They are the real stakeholders to bring the best to the last mile person, even in the remotest area, about the health professionals, ASHA, Anganwadi, ANMs, chief health officers, the recently added workforce for the Ayushman Arogya Mandir at the population of 5,000 across UP, across India, while scaling up of medicine, telemedicine, and remote care to the underserved population, especially because we are talking of universal health for all. It focuses on practical, field tested use cases and the system enablers needed for a responsible, inclusive, and a scalable AI adoption across community and the facility based care. So we have our speakers with us. Apart from that, I would just say कि we just were thinking how AI can truly empower the last mile health worker. This is the basic core agenda of today's discussion. We have in Uttar Pradesh Ashas approximately 1,80,000 Asha and Asha Sanginis, ANMs. In the Women and Child Development Department, we have Anganwadi workers, nurses, medical officers. They form the backbone of our health system. AI tools they must align with their workflows, languages, and the realistic problems. We are trying to find out the practical solutions going to the level of their understanding and a knowledge level of an ASHA, ANM, and any field level worker of any department, because interdepartmental coordination is the key for the holistic health outcome. Whether it is a PRI, it is rural development department, urban development department, women and child healthcare department, including the agriculture department. So interdepartmental coordination in health of all, the solutions must be intuitive, low burden and supportive, so that reducing paperwork, improving the decision support and freeing time for patient care. If technology adds friction, you know, there was a time when computers had been introduced in India and there was a lots of hue and cry that people will lose jobs. Same is for the AI. Now there are lots of YouTube channels. They say ki only who all are going to be relevant in AI. They give two, three examples only, and the rest of the people are in little confusion. Secondly, it is very difficult and complex system. So if it creates a friction rather than a value, it will not sustain. Equally important with that is the data security and ethical responsibility who is dealing with it, because there are lots of challenges coming recently. The government of India has announced a policy. They are telling they're going to make a policy for the security and health being a subject where 50% of our population is of women. The security and safety of our women and the children is very important and is of utmost sanctity has to be given to that. Health data, it is very personal when we're talking of Abha ID. So, as AI systems aggregate and they analyze sensitive information, strong safeguards are essential. Secure data storage, consent-based usages, transparency, and a clear accountability. Trust is a foundation of public health. We say, कि ना, if you're going to a doctor or a lawyer, you have to tell everything truthfully. You should not hide anything. So the trust is the core of a health system. Without trust, even the most advanced tools will fail. So we should have a trust. Along with that, we should have proper data security systems. Government leadership therefore becomes more critical. AI adoption can't rely only on isolated pilots. It requires a policy clarity, interoperable platforms, workforce capacity building, and the strong public private collaboration. Ultimately, we need to see where we can use AI for the basic things to make them better. Identify, for example, if we are working on maternal mortality rate and IMR and all, identifying everything at the earliest possible phase and the stage, strengthening the referrals, detecting the disease trend covers sooner, and support the health workers at the point of care. When AI becomes an invisible enabler rather than a visible burden, it truly serves the public. And health, being the public most important public sector, that's how it shows its importance. With this perspective, I look forward to a thoughtful discussions focused on a practical use cases, system enablers, and a responsible implementation. I would like the officer, Dr. Milind, to call upon all the concerned panelists and invite them so that we can start the session. Thank you.
Thank you, ma'am. So we have a power-packed panel for this session. It's my pleasure to invite Shri Arvind Kumar, Director General, Software Technology Parks of India. Professor R.K. Singh, Head of Department, Telemedicine, Digital Health and Emergency Medicine, SGPGIMS, Lucknow. Dr. Sanjay Sood, Project Director, E-Sanjeevani, CDAC, Mohali. Professor Sriram Ganpati, Associate Professor, Department of Electrical Engineering, Indian Institute of Sciences, Bangalore. Colonel Samir Kanwar, Director General, Health and AI, PATH. And Dr. Sujoy Kar, Chief Medical Information Officer and Vice President, Apollo Hospitals, Telehealth. Welcome to all the delegates. The keynote speaker for this session is Dr. Pinky Joel. I invite Dr. Pinky Joel to please deliver the keynote address.
A very good morning to all, respected dignitaries, distinguished panelists, colleagues, and friends. As we all know, the leveraging AI tools to strengthen India's healthcare, empowering human resource for health, and scaling telemedicine and remote care. In this context, if we look at that India stands today at a critical juncture in its public health journey. On one hand, we have expanded the reach of healthcare to the level where they were once unimaginable through primary health centers, community health workers, free ambulance services, and a large-scale national programs. On the other hand, there is a demand placed on our health systems are growing faster than our capacity to respond through conventional methods. This session asks a fundamental question: can artificial intelligence help us strengthen our healthcare systems, not by replacing humans, quote unquote, not by replacing humans, but empowering them? The current situation, if we see, there is a high burden, high aspirations, and high variability. Our frontline workforce, doctors, nurses, ANMs, CHOs, ASHAs, Anganwadis, they all remain the backbone of the service delivery. Yet they are often overburdened with documentation, referrals, reporting requirements, and decision making. Overburdened with all these things, the decision making becomes little uncertain Though we have tried few aspects like telemedicine, which has expanded access, especially the post-pandemic, but its penetration, its quality, and integration into the routine care remains still uneven. AI has already entered into the system in diagnostics, radiology, triage tools, disease surveillance, and teleconsultation platforms, but largely in the pilot modes, in a fragmented deployments, and urban or a tertiary care setting, which is very limited. So there are lots of differences, there are lots of challenges, especially in interstate and intrastate inequalities are existing because of the digital readinesses. Equally important are intrastate inequalities between districts, blocks, urban slums, remote tribal areas, and aspirational districts. The same AI tool that works seamlessly in a medical college may be unusable for a frontline worker in a low bandwidth, low literacy setting. Therefore, AI risks amplifying inequities unless it is consciously designed to reduce them. So the next question arises to our mind: is AI the solution to all our problems? According to me, it's my personal understanding that it's no. AI is not a silver bullet. It can't compensate the weak governance or any poor infrastructure or any inadequate financing. It cannot replace empathy. Again, quote in quote, this is the core of a health system, public health system, ethical judgments where we face day-to-day issues or on human accountability. But what AI can do is optimize decision making, reduce cognitive load, improve early detection, and extends expert support to the last mile if it is used wisely. The danger lies not in using AI, but it is overestimating it. So we need to have human understanding along with that. So the future challenges which we think we have to look forward from the past experiences, since the new disease patterns are rising, like non-communicable diseases, this will be dominating the morbidity and the mortality in the future. Cancer will demand early detection and continuum of care. An aging population, which is approximately, as per the latest data, is approximately 36% of our population will be aging in 2030, will strain long-term care systems, mental health issues. It's going to rise, fueled by the social isolation and the economic stress because of the fragmented families, increased screen time on the phones and on laptops, sedentary lifestyles. These are going to redefine the risk-based patterns of the health in the future. So we need to use AI in this context. These challenges require a longitudinal data, predictive analytics, and integrated care pathways. Areas where AI can provide meaningful support, but only when it is embedded with a strong public health system. So we cannot replace a strong public health system with the AI. Just it can be complementary to each other. Are we really ready to use AI in healthcare with respect to India, as well as can be the future forerunners for others? Yes, definitely there is a positive note. We have a vast digital public infrastructure, large health databases, especially with respect to UP. I will say that we have a beautiful systems of data collection using an e-coverage, which is the biggest in India. The huge data with us on different aspects. And the ABHA ID's basic enumeration has been done based using this only, and we have covered almost 20 crore plus enumerated population with us. Approximately 14 crore ABHA IDs created with that. So that we have a large database, a strong technology ecosystem is growing, and a growing policy clarity. But we'll need again the data quality and interoperability and capacity building of our health workers. Trust and explainability is an issue because people are still thinking trust has to be created based on that and clear accountability. So the unforeseen problems with respect to the field workers and other things working in the health department, which we have felt is that data privacy is an issue and security breaches could be there. Algorithm bias is especially against marginalized population. Yesterday, my batchmate, Secretary Health of Bihar, was telling if there is a wrong input in the data, so it's going to give us a very wrong decision making in an altogether different trajectory. Over reliance on an automated recommendations, the skilling of health workers if systems are poorly designed, the absence of human oversight, it can turn AI from an asset to a liability. So this is a core thing which we need to see. So we can use it as a servant, not as a master. We should use it very judiciously because health is a very personal and a very private sector. Or dealing with the individual dignity, actually, if we have to see, it's not the road or any other sector. In health, the dignity of an individual human being is at stake if it is going in a wrong direction. So this brings me to the central principle. I think we can just think of AI must remain as a servant, not a master, an enabler, not a replacement, a decision-making support tool, and not a decision maker. The goal is not to reduce human presence in healthcare, but to free human capacity for what matters the most. That is what is clinical judgment, compassion, and community engagement. If AI helps my ASHAs and CHOs and ANMs to identify the risks earlier at their doorsteps and help a doctor to try it better, or a health system allocates the resources more efficiently and equitably than it has served its purpose, it is going to serve purpose for us. The real question before us would not whether we should use AI in the healthcare or not, because we can't miss the bus. This is the future. So sooner we learn, better it is for us and for our country. With having such a huge workforce, intelligent, skilled workforce, we can be the next leader in the AI in globally. And the example is it's already set. India is hosting the next global meet in February. So it is an insignia of, or it's an acceptance that we are going to be the true leaders in the world in future. But importance is but how responsibly, how equitably, and how humanely we chose to do it. This panel will bring, I wish and I hope this panel will bring together the policy leaders, technologists, clinicians, and implementers, and I look forward for a candid discussion that, that will lead to move forward from pilots to platforms, scalable platforms, and from innovations to the impact. I still remember there is the future of AI could be. I don't know how many of you have watched the Robo movie of Rajnikant from Tamil Nadu. Have you watched it? Nobody. Okay. So what happens at the end? The robber Rajnikant, he falls in love with Aishwarya. Huh? So how can a machine fall in love? So that is the future of AI. That is the empathy. If we could create an empathetic robot, that will be an asset to the health system, the public health system of India, across India, as well as if we could research and develop that kind of a thing, then definitely that will be a real utilization of AI for the larger interest of the humanity across the world. Thank you all.
Thank you, ma'am. You raised some very relevant questions. Now I request Dr. Pinky Jewel to please steer the session ahead. Ma'am.
Uttar Pradesh, welcome to all your panelists. So my first question goes to Professor R.K. Pinky, the head of the Department of Telemedicine and Digital Health and Emergency Medicine, UPG of Lucknow, Senior Institute for Pradesh and University, Dr. Mohammed. So we would want to know from you that, from your perspective, what are the most critical gaps in India's healthcare today that AI can uniquely position for us?
Thank you, ma'am, for the kind keynote address that you gave, and you reminded us about the robo. Um, I congratulate the Uttar Pradesh government and the Department of Medical Health and Medical Education for organizing this sensitizing platform for AI in health innovation and conference. So my two words at the start would be AI is not magic, AI is not evil, AI will not take away your jobs, but people who know AI will take away your jobs. So the first thing is know about AI. Ride this horse, don't be afraid of this horse. So with that context, I would put it, there is a lot of scientific basis behind what we are doing. Humans have created it. We must master it. We must not be afraid of it. It will not take away your jobs. Again, I tell you, people who know AI will take away your jobs. Not AI itself will take away your jobs. So learn AI, be knowledgeable about it, no hype, not magic, not in evil. Now, coming to ma'am's question as to what are the critical areas in which AI can help us. So there are a huge number of areas. If I keep counting, there could be around 20 or 30 areas in healthcare where AI could help. I believe in the audience, how many of you are doctors? Can you just raise your hands? Okay, so a lot of my fraternity is there. So I will talk in terms of what AI can do for you. So there is doctor-patient shortage. This is the maximum area where things are going to work. Doctors are less in number. The WHO says the ratio has to be for 1,000 people, one. But go to rural India, this ratio will be 6,000 patients to one doctor. So AI can help you bridge this gap. So doctor-patient ratio, yes, AI can help you. Second is specialist shortage. We have CHCs, we have PHCs, we have the district hospitals, we have medical colleges, surgeon shortage, neurologist shortage, cardiologist shortage, physician shortage, ICU intensivist shortage, radiologist shortage, pathologist shortage. Can AI help me? Yes, AI can help in leveraging technology to bridge the gap between what is desired from a radiologist. The AI can help you bridge this element. So this is second element. Third, madam pointed out about the diagnostic delays that are happening. So diagnostic delays are primarily happening because these trained people are not there at the point. So a CT reporting time may be from 1 day to 3 days. An MRI reporting time may be from 2 days to 5 days, even in the best of centers. AI can do this in 1 minute to 3 minutes from a normal CT to an abnormal CT. So radiologist is not there, AI can help you sort it out. But AI will not diagnose the entire spectrum of abnormalities. You need the human in the loop to make sure that things are done in the right way. So this is another element. Pathologist is not there. You have a slide. So AI enabled whole slide imaging analytics. They are very, very good in diagnosing. The field of vision, computer vision has evolved massively. So what my eye see or what a trained radiologist eye sees, an AI enabled vision analyzer can see 1,000 times better. 1,000 times better. And therefore in diagnostics, you see AI is rocketing. Majority diagnostic areas AI is rocketing because computer vision has got machine learning, it has got deep learning, and even further generative learning. So a lot of advancements you see in radiology segment is coming. So we can take advantage of these segments to bridge the time of delay that is happening in MRI diagnosis, CT diagnosis, X-ray diagnosis, ultrasound diagnosis. So huge area where diagnostic delays can be reduced. Madam pointed out about the non-communicable disease. Almost 70% of deaths in India may be contributed by non-communicable disease. Diabetes, 15% Indians. Hypertensive, nearly 20%, 25% Indians are hypertensive. Cardiovascular disease, there are huge lot of burden in the non-communicable disease. So can I risk stratify? There are less number of doctors, more number of patients. So can AI help me risk stratify them? Can identify them? So AI will help me in risk stratifying, and I will know from thousands of patients that these 100 patients are at the highest risk. So AI can help me identify those highest risk diabetics, highest risk hypertensive, highest risk stroke patients, highest risk coronary artery disease patients. So AI can help you there in identifying these high risk patients from amongst all those patients. So it helps you. Mental illness, madam pointed out. The ratio for psychiatrists per 1 lakh population is 3 as per WHO. What is the ratio in India? 0.75. So there are only 0.75 psychiatrists per 1 lakh Indians. So how are you going to meet this challenge of shortage of psychiatrists? Mental illness is rising. So telemanas, tele-AI, tele-psychiatry, impregnated with AI. So the smartphone that the person has, when you talk to it, when you take an image, your behavioral patterns, they can all be recognized. Even a diagnosis can be made. A prescription can be automated. It can be then connected to a trained psychiatrist who can guide you through the stream. You can follow it up. So your smartphone is doing everything for you. Almost most Indians have smartphone, if I'm not wrong. Most Indians. So there is technology at hand. You need to have edge computing into this, that is diagnostic elements into this within the app. So even if the internet is not available at a particular site, the app itself can help you sort out, can triage, can do all this thing. And then when the syncing happens, when the internet facility is available, you can consult a psychiatrist at a higher center or a tele center at a higher center. So these are ways it can help you. ED overcrowding, emergencies are overcrowded, less nurses, less doctors, huge number of patients. Somebody in the queue, the 100th patient is having an MI, the upfront nurses or the doctors don't know that this 100 patient is having an MI while he's waiting for to be seen. So how can AI help you sort this mess out? So it can help you triage, it can help you identify. So the CCTVs and the cameras itself can help you identify patients. This is a sicker patient. They can analyze your facial behavior. They can analyze your pain. They can, just like you go to an airport, a narcotic, somebody carrying a narcotic has behavioral patterns. So similarly, in an ED, if you have, you can identify patients who are more in distress. They can be sorted out. They can be pulled up from the queue and brought up front. So these are all technologies that are happening, and AI definitely can help. Madam talked of maternal and child health, preemptive counseling, preemptive detection of eclampsia by AI-enabled, ASHA worker-enabled apps, which are who are going to a female. They can analyze the blood pressure, they can analyze the scoring systems, they can consult a gynecologist. The detection rate is, you can identify preeclampsia at 15th week. It is so early. So a lot of things are happening. I think in West Bengal, Grahini app, if I'm not wrong, these are helping. In Kerala, they have apps for this. So they have empowered their ASHA workers to do all these work. So that you can pick up these earlier and help reduce the maternal mortality. If compared it to Kerala, the maternal mortality in UP is, yes, we need to be below 100 at least because target. If you compare it to Kerala, we are way, way behind. So the best is Kerala. So how are you going to bridge this gap? So bring in the AI technology, enable your ASHA workers to bring these patients earlier, have institutional delivery. All these things are important for reduction of maternal mortality. Prime Minister, Honorable Prime Minister just talked about antimicrobial resistance. How are you going to reduce antimicrobial resistance with AI enablement? Yes, you can do it. All your labs, you know the disease patterns that are happening in a particular clinic, in a particular hospital, the microbiology, all that is enabled on a digital. So you may know where the disease outbreaks are happening, what is the disease antimicrobial approach to it. You can have an assimilated package to understand the antimicrobial resistance and you can act preemptively to reduce this. Okay, because this is going to be a huge and massive problem in the years to come. Other elements, we are having siloed EHR. Our EHRs are not connected. First, they are not there. So PSCs don't have EHRs. CHCs don't have. District hospitals don't have. Medical colleges don't have. There's probably some institutes which have got EHRs. These EHRs are again not Aadhaar, and
Even the EHR business is just 30% is digitized, 70% is still on paper. Unless the EHRs are fully digitized and we are going on to the computers for entering of all this data, it will be a huge task for AI to review this. So there is a huge amount of task to be done. Two more elements I will touch. Drug supply chain. AI can help. Material management. Remember, in any hospital or any clinic, you have more number of equipment than the staff is having. This the equipment is sick. We don't know when was it bought, what was the warranty period expired, what was the CMC, how many times it has been serviced. So there are AI platforms for material management which will send out alert that this device is faulty, it needs to be repaired in a correct time. So this is AI enabled material management which is coming offline to all the medical colleges and the district hospitals. How to better the material management aspect. So this is a huge area where AI can help you. I think I enumerated a lot of areas.
So, sir, definitely. So, Sanjay, from your point of view and topic, the suggestion that you have given to us. Marji, Director General, Software Engineering Labs of India. Sir, I take so how do can this IAS contribution to improving public university and Ayushman Bharat
Good morning. It's really very privileged to be part of this very interesting gathering. When the event is organized by UP government, it always gets a scale, very high scale event. Uh, in fact, we see today AI. Uh, we look AI as a uh, third big revolution in the history. First revolution, we always say it is in terms of electricity. If electricity could not have been invented, whatever development happened in 100 years, it could have happened in the 500. Electricity has increased so many things, improved the quality of life, productivity. So second revolution came in terms of invented. It could have taken around 50 years, which has happened in last 10 years. Third is AI. Internet has done more on information asymmetry, furthermore on financial sector. If you look last 5 to 7 years, I think we have done big revolution in the financial sector, either in terms of ESPN or in terms of UPI. Now, third revolution, which is coming in the form of AI, it covers entirely different sectors, and those sectors which has not been done by either power or by electricity. It is going to touch those sectors like maybe for assistive technology, maybe for health, because every new technology comes, it increases some efficiency of the humankind, quality of life, and some efficiency like when the internet, mobile came, it has increases uh, anatomy of my palm. Now your hand is not a fitness. Now this AI will increase capability of existing doctors, paramedical forces, machines which are used for diagnosis and all. Today, there's a lot of gap when it comes to healthcare sector in terms of demand and supply. I think AI is well fitted uh, for, for fulfilling this kind of the gap. In India, we are producing 1.8 lakhs doctors per year. But as per one of the report of WHO says we need maybe 24 lakhs more doctors by 2030. This gap, I think AI is well suited. Only problem with AI is, as of now, is that in India we don't have much structured, systematic data of medical reports, health system, and this data has to be structured and should be made available at earliest possible. And I think Ayushman Bharat is doing a lot of things in this direction. The only thing people have to understand is data, how the Ayushman Bharat or any entity which is storing it, how it is anonymized, and how it can be better use of future of our generation and for themselves also, instead of looking at only that privacy concern, that concern, just look into the privacy concern. But that data has to be shared because we are looking like uh, when we created digital public infrastructure, it has become an example for the world. Similarly, today we need uh, an inclusive, intelligent, and Indian-led healthcare system, and it could become only Indian-led healthcare system if we have the Indian data. And India has a very specific problem. India and corresponding some developing countries, and this all the AI must understand that all the AI tools should be trained by Indian data. If they are trained by Western data, it will give a entirely wrong results to us. And therefore, our startups, everybody should work that how to collect our data, how to process it at the earliest possible. Once all AI tools are available, which is trained by Western countries or any other country, this all results will be solutions should be lie in ourselves. We have a lot of capability. We have developed a lot of capability in AI. Government of India, including Uttar Pradesh government, we are having a lot of schemes, lot of facilities with AI. AI mission is already supporting. Is the budget of more than 10,000 crore, which is supporting all types of the AI, whether it is vertical integration, whether it is wrappers, whether infrastructure. Government of India is providing GPU support. These such support should be extended by all state government. I think with these supports, the new AI system, new AI trained tool, new LLM which is trained in the country, we can create a very world class AI tools by the way. Thank you.
So the doctors can easily pick the medications from the suggestions which show up through AI for the doctors. And we are finally making an attempt to also help doctors by by providing them generative AI or by using NLM or generative AI, wherein when the doctor speaks with the patient, understands the ailment, AI would on its own create the whole prescription out of the dialogue that happens between the doctor and the patient. So these kind of interventions can not only empower frontline health workers, but
also aid quicker decision making on the doctor's end.
for the doctor. Ask relevant questions, see the patient, and enter the whole data into it and then prescribe it. And sometimes there is an issue when what doctors write even only from the chemist can read it. So I think thanks a lot, Ji. And this I take opportunity to request Professor Sriram Gandhi. Professor Department of Engineering, Indian Institute of Science, Bangalore. How can AI be leveraged for continuous medical education, clinical decision support, and skill upgradation of the healthcare workforce? Means the medical education is the core because we need doctors, we need specialists, we need super specialists, we need trained paramedical staff. So how it can transform our medical education system in the future? So we would like to
Good morning, everyone. Thank you for having me here, Dr. Pinky, and the whole set of organizers behind this successful UPAI and Health Conference. So I also would like a short introduction to say that I also co-lead the AI Center of Excellence in Health, recently awarded by the Government of India Ministry of Education and Health coming together. We are co-located at the Indian Institute of Science, and we call ourselves TANU, which stands for Translational AI for Network Universal Healthcare. So before I go directly to answer the question, so I want to follow the lead that Professor R.K. Singh did. I also want to ask the audience, how many of you are engineers here? Raise of hands. Software professionals. Yes, I see some of you. Any deep tech startup professionals here? Yes, we see some of them. And policymakers, quite a bit of policymakers that are still shy to raise their hands. So what I wanted to say or bring to this point is that AI for health primarily is a highly interdisciplinary area where lots of these people have to come together, come from policy makers, from medical professionals, software engineers, AI developers, engineers, and then all the way to social health workers, and last but not least, patients who are really the consumers of these products. So this real multidisciplinary conglomeration has to come together for making any of these AI solutions to bear for what the promises they provide. So coming to the question that ma'am had raised in terms of medical education and education in general. So there has been a thought even at our university, like the Institute of Science, that pretty much anybody coming in, even for the bachelor's program, should go through an introduction to AI. So this basically introduces at least the bare concepts of what AI can do, what AI can't do, and where essentially the current state of things are. And of course, it's a very evolving field which requires solutions every 2 months or years. But an AI curriculum, at least a basic AI introduction program, could be one of the first starting points in curriculum of various studies, just like we introduce undergraduate mathematics or physics, chemistry, and so forth in medical education sector. So in addition to that, like, particularly when it comes to AI for medical healthcare settings, I would also suggest having courses and topics related to regulation, to data protection, privacy, to safety, to understanding, let us say, the limitations of AI, to know when they hallucinate, when they start providing results that are too fluent to be thought of as unreal or thought of as fake. That many of the current AI models, I also draw from my own experience in Google DeepMind, where we're working towards building models like Gemini. Models that you see out there are extremely tuned to fluency. They care about being very nicely sounding, but hiding the lack of substance, hiding the lack of ability to be factual. So, so models are optimized for fluency. Models are optimized to predict the next word or next patch in your image and so forth. So this optimization automatically means that everything that comes out of them is designed to look nice. So now when you start using them for various use cases that are not their domain, not their cup of tea, not the area, the data that was used to train them, they are going to misbehave. And many times they hide them in the plain sight, which means that it is hard to figure out when models are missing some things. So knowing these guardrails, knowing, understanding where the limitations are, I would strongly encourage the policymakers to think about medical education, understanding limitations of AI along with the hype that AI comes with. So coming to, let's say, the other question that ma'am asked, if you look at where AI can make an impact, my thoughts once again on this is a layered introduction, figuring out exactly the focus where AI can change. There are lots of things that many of my panelists mentioned. I also agree with most of them, if not all of them, on the AI impact. But knowing exactly the focus where AI can make an impact, trying to introduce them in those layers in a human in the loop along with the AI, so that the AI is not completely autonomous. It's more like a co-pilot than an autopilot. So these are, let us say, situations where AI can make an inroad in the system. So while we made a lot of hype actually to the journals and studies, not only from India but from the West even, to look at AI funding in healthcare, and if you ask these publications, they say that it's almost remained flat. The reason being, while AI has produced lots of innovations in the last year, AI for healthcare has not taken that, primarily because the lack of focus, primarily because the lack of uncertainty and calibration in this, and also the bar that we keep in healthcare that is much higher than for general public commercial use cases. So keeping all these in mind, we can integrate is something that I would also recommend. Thank you.
Different perspective you have given to all. A special kind of a scientist from Bangalore. I request Dr. Sujoy Khalsa, Chief Medical Information Officer and the Vice President of Apollo Hospital. Well, sir, in what way can AI-based tools support the task shifting, enabling our nurses and marketers and mid-level providers to give higher quality care? Because the care is being provided, quality is getting enrobed into it slowly with quad certification, state level quality certifications, more of monitoring. But how to transform it to higher quality care?
Thank you. Namaskar. बहुत ठंड है, so I spice it up. And the reason why I spice it up is because I'll take it from Professor at ISC, and he asked how many startups are there, how many engineers are there. I'll start up by asking how many ASHA workers are there, and how many people who supervise ASHA workers are here. The question that we need to ask, of course, I'm not talking about people who are at least 4 levels up and looking at supervising ASHA worker. I'm talking about immediate supervisor. And why they need to be here in the room is because of the fact that whatever we heard about the capability of AI, and I go around the world, work with several universities with more than 50 research, 20 AI APIs that are now being circulated across the world, including Latin America, Southeast Asia, Australia. I could name any country that we are providing. So the question is not about that India doesn't have good data. India has. And the other, particularly clinical data. And models are now being built in India that are being used or made in India and are used across the world. So those are practically going to be hygiene. I want to give you an example here from China, 2019, 20 days before the COVID outbreak. I was in Beijing
working for World Economic Forum. And there was a speech made by the chief data officer of Chinese government. 2019, before COVID, they had the data around just X-ray data of 50% of Chinese population in the repository that they made through Philips and Tencent. So we would have to understand that people across the world are moving leaps and bounds with the collection of data, building AI tools, and taking it to public health. Now, coming back to the ASHA workers, I always answer these questions when I teach my students. In fact, yesterday I was doing that in IIM Calcutta. We talked about four very important perspectives around this. One is the capability. And the capability is not just about how you bring cloud computing, how you build softwares, how do you build those APIs. In fact, if you go and ask your workers at this point of time and ask the kind of tools they are overwhelmed by tools at this point of time. What is the kind of platforms that you are bringing in where they say that you use the most appropriate tool at that point of time? And you know what? When you build technology and get it at that point of time, they talk about the pani se adu or yini chalega cholbena. The saying is across the country that these tools are not going to work. So having them inside the room when you design this tool is a very important perspective that we need to do. That's number one. Number two, we talk about a lot around the compute. How do you make those compute take to the last mile? And I work with Microsoft, I work very closely with GCP, and now beginning to do with AWS as well. The question then to the big tech is this, that how do you enable those compute power at the last mile? And then you work with the cognitive things. I mean, what are we expecting our ASHA or A&M workers to do? Have we scoped it? Have we skilled it? Have we put in a competency map for them to say that they are able to use this? One of the other things that comes in very naturally to this is to use tools like ambient listening. Have we looked at those kind of ambient listening with translation abilities to see that it is an ease of use for them? Because other background tools always work, whether it is, you are summarizing descriptions or making recommendations and clinical decision support. And I have a view on clinical decision support because everything is not right about clinical decision support in that. So look at this: capability, compute, the cognition of the individual who is using it. Because the success from a healthcare perspective will only come if you are able to take the compute and cognition together to deliver it. And the last one is the collaboration. And the collaboration is internal collaboration, external collaboration, and collaboration to look at it from what impact it brings. Today, we build certain tools for CKD, CVD, chronic liver disease, which is now getting embedded in Siemens machines. What we found out is that for the millions of people who have used this prospectively, there are gains that people are getting into all of these by looking at it from admissions from the others. So yes, it is powerful, it is impactful, it is working. But how do you collaborate it to take it to people, to different countries across the world, and how do you go about in doing that? Lastly, I wanted to add by saying, if there is a requirement around skilling of these people, that's where institutions like Apollo can come in, help the people who would like to skill them up, understand what is required as per their scoping, and get all of this done. So my understanding, to summarize, is that we need to provide people with the right tool for the right time and to ensure that it brings it back over the period of time. Thank you.
God, well taken. So I take it forward to Colonel Samir Kamarji, Director Digital Health and AI Park. So it's an extension of the same question. How can we ensure that the frontline workers, especially the rural and remote areas, are adequately trained and confident, making them confident in using AI in these systems? So requirement is sure, but how can we do it? That's the next thing.
Thanks for the question, ma'am. And I'll continue the tradition which has been established in the panel. I'll ask the audience the first question. How many of you have heard about ChatGPT? Fantastic. How many are using ChatGPT? Fantastic. How many of you are professionally using ChatGPT? Fantastic. Did anybody come and teach you ChatGPT? Anyone of you? How did you learn? It was filling a gap which you had, right? It was intuitive. There was no teaching which was required. There was no tutorials which were required. And even if they were required, you were more than willing to invest that amount of money and effort to learn it, right? Because it was solving a problem for you, right? And that's exactly the way we need to handle the health workforce, right? I have worked extensively with Anganwadis as well as with Ashas. I have never found a problem in terms of skilling or in terms of intent or in terms of being able to learn and pick up technology, which includes UP, by the way. So this is where I actually started learning about public health just about 4 years back, right? When I left the UP. So I've learned quite a bit from this state and done quite a few of those things which I think the state is extremely proud of today in terms of delivering on digital health. Now, I think there are three issues which I want to address. And to answer your questions, in one line, there is no skilling which is required. Because if skilling is required, then probably we are using and developing the tools the wrong way. And ma'am, you answered, you made a very pertinent statement in your opening remarks, and I noted it down actually, was that AI needs to be an invisible enabler and not a visible, uh, you said, burden. Right? Fantastic. Now that's been the story for digital health as is in public health, right? Because our systems are not designed like what Joy mentioned by keeping, what we call known as the human-centered design, keeping the person for whom it is being designed in the center and design it according to their requirements. Solve their problems, make that tool a job aid for them. They should be jumping and picking up their smartphone because they know it's going to solve my life. It is going to solve my professional problems, right? Nobody came to us to teach us Paytm. Did anybody come and teach us Paytm or a UPI? Everybody in this country today is using that system. If you just go back to a report, of the digital journey in India, 2008 we were the most unbanked country in the world. 2019 we were the most banked country in the world. 9 years. And the report says it would have taken India 47 years had it not done what it had done in the space of DPIs to do what they did in 9 years. Right? We do the maximum number of digital transactions today in the world. We have the cheapest internet. We have 1 billion smartphones. 80% of Indian families have a smartphone at least. Right. So we have everything in place. We have everything in place. The issue is, are we designing the applications for the person who's going to use them? A, right. Are we trusting that person to be able to use that technology and not making it a monitoring tool, right? Unfortunately, all our digital systems are based on data entry, data capture. The data is never used by anyone in the system, right? So the data which is being captured needs to be used by the person who's capturing the data. If it is of no use to the person who's capturing, is never going to capture it the way you want it to be captured, right? So the system design is extremely, extremely important. The second most important aspect is the mindset change. Right? The entire mindset, human mindset, when we work in the public health space, needs to change to be able to adopt technology. It is not a monitoring tool. It is a job aid. It is meant to help you perform your job better. It should not be used by the supervisory staff for monitoring the person who's actually capturing the data. That's where we go wrong, right? And that's why the reason people do not adopt technology. Right? They are scared of it. They will throw it out. Oh shit, I am going to get monitored. My attendance is going to be taken. Somebody is going to question me. So I think there has to be a mindset change for people to be able to adopt this technology. We have adopted the technology. We have enough number of examples in other sectors, right? Of adoption of technology, and it has been adopted just primarily because we were able to position that technology at that junction, which was actually solving a problem for that individual. And the last point I want to make is that AI is fashionable today. Are you using AI? You're not using AI? Probably you are outdated. I think what we need to do at the planning stage is to align what is that problem which we want to solve, and does AI have the capability to be able to solve that problem or not, rather than just trying to push technology down to that end user, right? To say, oh, I have an AI, start using AI. No, because we've been told to use AI. We are on the AI mission. right? We have an India AI mission and we have a mission, and therefore we need to use AI. That's now how it needs to be pushed down. It needs to be pushed down to solve a problem for that person for whom you develop that technology. And unless and until that happens, we will keep having these debates year over year. And probably, health sector, unfortunately, is the last sector in this country which has actually picked up technology. Unfortunately, whatever we learned in COVID, unfortunately, we unlearned that very quickly and went back to the same system which we were using before COVID. I think unless and until we change the policy mindset, we change the mindset of the supervisory staff, of the mid-level leadership, of the higher level leadership to be able to absorb and push technology in a manner which is positive in nature for the end user, we will not be able to solve this problem which we are wanting to in terms of doing courses and skill development. It does not require any skill development, right? You use your TV remote, it is equally complex and probably more complex than using AI. We are still using it because we want to use it. So I think unless and until we go into that space, we will not be able to solve this problem.
I have a rebuttal. I have a rebuttal, and I'll say, I agree to most of the things that he said. But one thing that we need to look at, particularly in the account of medical decision support, and if you go back and look at, because I believe that most of you are clinician and you have access to Lancet, look at the Lancet's um, gastroenterology journal in October 2025. It says that overuse of AI is de-skilling healthcare workers. And if it begins to de-skill, that's a separate problem that we're now going to have, particularly in hands of, the tools in the hands of our ASHA workers or ALM workers in that way. So those designs are very important, how you bring it into healthcare force, particularly with the use of AI.
Thank you, Dr. Roy. So, since shortage of time and that another panel has to start, we just have a very quick round of one small short question and quick reply is expected. So, Professor R.K. Singh ji, how do you think that the follow-up care, the most important of all follow-up in the AI can be helpful?
Thank you for the question. Follow-up for geriatric patients, follow-up for our routine patients, follow-up for with the help of remote patient wearable devices is the way forward and it's going to come very big way. Follow-up through telemedicine technology, follow-up through virtual ICUs, chatbots, through Autobots. So these is all going to come in a big. I will again ask a big raise of hands of all the doctors who are present in the audience. Just one more time. All doctors, a lot of them. So I talk to you. You are overburdened with your work because of 70% of the time you are documenting something. So documentation is your majority workload. Rather than your expertise being used for clinical care, you're actually documenting. So AI is an enabler, can help you reduce that documentation. I've got 100 patients to be covered in 1 hour. I have practically less than a minute for a patient. Of that 70% time I'm documenting. So what is the amount of time I'm actually seeing the patient? 10 seconds, 15 seconds, 30 seconds. So my documentation workload must come down with AI. So for all those who are sitting with us, if you can enable our EHRs with reduction of my documentation, because EHR is making me a data entry operator. You have made me a typist. So enable me through NLP multi-language platforms that I don't have to document and again. So EHRs have to be enabled with this technology. This is for all the doctors who are working there and who will be flooded with AI tools in the coming times.
Okay. So one more last question. Right? Last question, sir. Arvind Kumarji, sir. How can the startups and the innovators can align their AI solutions with on-ground public health realities rather than just creating technologies? Because India has come up with expectations of the world having the startups and the new technologies in-house in.
Thank you. So, Samiraj asked how many people use the Chat GPT. I asked from Chat GPT how many people are using GPT for health-related problems. So it says, as per the some report of OpenAI, which is AI as a health ally, it says 40 million people are using on daily basis Chat GPT for their health-related problems. So just putting the numbers in the proper perspective. As far as the startup is concerned, we have more than 1.7 lakh startup in this country. More than 10,000 startups are working in the health domain. But what I have seen is that I have visited a couple of health tech startups, center of entrepreneurship, including IT Kanpur. We also run one called MedTech, then IT Jodhpur. And I found there are many startups which is working in the very common area. Matlab the problem statement is the same, and many of the cases solution is also the same. So there are many silos between startups. Out of 10,000, if you say what kind of how many number of the problems they are solving, they may be solving maybe not more than 3,000 problem. But there could be 3 million of the problem which could require to be solved. So I think there is a need to create a very large ecosystem of startups in this country. For health tech itself, uh, I don't impress, but when somebody says this startup has created some flying car, I'm only impressed when somebody says that startup has created something by which you can detect cancer early, you can solve some personalized problem of old age people, if you can reduce the drug discovery cycle. So these are the some basic problems which required to be solved by our startups. I think corporate and government should come together to help those startups. Uh, those can solve pressing problem of the country, especially focusing on our country. So thank you very much.
Thank you. So we would request somebody maybe from the audience side, if they have quick one or two questions because there's paucity of time because it's a session. Ah, okay, please. Fast.
Good morning to all. Sir, my name is Uday Kumar Sharma. I am from SIPSA. Sir, I have two very small questions. Sir, first, how can we develop AI in-house capabilities in analyzing the current data which is available to us? And second, sir, that as many health data is available in manufacturing websites, is there any time to come to develop a general API to access this data? Because today we are living in a data-driven world.
Sure. So this is a question, if I understand the question right, about the use of the current data resources that are available. So we ourselves are in the Transition AI Healthcare Center. We are trying to work with the NHA to unlock a lot of the data that is already there. But some of the key challenges I will try to highlight is many of these protocols have not been designed with an AI first thought. Like, we want a particular standardized way of formatting and getting data in. There are lots of missing pieces of data. So some of these particular parameters were not measured for some reason. So now you have a lot more complex modeling process that has to come in to take care of the data, to look over what has not been recorded, still come up with the decisions or the responses the doctors would have made for those patients. So yes, it is challenging, but there is a lot of opportunity also here that current modeling techniques can use some amount of missing data to take care.
Thank you.
Can I add them just the government of India has an initiative known as e-Kosh, which has been established, which is primarily meant at setting up databases for different sectors. So it's work in progress, and they intend opening up the APIs also for startups to be able to use that going forward. So it's a GPU being set up, it is e-Kosh being set up, and then giving access to data as well as GPUs. That's the plan.
Oh,
Uh, Thank you very much. This is Ajay Singh. I'm the Vice Chancellor of Survey Medical University. It's not a question, it's an observation from my side that when we are discussing the AI and the healthcare, and we should focus on the adoption of how efficiently it will will be adopted. And unless until we will not discuss the registry formation, means how many, not only about the types of diseases, but spectrum of the symptoms which are prevalent, because the description of symptom in our area is quite different from other areas. So spectrum of symptoms should also be integrated as far as when the AI we are talking. And as a policymaker, I think you must give emphasis on this aspect when we are discussing about the AI in future. Thank you.
Thank you. Last question. Madhuri ma'am, one lady. पीछे, जया पीछे. हाँ. At least one woman has to be represented.
Good morning, ma'am, and good morning to all the dignitaries on the dais. First and foremost, we would like to thank all of you for enlightening about all the advantages. So, as very rightly said, ChatGPT has helped us in many a things. But this is also just an observation, me being a medical college teacher for many students, that we need to align ourselves and we also need to train the students to get enlightened and also have academic and cognitive knowledge, try to be totally dependent on the AI tools, because sometimes, as every rose has its thorns, they also have some of their shortcomings, which we need to align with our knowledge. And as said, the human guidance is always needed before we let them fall into the hands of those who are not well trained. Thank you so much, ma'am.
Last, पीछे एक है, मैडम है, मैम जया उधर रेड साड़ी. पहले हाथ पर रखिए. हाँ हाँ उनको.
Thank you so much. I'm Dr. Madhvi Devraj. I work for the University of Manitoba and UPTSU. Sir, this question is to you, sir, Dr. K.P. Singh. Studies have shown that the postpartum depression in UP is roughly about 14%. Right, sir? A, the women do not even know they are suffering from postpartum depression. And second, you have actually mentioned that through the facial expressions, you can identify the women suffers from mental health issues or not. But the thing is, even if they know they are suffering from such a situation, they do not want to go to the psychiatrist. So it's actually a behavioral problem. So what is your opinion on how AI could be useful in changing the behavior?
This is the smartphone can help you decipher whether somebody is in having a depression by facial recognition, by behavioral recognition, by speech recognition. It can identify if a person is having suicide ideations, if it's having a depression, it can identify that much. Now, the family member is a part of the entire cascade when somebody is using it. So it is the onus will definitely lie with one of the family members, the husband persons. So he has to take in a call with either a telepsychiatry with an AI-enabled feature. So there has to be support within the system. Somebody is getting pregnant, getting postpartum depression. The family doesn't know this disconnect is not acceptable. So the family, the husband, somebody has to take onus for taking the consultations to that. Even if the patient is not doing it, the family member has to take the onus to go to a psychiatrist or consult a psychiatrist for taking adequate help. I can just say this much. AI can help you decipher something. AI can help you give us some sort of a prescription which needs to be vetted by a psychiatrist through a telepsychiatric consultation platform or through telepsychiatry plus AI-enabled platforms. So this much AI can help you. But physically, you will at least still have to go to a psychiatrist, the help of your husband, to that center to get the help around.
Thank you, Mr. Kissing. So I thank all the panelists and formally you will do that. Dr. Sujoy, I just wanted to add what you told that any Asha here. So we have an officer who monitors them here. We have got, and there is a YouTube link created yesterday on and has been circulated to all the districts till down where all the conversations are being saved, stored, and they can be watched later also. Thank you.
Uh, Thank you to our panelist and the moderator for sharing not just your expertise, but also your experience. Your contribution has enriched this forum. And as a token of our appreciation and gratitude, I'd like moderator to present the mementos to our panelists. Ma'am. Professor Sri Ram Ganpati, we'll start with. Professor R.K. Singh. Shri Arvind Kumar. Dr. Sanjay Sood. Colonel Samir Kanwar. Dr. Sujoy Kar. And it is my pleasure to present the memento to Dr. Pinky Joel. Thank you, everyone. Can we please come together for a group photograph? We'll break for tea now. The tea is being served on either side of the hall in the lawn. चाय की व्यवस्था इस हॉल के दोनों तरफ लॉन में है. प्लीज आप लोग एंड आप लोगों से अनुरोध है कि आप लोग चाय लेके जल्दी आ जाएं. एंड बिकॉज आफ्टर दिस टी ब्रेक वी विल हैव अ प्रेजेंटेशन बाय Mr. Brijesh Kumar Singh, Business Head Imaging, ISC Zone, Philips Digital Imaging. Just grab your tea and come back for the presentation by Philips Digital Imaging.
माननीय प्रधानमंत्री श्री नरेंद्र मोदी जी के विजन से शुरू हो रही है एक नेशन वाइड मूवमेंट जहां एआई सीखेगा हर भारतीय।
हमारे लिए AI सिर्फ एक टेक्नोलॉजी नहीं है, बल्कि भारत के युवाओं के लिए अवसरों का एक नया
All right, ladies and gentlemen, just wanted to announce and request you all to please go and have your tea and coffee. And I request you all to please get back after 15 minutes so that we can start with our next panel, where we have the esteemed dignitaries who will be joining us for the second panel discussion for today's event. So I request each one of you to please get back after 15 minutes. देखिए सज्जनों, आप सभी से निवेदन करना चाहूँगी कि टी एंड कॉफ़ी ब्रेक के बाद 15 मिनट के बाद हम वापस से इस कार्यक्रम की शुरुआत करेंगे और हम हमारे अगले पैनल डिस्कशन की शुरुआत करेंगे। मैं यहाँ उपस्थित सभी अतिथिगण से निवेदन करना चाहूँगी कि अगले 15 मिनट में वापस से इस कार्यक्रम में हमें हमारे साथ जुड़े। धन्यवाद। All right, ladies and gentlemen, this is a special announcement for all these esteemed speakers out here that for the speakers, we have arranged the tea and coffee at the Optimum Hall. It's downstairs nearby the reception at the registration area. So I request all the speakers to join us there, tea and coffee. देवियों सज्जनों यहाँ उपस्थित हमारे स्पीकर्स को मैं सूचित करना चाहूँगी कि सारे स्पीकर्स के लिए हमने टी और कॉफ़ी का इंतज़ाम ऑप्टिमम हॉल में किया है। मैं रिक्वेस्ट करूँगी यहाँ उपस्थित सभी स्पीकर्स को कि हमें जॉइन करें ऑप्टिमम हॉल में। धन्यवाद। Ground floor, I request all the speakers to join us to the ground floor for the tea and coffee. This is a special announcement for all the esteemed speakers out here. Thank you.
कौन सोच सकता था कैश के बिना पेमेंट हो जाएगी? कौन सोच सकता था एक टैप में पूरी दुनिया हाथ में आ जाएगी? इंडिया ने ये कर दिया। और अब नेक्स्ट बिग लीप एआई। पर एक सवाल है, एआई सिर्फ एक्सपर्ट्स के लिए, सिर्फ कोडर्स के लिए? बिल्कुल। माननीय प्रधानमंत्री श्री नरेंद्र मोदी जी के विजन से शुरू हो रही है एक नेशन वाइड मूवमेंट जहां एआई सीखेगा हर भारतीय।
हमारे लिए AI सिर्फ एक टेक्नोलॉजी नहीं है, बल्कि भारत के युवाओं के लिए अवसरों का एक नया द्वार। भारत ने इंडिया AI मिशन शुरू किया। भारत हर सेक्टर में AI का उपयोग बढ़ा रहा है। हम दुनिया को भी बेहतर AI सॉल्यूशन देने में जुटे हैं।
बच्चे, युवा, प्रोफेशनल, हर शहर, हर गांव। इस मिशन का पहला स्टेप है युवा एआई फॉर ऑल। सिर्फ 4 घंटे का कोर्स, सिंपल, प्रैक्टिकल, पावरफुल। सीखिए एआई क्या है, कैसे काम करता है और कैसे एआई को रिस्पॉन्सिबली यूज करके अपनी पढ़ाई, काम और आइडियाज को नेक्स्ट लेवल ले जा सकते। सब कुछ बिल्कुल घर बैठे। कोर्स कंप्लीट करें और पाएं गवर्नमेंट ऑफ इंडिया का सर्टिफिकेट। लाखों इंडियंस को एआई रेडी बनाने का काम। हाँ, इस फ्यूचर का हिस्सा बनना ऑप्शनल नहीं है। इस फ्यूचर को शेप करना अब आपके हाथ में है। अभी एनरोल करें युवा एआई फॉर ऑल फ्यूचर स्किल्स प्राइम.इन क्यूआर कोड स्कैन करें और एआई के साथ विकसित भारत के सपने में सीखिए, सोचिए, बनाइए एआई के साथ। जय हिंद। कौन सोच सकता था कैश के बिना पेमेंट हो जाएगा? कौन सोच सकता था एक टैप में पूरी दुनिया हाथ में आ जाएगी? इंडिया ने ये कर दिया। और अब एआई सिर्फ एक्सपर्ट्स के लिए, सिर्फ कोडर्स के लिए? बिल्कुल। माननीय प्रधानमंत्री श्री नरेंद्र मोदी जी के विजन से शुरू हो रही है एक नेशन वाइड मूवमेंट जहां एआई सीखेगा हर भारतीय।
हमारे लिए एआई सिर्फ एक टेक्नोलॉजी नहीं है, बल्कि भारत के युवाओं के लिए अवसरों का एक नया द्वार। भारत में इंडिया एआई मिशन शुरू हुआ। भारत हर सेक्टर में एआई का उपयोग बढ़ा रहा है। हम दुनिया को भी बेहतर एआई सॉल्यूशन देने में जुटे हैं।
बच्चे, युवा, प्रोफेशनल, हर शहर, हर गांव। इस मिशन का पहला स्टेप है युवा एआई फॉर ऑल। सिर्फ 4 घंटे का कोर्स, सिंपल, प्रैक्टिकल, पावरफुल। सीखिए एआई क्या है, कैसे काम करता है और कैसे एआई को रिस्पॉन्सिबली यूज करके अपनी पढ़ाई, काम और आइडियाज को नेक्स्ट लेवल ले जा सकते हैं। सब कुछ बिल्कुल फ्री, घर बैठे। कोर्स कंप्लीट करें और पाएं गवर्नमेंट ऑफ इंडिया का सर्टिफिकेट। लाखों इंडियंस को एआई रेडी बनाने का टारगेट है। हाँ, इस फ्यूचर का हिस्सा बनना ऑप्शनल नहीं है। इस फ्यूचर को शेप करना अब आपके हाथ में है। अभी एनरोल करें युवा एआई फॉर ऑल फ्यूचर स्किल्स प्राइम डॉट इन क्यूआर कोड स्कैनर और एआई के साथ विकसित भारत के सफर में जुड़िए। सीखिए, सोचिए, बनाइए एआई के साथ। जय हिंद। कौन सोच सकता था कैश के बिना पेमेंट हो जाएगा? कौन सोच सकता था एक टैप में पूरी दुनिया हाथ में आ जाएगी? इंडिया ने ये कर दिया। अब नेक्स्ट बिग इवेंट एआई। हर एक सवाल एआई सिर्फ एक्सपर्ट्स के लिए, सिर्फ कोडर्स के लिए? बिल्कुल। माननीय प्रधानमंत्री श्री नरेंद्र मोदी जी के विजन से शुरू हो रही है एक नेशन वाइड मूवमेंट जहां एआई सीखेगा हर भारतीय।
हमारे लिए एआई सिर्फ एक टेक्नोलॉजी नहीं है, बल्कि भारत के युवाओं के लिए अवसरों का एक नया द्वार। भारत में इंडिया एआई मिशन शुरू हुआ। भारत हर सेक्टर में एआई का उपयोग बढ़ा रहा है। हम दुनिया को भी बेहतर एआई सॉल्यूशन देने में जुटे हैं।
बच्चे, युवा, प्रोफेशनल, हर शहर, हर गांव। इस मिशन का पहला स्टेप है युवा एआई फॉर ऑल। सिर्फ 4 घंटे का कोर्स, सिंपल, प्रैक्टिकल, पावरफुल। सीखिए एआई क्या है, कैसे काम करता है और कैसे एआई को रिस्पॉन्सिबली यूज करके अपनी पढ़ाई, काम और आइडियाज को नेक्स्ट लेवल ले जा सकते हैं। सब कुछ बिल्कुल फ्री, घर बैठे। कोर्स कंप्लीट करें और पाएं गवर्नमेंट ऑफ इंडिया का सर्टिफिकेट। लाखों इंडियंस को एआई रेडी बनाने का टारगेट है। हाँ, इस फ्यूचर का हिस्सा बनना ऑप्शनल नहीं है। इस फ्यूचर को शेप करना अब आपके हाथ में है। अभी एनरोल करें युवा एआई फॉर ऑल फ्यूचर स्किल्स प्राइम डॉट इन क्यूआर कोड स्कैनर और एआई के साथ विकसित भारत के सफर में जुड़ जाए। सीखिए, सोचिए, बनाइए। कौन सोच सकता था कैश के बिना पेमेंट हो जाएगा? कौन सोच सकता था एक टैप में पूरी दुनिया हाथ में आ जाएगी? इंडिया ने ये कर दिया है। अब नेक्स्ट बिग इवेंट एआई। हर एक सवाल एआई सिर्फ एक्सपर्ट्स के लिए, सिर्फ कोडर्स के लिए? बिल्कुल। माननीय प्रधानमंत्री श्री नरेंद्र मोदी जी के विजन से शुरू हो रही है एक नेशन जहां एआई सीखेगा हर भारतीय।
हमारे लिए एआई सिर्फ एक टेक्नोलॉजी नहीं है, बल्कि भारत के युवाओं के भारत में इंडिया एआई मिशन शुरू हुआ। भारत हर सेक्टर में एआई का
क्या है, कैसे काम करता है और कैसे एआई को रिस्पॉन्सिबली यूज करके अपनी पढ़ाई, काम और आइडियाज को नेक्स्ट लेवल पे जाए। सब कुछ कोर्स कंप्लीट करें और मानो लाखों इंडिया अभी अपलोड एआई फॉर ऑल और एआई के साथ
फोटो खींच देना एक दो, जो फिर हम लोग बाद में वो पीआईसी का ये बोल रही है, उसके लिए बोल रहा हूँ। तो पीआईसी का कम्युनिकेशन को बोल दिया उसने, तो हमें कुछ 2-3 अच्छे फोटो डालने होंगे, क्योंकि उसने कम्युनिकेशन टीम को बोल दिया है एक क्रिएट करने के लिए। वो आपका यूटी वाला ही भेज देना है। यूपी इंडिया का मोस्ट पॉपुलर स्टेट है, राइट?
4 घंटे का कोर्स सिंपल प्रैक्टिकल एआई क्या है, कैसे काम करता है और कैसे एआई को रिस्पॉन्सिबली यूज करके अपनी पढ़ाई और आइडियाज को सब कुछ बिल्कुल घर में कोर्स कंप्लीट करें और पानी लेवल पर इंडिया का लाखों इंडिया
सर बॉम्बे के आसपास हो जाए, मतलब 4-5 करोड़ हो गए।
इस फ्यूचर को शेप करना।
हाँ, तो मतलब बॉम्बे के आसपास हो गया ना।
हेल्थ केयर हो, एजुकेशन हो,
6.1 मिलियन।
भारत भर से
हाँ,
एआई का उपयोग बढ़ा रहा है।
60 लाख। मुंबई है 2 करोड़।
अगर उत्तर प्रदेश की मैं बात करता हूँ, पिछले 8-8.5 वर्ष में हम लोगों ने उत्तर प्रदेश में 42 नए मेडिकल कॉलेजेस बनाए, 2 एम्स बने हैं, जो सफलतापूर्वक संचालित उत्तर प्रदेश के तमाम नए संस्थान उत्तर प्रदेश में इस दौरान स्थापित हुए हैं, जिसके माध्यम से उत्तर प्रदेश के 26 करोड़ स्वास्थ्य सुविधाएं उपलब्ध होती हैं, जो
अब वो लगा देते हैं ना, अब स्क्रीन लगा दें।
पर एक सवाल, एआई सिर्फ एक्सपर्ट्स के लिए, सिर्फ कोडर्स के लिए?
और जब ऊपर जाऊंगा तो अभी आप ऑन कर दोगे, मेरी तरफ से ऑन है, आपको ऑन है।
जहाँ एआई सीखेगा हमारे लिए एआई सिर्फ एक टेक्नोलॉजी नहीं बल्कि
स्टार्ट नाउ।
All right, ladies and gentlemen, I would like to request you all to please get settled down as we are about to begin and start our sessions. देवी और सज्जनों, आप सभी से मैं निवेदन करना चाहूंगी कि आप सभी लोग अपना अपना स्थान ग्रहण कर लें। हम हमारे अगले सेशन की शुरुआत करने जा रहे हैं। I would like to request you all to please be seated and get settled down. Thank you so much. All right. All right, ladies and gentlemen, as we move further, देवी और सज्जनों, आप सभी का एक बार फिर से स्वागत करती हूँ आफ्टर द टी ब्रेक। आई एम स्वाति चंद्रा, योर होस्ट फॉर दिस इवेंट। एंड कार्यक्रम को आगे बढ़ाते हुए मैं मंच पर आमंत्रित करना चाहूंगी हमारे अगले प्रेजेंटेशन के लिए। So still I can see many of the people standing around. I request you all to please be seated and get settled down. यहाँ उपस्थित सारे अतिथिगण से मैं निवेदन करना चाहूंगी एक बार फिर से कि आप सभी लोग अपना अपना स्थान ग्रहण कर लें। धन्यवाद। All right, ladies and gentlemen, moving further. Now we are moving further for the presentation on lightning talks, enabling better care for more people with AI. And without any further delay for the presentation, I would like to invite on stage, ladies and gentlemen, please put your hands together for Mr. Rajesh Kumar Singh, Business Head, Imaging ISC Zone, Philips Digital Imaging Group, to please join us on stage. And let's have a big round of applause for Mr. Rajesh Kumar Singh ji. I request you to please join us on stage. A very warm welcome.
Good morning, everyone. I am Brajesh, I head imaging business to Philips. So, as a company, our vision is to improve 2.5 billion lives per year by 2030. And when we talk about improving that many lives, that can't happen without AI, right? So we plan to use AI not only to improve access but also improve quality of the care. Most of you know Philips. We have been there for 130 years, but we also have seen Philips evolve from a lighting to radio TV to domestic appliance to semiconductor to a pure tech company now. So while we have gone through this transformation in 130 years, the focus has always been on solving the problem which matters to the population. If we see how innovation has changed itself, the innovation in healthcare is no more about the big error. If you see, we invest 9% of our sales in R&D, and 50% of that is going into software and AI. We have been rated as the top innovation company in Europe and in the world for last many years. And what should give all of us lots of fear that Philips Innovation Campus in Bangalore is our innovation hub for AI and the big data, not only for India but for the global. 5,000 engineers working in Bangalore are building the AI solutions which we implement in our medical equipment, which we sell in India, which we sell globally. Of course, we in India are there for 100 years now. We came in 1930. We have our commercial headquarters in Gurgaon. We have our factory and hardware R&D in Pune. Our capability is in Chennai and our innovation campus in Bangalore, where we our work. Most of the things which I'll talk about during this presentation is based on a survey which we did in 2025 on the AI impact on the so we have future health index survey we have been doing for the last 10 years that measures how technology is taking healthcare with around 18,000 people from 15 countries participate in that group in 50,000 group population. This year's theme was how AI is taking healthcare. So most of the data that I will talk about is from this survey. This report is also available on the internet. If you want, you can search by that and you can read yourself to get more details. We know that we are getting lots of data from our body, right? Through wearables, through imaging devices, through monitoring devices. So in fact, we see now there is nothing of data and process of insight. There is no lack of data. We are getting data how much we are walking. We have variables in our body. We have connected devices, emulative devices which are connected which can give data. So, but when we talk about AI or digital transformation of healthcare, it's no more about data. It's about how we organize data to a meaningful information, how we analyze that, convert that to insight, then we add intelligence to that, we put it in the right context, have a good insight. So when we talk about smarter hospital, smarter system, it's not about how we can get more digital based on more data. It's about how we can get more insight to help clinicians do a better healthcare. So we were listening to previous discussion, right? Previous panel discussion, and somebody pointed out that there's so much documentation is happening to capture the digital data, which is sometimes also increasing the cognitive burden for the clinicians, right? The idea is not only have digital data, but also ensure that how we integrate it into workflow to provide insights for the clinicians do what they do the best, take care of the patient, and spend more time on the patient care. So solutions which also I present as with AI solutions, you will see this common theme that we are giving more time to clinicians so that they can spend time on the patient rather than spending time on capturing the data. Few of the trends are known to us. We have more middle class urban population, more aging patient. That means the chronic disease on rise. That means we'll have imaging data, not only increasing on the volume, but even longitudinal data, right? To make sure of the patient history to comment on how they can take better care of themselves. Complexity of disease is increasing, but solutions are not increasing in the same pace. That means with a disparity of supply and gap, and how we can use AI to balance the gap. I don't. This is particularly I have put about imaging. If I hate imaging business, but you can take this anything, even critical care meaningful. There are more patients, more complex disease, but less medicines to take care of the patient. So AI is no more an option. AI is something that we need to have to ensure we have better access and better care. Any new technology that comes will have some promise, some hope, some fear, some hype. That's true for anything that any new thing comes. But if you look at AI, while for population the AI may be new with the cat GPT of the world, the AI in healthcare has been there for long. Of course, it's accelerated in last few years, but AI in healthcare itself is not very new. The journey is from automation to AI. We also tendency that anything automatic being little AI are also want to put that duality there, right? Automation is reducing the manual work, whereas AI is also learning itself to correct. So, so basically, we talk to clinicians as part of the future health tech survey, we say that 85% of them agree that AI is helping them reduce administrative burden. It's 25% agree that it's helping them to enhance their skills, have more capacity so that they can access more patients. So whether we talk about workflow efficiency, whether we talk about improving accuracy, improving personalization, improving precision of the care, AI is impacting each and everything. Of course, each AI solution may be touching some part of that, but if you look at the integrated way the role AI is playing in the healthcare is to bring more control to the patient. Patient will be more aware, healthcare is more personalized to the patient. So as I said that we are adding data, intelligence, and clinical excellence to ensure that the clinicians who are taking care of the patient are more empowered, AI is adapted to the context, and is integrated workflow. It will not increase the cognitive burden, it will make it easier to patients. I'll give some example. Of course, the solution that I'm presenting is not a comprehensive list of the AI solutions we have. Idea is just to give you a picture that which are the high impact AI solutions. Many of them, our university campus, even Bangalore, have worked on many of these solutions. So we know that MRI is a slow imaging modality, right? The MRI can take from 20 minutes to 1 hour, which can be very painful for a patient who life is done for a longer time. But also it impacts throughput, it impacts the patient comfort, patient compliance, the threshold capability. We launched something called Smart Speed few years back, where we are using intelligent sampling and AI denoising to ensure that we have up to 3 times faster imaging and 65% higher resolution. We also launched Smart Precise last year RSNA to also add the second AI engine to increase the target. All of us know that if you stay scanning for a longer time, you have more security to better the noise reduction image quality. But what we are talking about here, how to reduce the trade-off that you have patience for a less time, still you have a better image quality, higher resolution, higher. Similarly, if I look at, I'm not going into each feature, but just to say that like CT scan, right? From a 3D camera, which is helping to ensure that the table height is at optimal to ensure the lowest possible dose for better image quality, auto centering of the region, needle guidance during biopsy, AI reconstruction so that you have good image quality at 80% lower dosage, when you are doing cardiac imaging, right, we have Philips cardiac CT we installed in 30 medical colleges across UP, the inside CT. But you know, heart is a moving anatomy. So when you are taking a coronary image, there can be a motion artifact, there can be blur in the RCA. So we have precise cardiac, which can not only track the motion of the coronary artery, but compensate that so that you get sharper image. Then in the post processing, there is a automatic quantification, uh, m- automatic lung nodule detection, which is helping you to maybe see few things which you may miss, or helping you to do the quantification automatically so that you don't spend time there, you spend more time on the insights that you are getting from those reports and offer the better care for the patient. Again, similar, few more examples where we are talking about how you can fuse different modality in the oncology, where data coming from MR, CT, PET CT to derive insights. You can have automated calcium analysis, automatic lung nodule detection, MR cardiac planning, which can take from 8 to 10 minutes with our smart heart, can be done in single click in 30 seconds. So these are few of the examples as I mentioned. But then AI is not only about imaging. Even though I hate imaging business, I have put some examples of like critical care, right? We know that nurses spend 35% of their time only in documenting. So how we can digitize the ICA, digitize the ICU so that you have automatic charting. We have implemented this solution already in AIMS Delhi, in PGI Chandigarh, in Reliance, Wokhard, with RML. So basically, the idea is that AI journey will start from digital because you cannot apply AI on something which is on paper analog, right? So we have digital ICU solution, which then you can apply AI to give predictive analytics to know beforehand the patient can deteriorate so that you can have timely intervention. Then, of course, we can also use the digital ICU and digital critical care to ensure that we provide remote critical care to a remote town, which is called tele ICU or e-ICU for Philips, ensuring that we can provide a best critical care to a remote tier 2, tier 3 town also. I'll not go into each of the solutions. Then we have also digitized the pathology because the radiology is digital, but the pathology we are still using microscope to see the slide, right? Now we have a scanner, you can simply upload the slide to that and all the data will be digitized. So if you have to take the second opinion, right, you don't need to send slides to a remote location, but you can simply share the data. Then you can apply AI on that. We already have this solution again in PGI Chandigarh, we have in Tata, and we have multiple corporate setups. I'll not. We also, it's also not about what Philips is inventing. We are also partnering with other vendors. Like we have partnered with Nicolab to enable a stroke care, right? Basically, what we are saying that when you are doing a CT imaging or MR imaging, that time itself the data will be sent to cloud, and the analysis of that data will be shared with the stroke team. So by the time the patient is reaching the interventional lab, they are already prepared. So you are saving time, you are saving not only patient life but also quality of life because time is bread. But can AI save lives? See, healthcare is also a trust factor, right? It's not only about what technology you are bringing, it's the combination of people, process, and technology can act as a glue between people and the process. When we looked at our future health index survey, we found that while both patients and physicians feel that AI can help deliver better clinical outcomes, there is an optimist gap of around 20%. And if you look at 45 plus age patients, the gap increases to 25%. And again, while the patients are more comfortable using AI for the workflow efficiency, when it comes to clinical, they are less confident, right? Whereas if you look at the clinicians, they are confident throughout because, of course, their understanding of AI is more. So how we can make patient more aware, how we can be more transparent, because see, half of the population feels, very simple, half of the population feels that with the technology they will have less face time with their doctor. So I'll end with this slide. So idea is to not build technology and see what solution it will fill, but start from problem and see that how we can involve clinicians to build the AI, integrate AI into workflow, ensure there is always a human supervision, ensure AI is trained using representative data so there is no inherent bias, and while we care for the speed of innovation, we also care for the regulatory guardrails so that AI is safe for the patient. And then we have to use create the ecosystem, right, where the vendor is there, caregivers are there, government is there, and the events like this will help to build the ecosystem. I'll end with this factor. AI is enabler, is augmenting the clinicians, not replacing the clinicians. Eventually, the clinicians will have their own assessment to either accept or modify the result the system is providing. It will only enable you to deliver better care for people. Thank you. Thanks a lot.
Thank you so much. Let's have a big round of applause for Mr. Brajesh Kumar Singh Ji, Business Head, Imaging IC Zone, Philip Digital Imagine Growth. Ladies and gentlemen, moving forward, now is the time we are about to start with our next panel discussion. And to introduce our panelists, I would like to request, please put your hands together for Dr. Antulip Rizvi, Medical Officer. एक जोरदार तालियों के साथ उनका स्वागत और अभिनंदन करना चाहूंगा and request you to please join us on stage.
A very good noon to all of you. A very warm welcome to all our audiences, our guests. And we are about to start with our second plenary for the day. And it's about the AI roadmap for the states. And in this, delegates, respected speakers, they'll speak about a structured roadmap for the states and the union territories to strengthen their digital health and AI ecosystem. And so, not to waste the time, I would like to just call upon Mr. Amit Kumar Ghosh, sir, to come. He is ACS Medical Health and Medical Education, Government of UP, to kindly come up on stage. A very warm welcome to sir. Our next speaker, Mr. Anurag Yadav, sir, IS Principal Secretary, Information Technology and Electronics Department, Government of UP. Uh, please welcome Mr. Madhukar Bhagat, sir, Joint Secretary, E-Health, Ministry of Health and Family Welfare, Government of India. Next, we welcome Mr. Professor Sonia Nityanand, MD. Is he here, sir? Okay. Kindly welcome Dr. Hardeep Singh, sir, HOD Urology from KGMU. Next, our speaker, Mr. Dr. R.K. Bhiman, sir, Director, SCPGI, Lucknow. Maninder Agarwal, sir, Director, IIT Kanpur. And, Dr. Pradeep Venkatesh, AIMS Delhi, AI in Ophthalmology and Diagnostics. Respected sir, Mr. Amit Kumar Ghosh, sir, to kindly take the stage. Thank you.
I think I'll be showing some slides to अगर कुर्सी yeah like थोड़ा टेढ़ा कर दो आप बस distinguished panelists who are also my colleagues in the audience, and all the participants, guests. Today is our second day, and actually, this session, AI Roadmap for States, this was scheduled to be held post lunch. But post lunch, myself and Dr. Seema and Dr. Sonia Nityanand, we all have to go for a high level meeting. So we requested to schedule us now, and I'm glad that Madam has not been able to make it the VC KGMU, but we welcome Professor Hardeep, who has kindly found the time to come for this meeting. I'll be making a very small presentation because I have been also given the task of speaking at the valedictory. So I'll be leaving the stage very soon. But all I wish to say is that, when we talk about the AI roadmap of states Uttar Pradesh, we're going to be talking about Uttar Pradesh. So, next slide. So, this is the global context. I am not going to read word by word, all of you can read, but you can listen to what I'm basically. All the people that I know in the United States of America are telling me that their children in schools, colleges, everybody is caught up now in the AI fever or AI wave. So there is a global, move towards AI. But it is also known that globally systems face workforce shortages, and that is also the reality for UP. So we don't wish to approach AI as a pilot exercise. We wish to embrace AI as a system level reform. That is if you can say, that is our policy declaration from the state this morning. That health department in UP will not carry out pilots for AI. We will embrace AI as a system level reform. Uh, all these AI is critical for so many things. All I wish to say is that we wish to focus on population scale readiness, where solutions work for 25 crore citizens. We will not focus it for a niche or a group or an age group or a particular cohort. So, health department in UP, medical education as well as medical health, will need to orient themselves to think of AI as a state level, you can say, strategy or system. Next. When we talk of AI, I wish to say that, you know, there is an increasing burden that AI must be able to address. And we have to go for early detection, predictive care, efficient allocation of scarce resources, and the global challenge before AI, the main challenge we have been hearing since yesterday, is how to scale AI responsibly. Now, in that context, point number two, UP offers, no, go back, a diversity of demographies. It offers a diversity of disease profile as well as care. happy to tell you that with the help of, till now we were not any regular course for care for geriatric. You know, I've got it started. So wherever we go, AI can help us reduce the workload. So already we have, you would have heard that we have done a lot of good work and on the side of ABHA, ABDM. So we wish to say that, what we will do here, whether in terms of digitization of health records, protection of patient privacy, all these things will be transferable across other states and across nations also. I was talking with Dr. Rakesh Kumar. He used to be JSRCH. Many of you, most of you, know about him and his work. The gentleman who introduced the RNLCH plus A framework in NHM. And he was telling me that the lessons in reducing IMR and MMR in UP are now being implemented in many nations in Africa. So what we should do is that the lessons from AI here should be globally transferable. That is the kind of work. Now, to continue with this, I just want to also say that it is not easy to work in UP. But if AI models can succeed here, I assure you they will be able, the agencies will be able to implement in other states. So UP is a real strength. Next slide. So what AI needs to succeed at scale? To all my colleagues from medical health and medical education, I think in the morning we heard the learned panelists. AI succeeds when four fundamentals are in place: representative population scale data. So wherever you are, make sure that data is accurately. Secondly, interoperable digital health platforms. Since yesterday, we have been hearing about the need for this. And robust governance. Privacy framework should also be robust. And a clear linkage between public health action, insights offered by AI. So what we learn should be we should be able to transform into clear public health action. So again, I say that our department will deliberately sequence AI development across all these layers that you see to avoid fragmented deployment. And that I will need full help and support of recently, yesterday it was announced the UP artificial intelligence so that interoperability and accuracy are maintained. Next. There was a time when we did not have data. I am talking about 2012 when I came in as MD and RHM. Today we have a lot of data. Now that I've come back at this level, I find that we have a lot of data, but it is placed here and there. So I want to talk about how we can have impact. I want you all to think we have leaders from PGI, RMLI, KGMU sitting here. and other institutions like Kalyan Singh Cancer Institute, Safai University. We have to design impact marketing. And the journey, I think, is from population data to what I've spoken about interoperable platforms, proper AI models, and public health action. So, early diagnosis, better, more accurate referrals, targeted interventions, and improved outcomes. This should be our path. Next slide. So, where are we? So we have done some foundational work. We have a strong digital foundation. We have population, facility, and health workforce registries with applications like UPKSK, Manav Sampada, eKavach, and UDSP, the Unified Disease Surveillance Platform, ABDM aligned interoperability standards. Okay, so these are the digital systems in place, scalable cloud infrastructure supporting large public programs. Now we have to think about bringing in AI solutions which we can plug into existing systems rather than creating parallel silos. Yesterday, I'd asked a question and I learned a great deal in the answer provided that we don't have to, reinvent the wheel. We have to find the right model, right tools to create the correct DSS and be on our way. So I think, this year 2026 is going to be very important from that point of view. Next. But we should never ignore citizen engagement, you know, transparency, inclusion, and ethical AI deployment. Trust is very important. So, citizen trust is the currency of digital health. We will follow a digital first, citizen centric approach. We wish to reduce. So, that is the way we proceed. Next. You know, long back, Mr. R.R. Shah used to be in UP, a very, very venerable senior, and he has made a comment that UP has become the graveyard of pilots. So, no pilots. That was the first decision I had made after here. So, I have never really gone for pilots, but we will go as a living lab for everything that AI has to offer, the best in the world we have to do, and we offer governance at scale, extreme diversity, real world validation, and rapid scale up capability. So no longer we will work as a test bed, we will work as a living laboratory. Next slide. What is going to be our strategic roadmap? This is a slightly busy slide, so I'll go slowly. You can read that and listen to me. We'll have a phased approach. We'll have a realistic approach. And our approach will be outcome. In the year one, we will align ourselves with the National Digital Public Infrastructure, PDM 2.0. We look at data as public health and we will ensure institutional ownership, whether in our institutions, in our directorates, or in our divisional and district level units. And
Right from now, we will scale with validation, which means validation through real world setting, program integrated with AI development, capacity building, and adoption. Then, by 2030, we wish to have human in the loop governance, workforce empowerment, and predictive public health planning. This means that from January 26, we will start empowering, enabling, and training our workforce, the top leaders, beginning from top leaders. You know, Dr. Kar from Apollo, he was there and he said, how many ashras are there? How many supervisors of ashras are there? So somebody tried to raise a hand, but then he put the hand down. So what I'm saying is that at the same time, we have to look at our large frontline FLWs, frontline workers, and also start taking these technologies to them and see how what is the best way to do it. So right from this month, we should start engaging. We already have Vadhwani AI as a knowledge partner here. We'll work with them. I have also requested today the participants from Dr. Ganpati, no? Dr. Ganpati, who join us as knowledge partner. So we will see, and of course, in the Department of IT under my colleague Rag Yadavji. So we wish to start working for 5 years from this month itself. Now, what is the outcome at the end of 2026? Whatever solutions we bring should be technically integrated, programmatically owned, and ready for structured scale up. Scale up will come next year, but at least it should be ready. Outcome by year 3. AI should have become a routine, trusted, and outcome-oriented component of the priority health program. Let me tell you, there are some solutions which are available from Government of India, like for tuberculosis. AI are available. So, you know, we should start going for their deployment and look for positive outcomes. By strategic decision making should have the support of AI from frontline worker level to state level without diluting, as I have been emphasizing, human responsibility. Next slide. We should also keep our doors and windows open. So my appeal to all the health partners, institutions, Government of India agencies who are here, that we look forward to partnering with you. We look forward to signing MOUs of cooperation, whether in the area of capacity building or deployment of AI solutions. And we will have a very, very open-minded approach. So, life-saving solutions, please bring them to us. Greenfield environment for population scale AI, we offer in return to you. And we assure you that it will be a smooth affair this time. So, we look forward to working with you all who are present because we value your participation and your knowledge and your. So, we invite partners for co-development and co-generation, co-development tools, co-generation of relevant models as well as relevant evidence and help make Uttar Pradesh an exemplar for AI in public healthcare. So this is my offer from the state of UP that we will have a shared journey where public purpose should lead innovation. Next slide. So this is my last slide. We are ready to, this I have already spoken about. Next slide, this thank you slide. I wish to say that the health team in UP right now is the best team any additional chief secretary could have asked for from the government. And when I say this, I speak not only of civil servants, but also of the doctors and academicians who are leading our institutions. So we have to now demonstrate how technology, governance, and human values can converge for population health. Thank you very much.
Thank you very much, sir, for a very engaging and interesting presentation on AI roadmap for the states. Now, I will like to invite Shri Anurag Yadav, Secretary for Technology Projects for the state of UP, to share his views on the topic.
Thank you. इस सभागार में ज़्यादातर लोग हेल्थ सेक्टर से हैं और जो थोड़े हेल्थ सेक्टर में नहीं होंगे वो टेक्नोलॉजी से जुड़े हुए होंगे, ऐसा मेरा विश्वास है। तो जो बात मैं शुरू करने जा रहा हूँ उसका थोड़ा सा डिस्क्लेमर के साथ शुरू करूँगा, बिकॉज बहुत सारी चीज़ें प्रिपेयर किया था, बट सर के सेशन के बाद और सर की स्लाइड्स के बाद मुझे लगा कि इससे शुरू करूँ। और ये बात सर इस यूपी में जो लोग रहे हैं वो बहुत अच्छे से समझेंगे, बाकी आपके बगल में जिसको समझ में ना आए बिकॉज ऑफ लैंग्वेज उसके नरेटिव वो आप समझेंगे। यूजुअली द बेस्ट प्रोफेशनल्स, हेल्थ प्रोफेशनल्स ऑल्सो मैंने देखे हैं डॉक्टर डिस्ट्रिक्ट यूपी में। हम लोगों के यहाँ होता है सेहत अच्छी हो तो नजर नहीं लगनी चाहिए, ये दिया जाता है कि तारीफ मत करो नजर लग जाएगी कहीं छुरा न जाए। ठीक है, सर का प्रेजेंटेशन इतना अच्छा था कि मेरे जैसे को रखना है साथ काला टीका के रूप में कि नजर न लगे सर के प्रेजेंटेशन को। ठीक है, तो वो सारा रोड मैप सर का आ चुका है, बट यू हैव टू डू दैट एंड आई मीन यू अंडरस्टैंड द स्पिरिट व्हिच आई वांटेड टू से। यू नीड टू हैव मी, अदरवाइज नजर लग जाएगी जितना अच्छा सर ने प्रेजेंट कर दिया सारा रोड मैप। So what I present, मतलब basically I have nothing to present because entire roadmap which state is supposed to lay out, in fact whatever I could do, सर के presentation में वो बहुत बेहतर आ चुका है। So presentation is about what state is supposed to do to take AI into health sector. It's already been discussed and have been, I would say, presented before the audience. I'll present certain other additional aspects जो कि अगर आप में से किसी का ध्यान उस पर नहीं रह गया था उस समय तो आपको थोड़ा बहुत याद आएगा। तो एआई को लेके एक अगर आप देखेंगे तो दो बेसिक खड़े कहते हैं जो दो तरह से चलता है। एक है देयर इज अ लॉट ऑफ आई वुड से नॉट कंफ्यूजन बट देयर इज अ लॉट ऑफ insecurity. Insecurity, for example, is and insecurity is more for the professionals, in fact. So, चिकित्सालय डाउट की किसी ने नहीं देखा होगा, I believe doctors where on a laptop he opens up आपकी problem and he goes on. So, in a nation where everybody is a doctor usually, and you are now left with a chat GPT. So health professional do feel a bit insecure कि जो रिकमेंडेशन आप उसको दे रहे हैं उसके बारे में 10 बार आपसे कह रहा है इसका साइड इफेक्ट क्या होगा या ये तो मैं जान के आ रहा हूँ। A society which takes very easily consumes all the paracetamols and all the antibiotics and then comes to you once everything has been exhausted by its own domain of expertise. Public health burden जो हमारा है वो कहीं ना कहीं, so there is an insecurity for all the professions, and there is a second part where we see a lot of opportunity. So India has embarrassed under the leadership of Prime Minister Sir that we will embrace AI with a responsibility, with making it inclusive. And that probably is going to be the role model for the world to practice when it comes to how to embrace AI. There's been a lot of, I would say, there is one. Uh, Yesterday there was a debate about what is global south in technology. So leave it south or not. But yes, there are countries who have doubts about AI's potential, and there are countries who want to adopt it in a responsible manner. We are going to be a nation which is going to adopt it in a responsible and inclusive manner. And once we say it, once we want to make AI as inclusive, health is going to be one of the most important sector where AI would have usage. Now, as a principal secretary information technology, what role I foresee? So the fundamental, I would say, is the building blocks. Whatever discussions we are having since yesterday, most of it is based on we do want applications. So we are looking too much of deployment of applications. But as a nation, we also need to be creator of these applications. Not only the deploying, but also creating it. How do we do that? You require data sets. Yesterday, somebody was talking about a particular disease data set. Probably, if I recall, cancer. He said that if we don't have a data set for that, how do you create them? It's not just not having the data to train, but also if you have a data, can an industry or an entrepreneur use that data? Whether our copyright laws allow you to do that. The existing data which is in the public domain, can somebody build an application on that? Can you have an access to that? So these things would require, I would say, enabling policy, not the regulations. And there comes probably people like me who would be trying to enable these things, where probably is time has come when we require these enablers. So how do you access data? How the data is unstructured or structured, but part of a sandbox where you can build up your applications. So there comes the role of IT. For each sector, how do you build up the sandboxes where people can access? We do have examples. We have done DPI. So everybody is using Aadhaar, everybody is using UPI. I mean, nobody in world could believe that India could achieve these things. We have been hearing the success story of UPI and Aadhaar. So we do have that confidence that India can create, enable a digital public infrastructure. With digital public infrastructure, we can create our data set, which can be easily enabled to train the models. The models and the LLM has to be ours. Because let's I mean, I drift a bit. Uh, you see, I usually give two examples लोगों को when it comes to learning models में. And yesterday somebody was discussing about the diseases. So we all understand that a model which is trained on some international experience may be difficult to give a right output. And we have from the technology experts also in the morning session, we had this whole issue of the results are coming quickly rather than with substance. So you do require training of the model. And for doing that, we do require our data sets and our own building blocks. So, sir, I mean, on the AI part, and where comes the technology and people like. So one of my teacher used to narrate this story. I was a bit disappointed and he didn't go to IIT or a CPMT. मेरे ज़माने में PMT. I was a arts student. So I was a bit sad in a class and he looked at me, क्या हुआ? And I was like, sir, people look at with pride to somebody who qualified for an IT. So medical मैंने नहीं कहा था, IT I said. So he's like, हाँ, ये तो ठीक है. Okay. So he wrote on the blackboard for us in the class 2 plus 2 and asked, if you were in IT, what will you answer? So we all answered 4. Yes. But now I'm going to tell you 2 plus 2 can become 1. We were a bit surprised, and then he asked, add 2 drop of waters in 2 drop of water. How many drop of water you have? 2 बूंद पानी में 2 बूंद पानी मिलाओ, कितने बूंद पानी है तुम्हारे पास? So I said 1, and he said yes. So maybe IIT will keep coming with 4. Don't, I mean, again, don't take it that way. He said that there is much more beyond what 2 plus 2 teaches, and that is what you need to learn. So that is what, when you think of that, then comes the question of what are the opportunities and risks. We had a lot of discussion. I had my colleague in morning session. I foresee, sir, there are few important aspects when anybody who is a stakeholder with AI, I try to, wherever I am in a institution, I try to highlight these things. I may be right, I may be wrong, but that's what it is. I'm just going to highlight that, and I believe 1 or 2 of that is related to particularly health sector. So what AI, what is one should be doing when it is has to be responsible? What is happening as of now is with technology, and this is a term which we usually use, but that's what is happening, and in health sector particularly, it has its own implication. Individuals being what we say is hyper connected, deeply alone. Now, in first time in the human history, it is happening. Humans are supposed to be what we define as a social animal. You belong to a society. You belong to a group. Now, that virtual group can replace that social group is something which one has to see. And particularly from your own, when it comes to health sector, what is happening? Has does it make any implication for that? So you are hyper connected but deeply alone. What is going to happen? The second part is too much memory in your gadget and too less memory in your mind. Now, what happens with humans when you don't have memories? I mean, you doctors and clinicians know much better than me what disease sets in when you start losing your memory. And and think about this: that you go from this conference and you have no memory of this conference right after the session, and to know that you have to click in your whatever phone, because you really know that everything is there in the phone. You just say time this, and it gives you everything. Would you like that? I'm not sure, but it is happening. It's happening. I mean, it's happening whether it is documented, whether it is scientifically validated. I'm not very sure. I may be wrong, completely wrong. But what I find usually is that we have too much memory in our gadgets, and somewhere probably we are not giving importance to human beings. Because we as a human being, we enjoy our life probably with these memories. Memories play important role in our health, in our well-being. How do we set in with technology? That is something I always leave I just leave this part to. Third thing is about data. I always, I usually, when I interact with people in AI technology, information technology, digital technology, I emphasize this point. Uh, Human beings now are traded as data. So are we the new slave? Slavery ended. I always say that slavery ended centuries ago, but now you are traded as a data. You rather than being consumer of data, you are traded as commodity. Your data is becoming a commodity. So commodification of human being with data is something which worries me. I'm just leaving this thought. How far it is going to be. So when we use the word being responsible, being inclusive, probably every application which is going to be there needs to think about these issues, particularly when it comes to how your resources are going to be used. So will our startups, will our clinicians, will our professionals be using compute only to make the skin illness, or will it be addressing actually the health burden or the burden on the public health system? Because the experience has been that nobody can stop that. I understand. You can't stop these kind of research. That is how it is done. So billions dollar may be spent to find a miracle drug rather than finding a drug which can solve a disease. That's part of learning. It has been there. So I understand that completely. This whole market between things. At the same time, as a state, when we put in our priority for applications, when we go for finding the solutions, probably what my senior colleague in the previous session presented to you, the roadmap about how we deploy these solutions to reduce the burden on public health systems. That should be our goal. I'll end up here. If my thoughts or my ideas have injured anyone's psyche, my sincere apologies, because I never intended that. It was all with my disclaimers that no malice to anyone, and it was not to be quoted also. I usually follow in conferences something called Chatham rules when I speak. So Chatham House rule applies to me when I speak. Thank you so much.
We thank sir, and his message was inclusive AI for the benefit of masses. Now I invite Shri Madhukar Bhagat, who is Joint Secretary, Government of India, to deliver his address.
Thanks a lot, Mr. Ghosh, the eminent panelists on the dais, and this August gathering over here. Uh, First of all, thanks for the organizers for having me over here. I'm in the area of mental health at Ministry of Health level, dabbling with technology, leading some projects of AI for the last 3 years, which have been interested upon the health sector. And we do have some experience of this, and whatever I'm going to say is of from the practical considerations. So first of all, I would like to highlight that why do we need actually a digital health, or for that matter AI, or for that matter AI or any technology? Well, we have to understand there are four utilities as far as health is concerned. They are the four dimensions and the four guiding principles for any health. And these are, first of all, availability of medicine. Second is affordability of medicine. Third is accessibility of medicine. And fourth is quality of medicine. And whenever we talk about technology or any initiative in the health, we have to ask ourselves, what's happening to these four pillars, to the these? Is it improving? Am I improving the utility of one at the cost of others? And when I look back at the digital health, or for that matter, as far as AI is concerned, I can say yes, there are definite areas where there is improvement as far as adoption of AI is concerned. In India, and for that matter in states, we have a doctor to patient ratio of what, around 10 doctors per 1,000 population, as compared to the European standards of 30, 40. And therefore, there is a huge gap. Can we reduce this gap? To some extent, it is possible. But when we talk about the rural areas, is that gap going to be reducing drastically? Given the structure of things, the answer is not in the near future. I don't know of the very far future. And therefore, we have to think of technology as a force multiplier, and for that matter, for the states to adopt appropriate technology for the purposes of availability of medicine, accessibility, and affordability. And when I saw presentations which were made by the team from Philips, how it is also improving the quality of medicine, how it is deep diving. And whenever I interact with the private sector or the presenters, I realize that the quality of medicine can improve because through the visual inspection method, which is the visual AI, or by analytical method, the analytical AIs, they are able to give things and give products which are perhaps the ordinary human mind may not consistently be able to do. And therefore, what is the choice for the states? The choice is simple. Either you adopt the digital technology or you get left behind. Now, let me just take briefly, next slide please, what's happening at the central level and what are the lessons which can be very easily taken by the states or can be considered. First of all, as far as, first of all, I see the Department of Health and Family Welfare. Uh, the last 5 years, we have developed 3 centers of excellence, and these are at the AIMS Delhi, AIMS Rishikesh, as well as PGI Chandigarh. And these 3 centers of excellence are working along with other supporting institutions, whether it being ICMR, whether it is the Ministry of Higher Education, whether it is IISc, and we also have the public and private partnership where AI has been providing us with the technology. But besides these 3 centers of excellence, we have a National Medical College network. Sanjay Gandhi is a part of that, and we have been trying to enlist them as associate sectors, which can apply what we are doing and from where we can also take it. And therefore, what is required to be done by the states, or one of the models that the states can adopt, is number one is identify who's going to be a technology partner. Is it going to be someone from Vanvani? Is it going to be someone from other private institute? Or is it going to be an IT Kanpur for that matter, or ITBHU, or who's going to be your technology partner? And then you have to have certain AI centers. And these centers have to be in centers of medicine presently. UP, maybe it's Sanjay Gandhi, postgraduate, or maybe ITBHU, or maybe some other eminent medical college which has got the IT professionals. But once you have got the institutional framework ready, funding is definitely one of the requirements. HR is definitely one of the requirements, and the previous speaker we have already talked about it. What should be the climate? That's extremely important. How you are going to approach it? Whether it's going to be just a project, it's going to be a pilot, and of course, you have said no to pilot, and that's wonderful. If we want to do it, we want to take it whole hog, and that has to be approached because you cannot divest so much of resources in just testing and saying, "Oh, we are touching the waters, we're testing the waters." No, you cannot. You have to give your best and you have to make it successful. If any states wants to adopt technology or AI for that matter. Next one. Now we have got the technology framework, we have got the funds, we have got the centers, and next we come to the issue of data. How data is going to flow and how digital data. This one form of data, okay, from where am I going to get data? Look at the central institutions. First of all, do they have the data? Don't start thinking that, look, I'll dig my own well to tap water. That's a time-taking exercise, gathering data, as my colleague whom I do, work at AIMS will tell you. Because gathering data from the source is a time-taking exercise. It is a trickle-down effect which takes months and at times years. And when you realize that, oh, the quality of data and the annotations were not great, maybe I could have taken some gold standards which was available, or maybe I could have developed and then tested on my own data. Look at the data. How can I get data? Whether ICMR has data, whether you already have the Government of India AI Coach projects, which is launched by IT, which is going to offer some data on that particular platform. Maybe it's going to offer some compute also. Can I take from that the analytics from that? And then once I have sought the data, then I have to realize what sort of data. Is my data longitudinal data across patient's life depending on the projects? Or is my data such that it is covering a large span of the country? Or is it just localized to a particular population? In that particular case, the application will also be localized, perhaps best suited to the population. And therefore, if I am targeting any application, I should have a geo distribution of data, I should have a longitudinal distribution of data. I should also have age distribution of data. And it shouldn't be that, okay, the data is only from a small time frame of a few months. I would like to have data maybe 5 years prior to that, or maybe some later down the line. Now, let me look at some of what are the projects we have developed and why this is important. Because if you want to replicate them, what's the point? Try something new to the states that I would tell. And therefore, for the states, it also becomes important that if they have already adopted something from private sector, or some other states are developing, then it's a whole new area. Try to develop of new solutions, new areas of challenges where you can really apply. So in AIMS Rishikesh, we have projects like breast cancer, we have uh, radiological solutions, we have projects pertaining to CDSS, clinical diagnosis and support systems. We have these are the finished projects, which is AI-powered clinical decision support systems, which is on the eSanjeevani platform. We have the media disease surveillance, which every day is telling me information, and from that I am able to get that there is an outbreak of Nipah virus in some of the centers. As of today, it collects information from the media, and then I'm able to send to Sanjay Gandhi and other such centers of excellence, which are then able to act upon. Diabetic retinopathy, my colleague from IMS Delhi is there, who is the lead expert. He will be telling more about that, and we have already launched in 7 states. So these are some of the actions which are also a part of the national health vision, such as the prediction of adverse outcomes of TB. And therefore, when you are adopting something for your state, think of something new instead of replicating what has already been done. That is better for the country. Now, let me also talk about some standards which will be important. I talked about the data standards. Let me talk about what are the other standards. Data standards is one there, gold standards of data is there. But we also have to be conscious about the fact that what is our strategy? You can have a state strategy that can be that can draw elements. Government of India is also developing a national strategy for AI, and on we had the first round of discussion. Later on, you can see is there something you can adopt from that instead of reinventing the wheel all by yourself. Second thing is what are the guidelines which are existing? ICMR guidelines are pretty, I would say, old because things are changing. But then there are certain valid elements from them, guidelines, etc. Third is the DPDP Act and rules. It has already promulgated. It is already in force. And whenever I'm talking about data, two elements from DPDP I have to be very, very careful. First of all, the data has to be anonymized. And therefore, whatever you do, please have an anonymization tool so you can test your data is fully anonymized. Otherwise, the repercussions can be severe going down the line. And second thing is data security cannot be forsaken. Nobody talks about data security. Myself being a person who has done audits in information security for international organizations, a number of countries, for every platform I talk that look, being in the field of AI does not mean that data security can be taken for granted. It cannot be taken for granted. Data poisoning can happen, model poisoning can happen. And then imagine that if poisoning has happened and you have not been able to detect, then the whole application goes awry and a mission can go haywire. So these are some of the principles, some of the cautions, and some of the leads which I would like to share with you. I'll be there with the next session also. And so something again I'll be talking to you. Thanks a lot and see you.
Thanks, Shri Madhukar Bhagat sir, for the pearls of wisdom shared with us. And now I humbly invite Professor Hardeep Malhotra, Head of the Department in Neurology, KGMU, for bestowing us with his knowledge.
Yeah. Good afternoon, everyone. So, on behalf of the King George's Medical University and Honorable Vice Chancellor, I would be presenting. This is strengthening digital health and AI ecosystems, a strategic roadmap for Indian. So I'll give you a different perspectives of how we are planning to go ahead with this. So we have actually focused on the 5 basic strategic domains, right from infrastructure foundations to the service delivery innovations. I'll give deep into whatever success stories within the states have been there. So if you look at all those success stories in these 5 domains, I have just a couple of slides for each domain, and I'll walk you through. If you look at the first domain, that is the infrastructure foundations, then we see that, can I have the next slide, please? the leading states and the union territories are Telangana, Karnataka, and Haryana. There is a bit of everything to be learned from each and every state, the way they have developed. The T hub, that is the technology hub they have developed. Karnataka, the digital backbone that they have developed in terms of their state-wide incorporation of their HMIs, and the Haryana, that is the Aravat compute infrastructure. That, in fact, is the biggest, strongest, and the highest capacity AI computing system in India. So this is something which we need to see, and the key infrastructure components, if we see, what we actually require is high performance computing, federated data centers, 5G network backbone, and last but not least, as has been said earlier, that zero trust architecture with end-to-end encryption. Trust at the level of patient and zero trust in terms of how the data is getting analyzed. So this is very important. If you look at the next slide, please. If you look at this case study, what we see ultimately is that we are having a lot of health tech startups, and these health tech startups are in turn increasing the output, making things translatable, as well as reducing the cost to one third. If you look at the plan, we can divide the plan, and as sir has already said, it has to be gradual. It cannot be, kind of 1, 2, or 3 years, but it has to go down the line like 5 years, 10 years down the line, and each and everything has to have key performance metrics. Until unless we have the matrices, we will not be able to gauge what we are doing. The next slide. We shift on to the next domain. This domain tells us about the data systems and the interoperability. So three leading states, Bihar, Madhya Pradesh, and Jharkhand. So we consider the state of Uttar Pradesh, considering all the lead nine overall registrations in Uttar Pradesh, they are the highest, no doubt. We require translatability and interoperability of all the operations that have been lead. ABDM 2.2 in place will require this even more. So besides ABDM integration, we have to look at the analytics, the time analytics that are there. Last but not the least, the consent management, patient control data access with audit gates, as has been alluded to my earlier speaker. Once we have these things in place, we'll be able to track right from the first referral, grassroots level, to the apex, and then map how was the entire history longitudinally for that patient, to that referral center, up to the level of the apex. Next slide, please. So the case here in point is Bihar, where they have achieved a 92% online health record sharing. So as of now, here we are bordering around 80%. We are at 92. We have a target of 80%. So we are seeing the rise, but considering the population of the state of Uttar Pradesh, what we have achieved is immense. Just coming to the, if you look at the replication strategy, what we finally require. So what are the asked indices? These metrics would be to track the pharma adoption. We decrease the overall waiting time, so that will improve our efficiency, and the workforce capacity. These are again three important case studies from which we can go ahead. The AI learning module, where Kerala has come up with 10,000 trainings. It is similar to the SWAYAM portal that we have. Now, an important aspect is they are managing the educational services. We use triage for emergency services for trauma. So they are using a triage even for the learning process, for maintaining their educational modules. For Tamil Nadu, they have an evidence-based training. For Andhra Pradesh, we have a telemanas. For those who are not aware of telemanas, it's similar to the addressal system that we have in US, that is suicide prevention, or the system where you have a patient who has a psychiatric illness and requires an urgent consultation and then a subsequent follow. So this is a very good model there. And we look at the delivery we'll have to see the micro credentials and refresher courses, because what we start should not stop. So we should be having a refresher course, because technology is advancing, AI is advancing, the data is taking us to a different level. So that will be important. Next slide, please. So the case, the next case in point is Kerala. So as I said, you can see that there is a AI-powered triage. So this is not commonly seen. So this is very important, building. And if you look at the key metrics, we have to track the certification numbers, the competency post, and the patient count. Next slide. Coming on to the fourth domain, that is governance framework. This is something now has come up. We have also adopted a part of it. The first and the foremost thing is the AI ethics board establishment with mandatory bias audits. So if you find a deviation, so the AI will tell you, "Look, there is something which is different." We cannot say whether it is deviance, which has some amount of malice, but it is different. So you need to peep into this thing and get an audit done. Then you have Rajasthan, where it mandates that each and every matter should be online. There should be transparency. And the third module is of Jammu and Kashmir. This is again very important, where privacy, where confidentiality is of utmost sense and importance to them. So this is where they have come up with their sovereignty focus, and they have adopted that module as per their needs. So if you look at the mechanisms, so what we require is clear liability frameworks, so that everyone has a responsibility, answerability in the entire ecosystem. Next slide. The case here is of Uttar Pradesh, where they have gone ahead with the AI ethics board. So we are into the process, like a partial process where we are into this thing. Here the key emphasis would be track audit completion. So that will give us the answer where there was a problem, compliant, complaint resolution, and public trust score. Again, trust at the level of consumer. Here the consumer is the patient, may be a patient, subject, participant, or a healthy person. Anyone. You have to take everyone into view. Next slide, please. So this is the last domain that I wish to highlight. That is the service delivery innovation. In this service delivery innovation, this is again something which we see fairly commonly in US, Canada, Germany. We have an ambulance system which is tracked on the basis of AI. It's not so that there is an ambulance going and you are having repeated checks. You have traffic system which is not controlled. You have lights which are not there. So similar to what we have already seen here happening in Lucknow, the development of green corridors, when the organs are sent for to another state, or someone has to come. So this is similar to the green corridor development which has started here. We have seen, and here we require AI-driven treatment recommendations based on the patient history. Again, the focus is the patient. Next slide, please. So in the Gujarat model, we have each and everything right from the GPS tracking, then very important to train the emergency dispatchers and keep paramedics on record, so that entire ecosystem is there, along with usability, and the key metrics would be to track the response times, patient outcomes, as well as the system uptime. Next slide. So this is just a gist of how things are moving. So as I've already said, so Uttar Pradesh has 13.89 crore registrations. So numbers are very high. We are not lagging. Thinking about how we are getting this thing incorporating, and as very rightly said by Ghosh sir, that we are a diverse population, a huge state. The number is very high. So the interoperability and the execution needs to be in place. Next slide. To sum up, so we have these 5 domains. The singled out points are there, but I would like to end my presentation with next slide. Can I have the next slide, please? So I think there is an issue. So I would end by saying that what we want to do is very important. AI associated here is bound to flourish. It's only about the states. You want to lead or you want to follow. Just end my presentation. Thank you.
प्रोफेसर हरदीप मल्होत्रा सर, इतनी महत्वपूर्ण जानकारी साझा करने के लिए हार्दिक आभार। एंड नाउ आई रिक्वेस्ट डॉक्टर प्रदीप वेंकटेश from Delhi. He specializes in use of AI in ophthalmology. Sir, I request.
Yeah, a big thank you to the organizers for having me here this afternoon, particularly Dr. Mrs. Ritu Maheshwari and Dr. Mohit Singh. The section as a clinician, I've been working in retinal diseases for almost 25 years plus now. But I also have an MBA on healthcare and hospital system management from Bistalani. I also have a certification from Stanford University on AI and healthcare. So, in the midst of all the technocrats and the administrators here, I'm going to add a mix of the clinical knowledge that's there on AI. So, what I'll be talking largely is on Madhune AI, the app that we created in the team effort. We've largely driven on the administrative side by Mr. Madhukar, and we've had a lot of meetings with him. He's always been very supportive. He's guided us. He's also prodded us to go forward whenever there was a pause in what we were doing. And I thank you for that. And so healthcare you actually cannot separate. Since yesterday I've been watching somebody cover the aspect of GDP. And if you see over the years, the Indian GDP has grown. Last 25 years again it's grown. Now we're the fourth largest in terms of total GDP. But what about per capita GDP? We're nowhere in the list. We're nowhere in the sorry. So we've been nowhere in the per capita GDP, and it's important to remember that. Why so? Now, if you look at the health expenditure per GDP, India is the last to be at 2.9% spent on that. And the light blue particularly is more concerning because more than 60% of our patients actually pay out of pocket. Again, when I conclude my presentation, I will bring this domain back on why this is important for us to remember. But those were very sobering slides. But is it always that the country who spends most of their GDP on healthcare? Look at the United States, 31st in terms of life expectancy, but it spends the most in terms of their GDP. It's somewhere down in the 48th rank over there. We spend just $290. US spends around $12,000. The average is around $4,000 to $5,000. So what it's actually telling us is that we need to be more efficient. We have less resources. So efficiency parameter is very, very critical for us. And we cannot while away our resources doing pilots again and again and again and sharing our resources with multiple testing multiple models. So we have to focus on efficiency over here. So far, I mean, we've been talking about is it that big data analysis leads to any revolutionized health benefits? The answer is no. We do not have any such. It's all been in terms of promises. Yesterday, the person from AWS he was mentioning about the low fruits. What we have been critically covering, I think, is largely the low fruits. The higher fruits, we actually can say that the health outcomes have really changed. We do not have any proof. Is it only my saying, or what does the industry actually say? Okay, so the most of the utility has been on the green boxes that you're seeing, but when you talk about new drug discovery, better disease understanding, better understanding of risk factors, we are nowhere there changing disease patterns. Yeah, I still feel, I mean, the previous producer, he said, Rajesh said that we have passed the hype cycle. I would disagree with that. I think we're still in the hype cycle. Again, it's important again for us to be cautious because early adopters, education system in Denmark adopted AI for their education system. They've gone back to the traditional methods of teaching now. So we need to be cautious again in terms of how quickly we implement AI. So this is what most the adoption in the United States has also been not very good. Most of them believe there is a promise, but they're very, very not taking the risk in adopting AI. So what do actually patients feel? Patients do not trust. Like somebody else was also mentioning, 70% of patients feel that they would rather have a human interface than AI. And if you see that they feel that the medical education, the health sector is adopting AI in a very, very rapid manner without understanding the risks of patients themselves. So again, on the patient side, we need to be cautious. Mr. Madhukar was mentioning, okay, there are multiple steps to creating an AI model. The very first step, I think, the standardization of images. To me, retina means images. Talking about unstructured data, that would be more of the written text, but for image, standardized images that are important, and we do not have standardized images. That's very, very critical. Before we accept any software as a medical device, we need to understand the quality of the images that we use to develop the model, and that we do not have standardized models there. I'm glad that we are just moving. Yeah, so I'm glad that the ICMR has taken an initiative to create an Indian image data standard set. They're working with ISE, and I think this will be very, very critical because the one that's put up on the net. So this will be a useful way for developing our models. So in ophthalmology itself, I mean, there is a blindness is considered the second most frightful condition after death itself. Okay, so blindness, we would like to reduce blindness, and 90% of the blindness from diabetic retinopathy is actually preventable if you screen them on time and you give them good treatment on time. The other conditions, like we spoke about cataract yesterday, I'm not too particular about AI and cataract or the corneal diseases or in glaucoma, essentially because there are simpler ways to detect these conditions. And I would not like to put my resources there in conditions where there are alternate, simpler methods that can succeed. So the focus essentially again would be on the posterior segment disorders, not because I'm a retina surgeon, essentially because you cannot see those conditions. It can go on silently behind. So I would like to focus on retinal uh, disorders like diabetic retinopathy, age-related macular degeneration. And if you look at all the FDA-approved devices for ophthalmology, there have been 10 devices. Most of them again have been posterior segment disorders, diabetic retinopathy, and age-related macular degeneration. Yeah, so diabetic retinopathy itself, the most recent survey said there are 101 million diabetics, of which 17 million are likely to have some form of retinopathy, and of which about 40 million there are going to have different diabetic retinopathy. So again, it's going to be very, very important that we prevent these patients from going blind. And between 1965 and 2025, India has added 28 years of life expectancy. So in 1965, our life expectancy was 48, and now it is 75. So obviously, the age-related disorders like macular degeneration, cognitive decline is going to be more and more. And in cognitive decline, I'm talking about that in retina because retinomics is a field where we could actually predict, say, 4 years' time, about two-thirds of the development cognitive decline and take measures accordingly in reducing the risk. So we've also been studying on the phenotype, genotype. That is, we have a lot of inherited retinal disorders amongst us, and the genotype costs a lot of money. Each sample costs around 8,000 to 10,000. So if AI can see the retinal image and they predict the likely genotype, it is likely to reduce the cost of genotyping that's there. That's something that's recently initiated. The second is we're working with the team Emory University, the PCARS brain study, and we recently initiated one in the Indian cohort itself. Yeah, so the Madhunetri AI, we've gone through some of the steps. We've got the Tedesco approval. Again, here one word of caution is some models have already been deployed in the population without proper regulatory approvals. I'm not very sure if that is not admissible, but some of them have collected data without SEDESCO approvals or regulatory approvals. So we've gone through the right process. We've applied for that. We've got that. It's an agnostic device, device agnostic device. So you can use it on any camera. It's not that you use one particular camera. You can use any fundus camera that is there. So the process is the same, but you take the fundus image, you upload, the AI interprets it, whether it's a mild, moderate, severe grade neuropathy, and then it tries whether it's very severe, it goes into a ophthalmologist. So, and the model also, we had around 35,000 images that we annotated and we curated. That's one of the largest data sets that we've used in India so far. So, like I said, you can use that you want, and it's not necessary that it's a particular company. So this is the interface, user interface, like most other AI devices. So we have evaluated this model both in retrospective studies, in community data sets, in the AIMS data set, in the open data sets, open source data sets, and all of these is performed very well. Again, the technical team at Vadvani AI has been instrumental in creating this model. In the prospective model, we had around 2,500 images collected from the community set, and there too it performed pretty well. Yeah, so here again you see a 98 or 90% sensitivity and specificity. So it's performing very well even in the field situation too. Yeah, so we've had a couple of publications, published text publications. Yeah, so we've so far deployed it in 38 sites across 11 states. We're looking at pan-India deployment, and again that we need that we need support from the ministries. So whenever we talk about all of these devices, there are challenges. We have to deploy this with lack of hardware. Most states do not have these fundus cameras. There are lack of workers. So the nursing staff, I feel, is a big strength that we can have. The permanent staff to use these devices. And the most important to me, which is not addressed, is what after the diagnosis. Now we made the diagnosis. That's only the first step of care to get a patient to do after that, and we need to create a network. We cannot do it in isolation or in silos. That we create a model, then we're going to create a network with ophthalmologists, with retina specialists. We need to do that in tandem. And only then will AI keep changing outcomes. Yeah, there are some innovative methods that we have described from our center. The hidden cost, again, this I think nobody covered the hidden cost over here. You'll see that Meta and some of the companies are actually investing in outdated or trying to revive some nuclear reactors, electricity consumption, extremely high these hidden costs. So it may come out as being free initially, but then again, the end user is the one who's going to pay for all this. So whether it's going to be actually equitable, I'm not really sure. So this is my concluding slide, and I'm hoping that whatever we do is going to be safe, efficient, effective, equitable, and patient-oriented. So which, like I said, remains the promise. It's only going to be maybe 3 years, 5 years when we look at the outcomes and say whether the traditional methods, we need to actually have the traditional methods going hand in hand with AI, not in isolation. So thank you. Thank you so much.
Thank you very much, sir. So the message is that now that world has invested billions and is planning to invest trillions for the development of AI, the AI should at least start reducing the cost of medical care globally. I thank you, sir, and I invite you once again because you have a train to catch. So I invite Ms. Neha Jain, Special Secretary, Department of IT, to hand over a memento to sir. Next, I will invite Professor R.K. Dhiman, Director SGPGI Lucknow, to the stage. Thank you.
First of all, I will thank Mr. Rose IAS for inviting me to this opportunity. And I'll be talking about the roadmap of the UP in the next 5 years. I am happy to tell you that we have been working on the AI in our institute, Sanjay Gandhi Postgraduate Institute of Medical Sciences, and we want to make it totally AI enabled also. So we have some experience in that direction also. And what we have planned for the phase one. As far as the roadmap for the Uttar Pradesh is concerned, there are several opportunities. First thing is that we have 25 crore residents across India's most populous state, that is Uttar Pradesh. It has 42 government overall, 81 medical colleges, and 75 district hospitals. It is very important if we are going to plan the AI-enabled hospitals or the medical colleges in Uttar Pradesh state. And there is already a digital foundation that is ADBM, Ayushman Bharat Digital Mission, and we have 5 crore ABA IT office. And we have the annual budget which includes the budget for the AI also. And we have the national policy momentum like India AI Vision, APDM, ICMAP guidelines, and many more. What makes 2026 the optimal moment to the launch comprehensive AI integration across the state of the UP? Because it is the convergence of the healthcare infrastructure readiness and policy framework and the political will. All is there. But it's the right time that we have to take on the AI. So what should be the strategic vision actually for the state of the Uttar Pradesh? We know everything about as far as the medical industry is concerned. Already told also, Mr. Ghosh, that we should have the AI based diagnostics. How can we diagnostics and we can increase this thing by 100%. And the predictive disease services is very, very actual rural might increase, it may increase 1.5 times the detection as well as the workload would be halved by using the AI in this setting. And telemedicine and remote monitoring, that is important. You all know the maternal and child health. If we are using it, then we may decrease the maternal mortality and the infant mortality. For the cancer detection, trauma.
The critical care is very, very important. During the COVID times, the most of the patients, they are referred to the institution. And I tell you very frankly that one of the patient, I just give you the example, referred from the Agra, needing the dialysis with the COVID, and he died.
That the capacity building for the ICU should be at the multiple places. And those places, I would say, they are the medical colleges. We are having the 81 medical colleges. And I am going to tell we acting as a hub at the 6 medical colleges for the Gorakhpur, Kanpur, Prayagraj, similarly Jhansi, Agra, and the Meerut. We are having the 24-hour monitoring over there. So those patients who are being referred to the SCPs, they are admitted over there, and we stabilize them. Many of them they improve, otherwise they are shifted. So this kind of the system, I would say, that
important for the state of the Uttar Pradesh. Because that is the need base that we require at the moment. That is the need at the moment. And another is the trauma also. Why I'm talking to trauma also? If it is nice, AI enabled, we have level 1 ACM. And I've come to know there are at least 2 or 3 brain dead people out there. And we are not making any connection for them.
Not only the KPMG, maybe many other medical institutions in the Lucknow or nearby, if they are made the AI enabled, so we can detect which patient is going to have the brain also and likely to be the organ donor in the future also. I think this is the one applicability that is the need.
And one such statistic I specifically like to tell you that we must be empowering the frontline health workers with the digital tools. And AI is not something that you will attain overnight also. I think the graduates at the level of the MBBS, at the nursing staff, at the level of the students, I think they have to be taught about the AI also so that they can become a part of the AI force of the Uttar Pradesh. We need private-public partnership also. We will get from others.
So my proposal is similar to what, as Mr. Ghosh has told us, that is the three-phase implement done as Sanjay Gandhi. And we have submitted our proposal to the government, and it was a proposal for the 550 crore for this pipe. So similarly, we have made this three-phase proposal implementation roadmap also. The phase one is basically the foundation. Objective is build foundational structure, establish expertise, and align stakeholders. That is very, very important for the phase one. We must build digital health worker bone, a backbone. There should be the artificial readiness assessment across all the 75 districts also. And there should be some center of excellence also. It could be any actually, our center also, maybe the IIT or maybe VHU, other things. And we must align or define the Ayushman Bharat digital mission infrastructure that is in all district hospitals. And I have already told you that is in the phase one. We must start the tele ICU on a hub and spoke model, at least at 20 medical colleges and the district hospital. I would say it was 10-10 actually, but we must have the experience of the AI enabled tele ICU district hospital also. Basically, outcome would be the foundational system operational and stakeholders, they would be aligned also, and the technical expertise would be established. And the two is basically similar to the system what Mr. Ghosh has told. I am not going to elaborate on this much also, but I would say that there should be some pilot studies on AI diagnostic at least in they could be related to the any title actually. And here I would re-emphasize also in phase we must consolidate tele-IC project also, and the AI industry trauma center also must at least tele-IC project in 50 medical colleges and the district hospitals. Outcome would be that whatever is the relative efficacy would be proven, workflows would be optimized, and donation will and we are basically concentrating on trauma enabled AI, AI enabled trauma. Phase 3 would be from 2028 to 30. It is basically the expansion phase, which must achieve universal coverage in this section also and build sustainable innovation ecosystem also. We must scale up AI diagnostic to all 75 diagnostics also, and we must have predictive and preventive healthcare system also, which is also AI enabled at that time. And lastly, I would like to say, further I would emphasize that this subject should be now to all medical colleges and to all district hospitals. And the AI in trauma center, it must be enhancing the organ donation, not in the state also, so that the transplantation, solid organ transplantation, uh, must be increased in our state to meet the demand of the increasing uh, organs for these patients who are suffering from the multiple organ failures also. With these, I would like to stop here. Thank you so much once again for the invitation. Thank you.
Thank you, Dr. Devan, for letting us know various innovations and implementation of AI that you are planning to do or are already doing in the Institute of AI. Now I invite Professor Manish Agarwal, Director IIT Kanpur, to share. Thank you.
Good afternoon. I know that this session is getting a little delayed, and my discussors have already spoken in detail about multiple aspects of AI in healthcare. So I'll limit myself to the technological perspective. Coming from IIT Kanpur, that probably also gives great. But before I start, there is one thing that Dr. Dhiman said that scared me a bit. He talked about using AI to train dead people so that their organs could be used. So I worry if the AI gets developed and it gets applied to directors of various institutions, if their organs will start getting harvested. So that's something that we really need to include. All right. So jokes aside, uh, from the perspective of applying AI as a tool in the healthcare domain and in India, where you have large population, uh, resources are not so freely resource constrained in India. So any AI solution is to have multiple properties in order for it to scale. First, it must be cost effective, and the previous Dr. Venkatesh had provided some information about hidden cost of using AI, likely to be very high. Second, when we are using healthcare data, again, as previous speakers have emphasized, that the data privacy and security are most important, because inappropriate use of data can lead to very unpleasant consequences. Third, connected to being cost effective, that the solution, uh, particularly the inference engine for the hair, must be available on the edge. By edge, I mean handheld devices like smartphones, kiosks, which have limited power, limited memory, but they should also be able to run the inference, because everything in a centralized fashion, that's not really. And of course, it goes without saying that solution should minimize. Today we do have solutions, especially in diagnostic and predictive uh, usages where the error is quite low. Of course, it requires at times heavy compute. In order to achieve all of these requirements, one one of the three most critical things is collection of data across the primary healthcare centers and the screens. Uh, the collection and the data needs to be of reasonable quality, also needs to be uh, designed so that it can have appropriate. There needs to be an internet connection so that it can be appropriately loaded into a centralized repository where the, uh, some significant compute power available which can just that data and update the model so that it for inferences. Then for inference side, I already mentioned that it has to be available on the edge, so it has to be a very lightweight inference engine that needs to be created. When the data is traveling back and forth on the internet in various devices, systems, the privacy and security needs to be maintained. Very importantly, for the use in India, it has the model that we use needs to be trained on Indian data. Taking a model which is trained elsewhere and trying to adopt in India, especially in healthcare, is a not thing. And I'm no doctor, but those of you who are will know much better than me that from region to region, the uh, body behavior, the genetic behavior. So these are the technological challenges that are in front of us. We don't yet have complete solution to these challenges. It's all partial solutions available. On one hand, we have this compute guzzling models like LLMs, major centralized compute engines, which all the input get uploaded and their inferences are then put back to your device. On the other hand, we have very tiny models which could be sitting on the edge devices and providing direct inferences, and their efficacy is not so good. Need an intermediate sweet spot where while maintaining the accuracy, we still are able to in a cost. Now, in some of these aspects, IIT Kanpur as an institution has been working on uh, in terms of doing R&D work and also in terms of with the government. Just take some examples which seem to be of interest. One is creating a digital health stack, which is being created for the state of Uttar Pradesh in partnership of both with the government of UP and the National Health Party. And the idea here is just create pipes to collect all the data from everywhere and clean up that data in a privacy preserved way, secure way, give it a platform on which then applications can be built from. When it comes to collection of data, there are many challenging issues that one has to address because data is held by different entities and different kinds of. There are primary healthcare centers, there are small hospitals, there are large hospitals, there are a lot of private players, individual doctors. Each one has some amount of data. We need to collect all of it. Question. There are some government entities that can mandate that you have to provide. Then in private entities, how to collect data? Because they will be concerned about privacy of the data because the patient likes to start that his or her data is made public. At the same time,
very hard to force them to share the data. There needs a mechanism which is incentive created, which will that they will first have confidence that the data privacy is maintained, and second, that if they share the data, they will be to benefit. And that's another project which is being done at IIT National Health Authority, that and in a platform created with the proviso that if an entity uploads data, fresh data, then that entity gets certain credits of inference. The entire data set which is being collected from all these resources, inference can be run by that entity with uploaded data for fixed to a certain period, so that there is a natural incentive built into the system. And, they can be motivated to sell. Then the other aspect, which is creation of a lightweight inference engine, remains a area of active research. For specific types of work, we need to have lightweight engines. But for uh, many domains, many types of inferences, we still are unable to find that. So that remains a huge opportunity as well as challenge. And worldwide, researchers are working on it, trying to find better and cheaper solutions. In terms of cyber security, also a very, again, some previous speakers have mentioned that it's a very crucial aspect of integrity of your data that is in the digital world. Again, IT Kanpur has certain expertise in that and has been providing uh, services of security audit to various entities, as the security operations center defined with various entities. This is another aspect that the institute has been working on for a while. And finally, when you speakers talked about the Vatmani Foundation, who have been a major player in the AI space, have been working with various government entities. Last year, IIT Kanpur entered into an agreement with the Vatmani Foundation, and through a significant contribution by them, we have now initiated a Vatmani School for AI and Intelligence System at the Institute. And all this is activities that I just shared with you come under this umbrella now. And there is an additional partnership which we are putting more resources and effort into creating this solution. And I hope that we can strengthen our partnership with the medical colleges like CPTI, KPMU, and others to develop better and better AI-centric solutions in for development in this way. Thank you very much.
Thank you, Professor Mani. And as you said, you are no doctor, but then you are the only engineer who is part of the health advisory team of Honorable C. And we cannot forget your regular contributions, your very deep prediction models during the COVID period, in the long meetings that we had, during long meetings that we had. Thank you very much. And now, the state of Uttar Pradesh means business, and what better to prove it an exchange of an MOU. So I invite Alpan Rawal from Vadhani AI to exchange a MOU with Government of UP on implementation of centrally adopted AI programs activities in the state of Uttar Pradesh. Thank you, ACS sir and Alpan and team Vadhwani AI. Now I will invite Swati to come on stage and take it forward.
बहुत बहुत धन्यवाद करना चाहूंगी यहाँ उपस्थित सभी अतिथिगण से निवेदन करूंगी एक जोरदार तालियां हो जाए मंच पर उपस्थित हमारे गणमान्य अतिथिगण के लिए कार्यक्रम को आगे बढ़ाते हुए मंच को सम्मानित करने के लिए आमंत्रित करना चाहूंगी एक जोरदार तालियों के साथ डॉक्टर रत्न आरपीएस सुमन सो को डीजीएमएच उत्तर प्रदेश के वो मंच पर आ जाए एक जोरदार तालियों के साथ ही साथ मैं आमंत्रित करना चाहूंगी श्री उत्पल कुमार एमडी यूपी एमएससी आपसे पर आ जाए साथ ही साथ लाइक Neha Jain, IAS Special Secretary, Department of IT and Electronics, गवर्नमेंट ऑफ उत्तर प्रदेश। देवियों सज्जनों, कार्यक्रम को आगे बढ़ाते हुए मैं निवेदन करना चाहूंगी डॉक्टर रतनपाल सिंह सर से कि वो सम्मानित करें और इस मौके पर बच्चों की जोरदार तालियां जाए श्री अमित कुमार घोष सर, ACS एजुकेशन, गवर्नमेंट ऑफ उत्तर प्रदेश। एक जोरदार तालियों के साथ मैं चाहूंगी जोरदार तालियां हो जाए श्री अमित कुमार घोष सर के लिए बहुत बहुत धन्यवाद करना चाहूंगी सर, आपने इस कार्यक्रम में अपनी उपस्थिति दी। मैं निवेदन करूँ श्री उत्पल कुमार सर से कि सम्मानित करें श्री अनुराग यादव सर, IAS प्रिंसिपल सेक्रेटरी, इंफॉर्मेशन टेक्नोलॉजी एंड इलेक्ट्रॉनिक्स, डिपार्टमेंट ऑफ IT एंड इलेक्ट्रॉनिक्स, गवर्नमेंट ऑफ उत्तर प्रदेश। सर बहुत बहुत धन्यवाद करना चाहूंगी कि आपने अपना कीमती समय इस कार्यक्रम में दिया। मैं रिक्वेस्ट करना चाहूंगी स्नेहा जैन मैम से कि वो सम्मानित करें श्री मधुकर भगत, ज्वाइंट सेक्रेटरी, ई हेल्थ, मिनिस्ट्री ऑफ हेल्थ एंड फैमिली वेलफेयर, गवर्नमेंट ऑफ इंडिया। बहुत बहुत धन्यवाद करना चाहूंगी सर कि आपने अपना कीमती समय इस कार्यक्रम में दिया। एक जोरदार तालियां हो जाए। साथ ही साथ मैं निवेदन करूंगी, मैं रिक्वेस्ट करना चाहूंगी डॉक्टर रतनपाल सिंह सर से कि वो सम्मानित करें डॉक्टर हरप्रीत सिंह जी को। हरदीप सर, आपका बहुत बहुत धन्यवाद करना चाहूंगी कि आपने इस कार्यक्रम में हमें अपना कीमती समय दिया और इस मौके पर मैं चाहूंगी एक जोरदार तालियां हो जाए। बहुत बहुत धन्यवाद इस कार्यक्रम में अपनी उपस्थिति देने के लिए। मैं रिक्वेस्ट करना चाहूंगी श्री कुमार सर से कि वो सम्मानित करें डॉक्टर आके दिमन, डायरेक्टर SGPGI लखनऊ उत्तर प्रदेश। और इस मौके पर मैं चाहूंगी एक जोरदार तालियां हो जाए। बहुत बहुत धन्यवाद करना चाहूंगी सर, आपने अपना बेहद कीमती समय इस कार्यक्रम में दिया। I would like to request Ms. Neha Jain to please state Dr. Maninder Agarwal, Director IT कानपुर। बहुत बहुत धन्यवाद करना चाहूंगी सर, आपने अपना बेहद कीमती समय इस कार्यक्रम में दिया। इस मौके पर मैं चाहूंगी एक जोरदार तालियां हो जाए। I would like to request all the esteemed dignitaries कि वो आगे आ जाएं एक ग्रुप फोटोग्राफ के लिए। I request all the esteemed dignitaries कि आप सभी लोग आगे आ जाएं ग्रुप फोटोग्राफ के लिए। इस मौके पर देखिए सज्जनों, मैं चाहूंगी जोरदार तालियां हो जाए मंच पर उपस्थित हमारे अतिथिगण के लिए। For all our esteemed panelists seated on the dais right now, let's have a big round of applause all together. I request all the dignitaries to please join us for the group photograph. देवी और सज्जनों, बिना किसी विलंब के मैं चाहूंगी जोरदार तालियां हो जाए मंच पर उपस्थित हमारे अन्य अतिथिगण के लिए। Ladies and gentlemen, let's have a big round of applause for all our esteemed dignitaries standing on the stage right now. Thank you so much. Once again, I request Vikas sir to please take the podium and invite our other panelists. Thank you so much.
I will request all the audience to stay put because we are going to have a very important, interesting session on harnessing AI for new and emerging healthcare challenges. I will request Ms. Neha Jain, Special Secretary, Department of IT and Electronics, the moderator for the session, to take the session forward. Thank you.
I have this placard in front of me that says, "Be quick, please." And I always have this honor of getting the session before lunch and having to complete it in time. But this is a very important session. Distinguished secretaries, respected clinicians, innovative colleagues. Um, there are debates and ethical dilemmas that we fight on a daily basis when we speak of AI adoption in healthcare specifically, whether we should collect data, how we should collect data versus privacy of data, PDC at all. And then there is a second dilemma which we face whether we should do pilots because when we try to do something new, then we have to start with pilots versus longer term policy changes. And then there's a third, clinical decision support system पे जाएं, human intelligence पे जाएं, किस पे जाएं? There is a dilemma between that. And would want to mention that we as individuals have a tendency to really minimize or individualize our experiences rather than thinking of our system. तो अगर मैं AI की बात करूँ, तो आप सभी पहली चीज जो सोचते हैं कि right? So you're thinking of ChatGPT alone, which means that you are thinking of efficiency gains only for yourself. But आप लोग यहाँ पे जितने भी लोग बैठे हैं, I'm sure you lead an organization, you lead a medical college, you lead a team of people. So you have to think of efficiency gains not just for yourself, but for the staff and your entire organization. And this session is going to actually talk about the predictive analytics and how we can harness AI for new and emerging healthcare challenges, a topic that will define how we respond to rising health risk, widening access gaps, and growing expectations for timely, high quality healthcare. Basically, when we talk of AI and we're talking of what प्रॉब्लम टू सॉल्व अभी हमारे सामने एम्स दिल्ली का एक बहुत अच्छा प्रेजेंटेशन हुआ जहाँ पे सर ने बात करा डायबिटिक रेटिनोपैथी पे और उन्होंने बोला वी शुड नॉट वेस्ट रिसोर्सेज इन कैटरैक्ट डिटेक्शन एंड ग्लाउकोमा डिटेक्शन बिकॉज देयर आर सिंपलर मेथड्स फॉर इट तो कहाँ पे एआई लगा है क्योंकि अब इस कॉन्फ्रेंस से जाने के बाद हर किसी को ये लग रहा होगा कि वी शुड अप्लाई एआई समवेयर बट वेयर टू अप्लाई दैट बिकम्स अ चैलेंज बिकॉज you would want to do it, but whether you are actually, wasting those resources, आपको बताया कि इतना compute लगता है, इतना electricity use होता है, so are you actually wasting those resources? So maybe this session gives you some understanding of public health priorities because there are rapidly changing realities. We are talking of NCD, like we're talking of cancer, various types of cancer. We're talking of mental health conditions, lifestyle-related diseases, and late stage diagnosis. जैसे कैंसर अगर लेट स्टेज में डिटेक्ट हुआ तो कैन बी गिवन अर्ली डिटेक्शन राइट एंड एट द सेम टाइम द एनवायरमेंट has changed, the environment related health risks have only increased from air pollution to heat stress to the now recent in the news water contamination and climate linked repository and respiratory and cardiovascular conditions. So the gamut is really increasing. Maybe if you're a specialist, you'll think of only your domain. As a public health practitioner, which all of you are, we have to think beyond the individual experiences that we get and AI and could be used to understand the patterns and the future, right? When we talk of AI and then we say ki it is just digitization. It's not digitization. We have to make sense of the data we have. We have to have systems which interpret risk, which prioritize action and which support timely decisions. हम districts की बात करते हैं तो that poor lady Asha is burdened with so many apps and data which she has to fill. But the access to oncologists, psychiatric care, psychiatrists, pathologists, and radiologists remain limited at the ground level. यहाँ पे इस कॉन्फ्रेंस में अभी सुबह एक स्पीकर ने बोला कि आशा कितनी है. We're talking of quaternary care, closed door meetings and metro cities. But what about those primary health care जो givers हैं, जो underserved areas हैं, वहाँ पे हम कहाँ तक पहुँच पा रहे हैं? And how can AI actually help us? So rather than thinking of AI, and there was a discussion that during our preparation meetings that this is AI versus health. Because अगर AI है तो health नहीं है. We should look at how we can actually use the advantages of AI to deliver better public health outcomes. There are a lot of esteemed speakers which will deliberate on this matter. But I would want to emphasize that as हमारे respected CM ने he spoke yesterday, that AI must be human-centered by design, transparent, culturally sensitive, and respectful of the patient's privacy. So अभी तो DPDP Act आ गया है, the consent has to be taken before you process anybody's data. But otherwise, also if the patient is not willing, it will be unethical to actually use the data of a lot of तो आप एक्सरे ऐसे ही यूज कर दे रहे हैं अपने डेटा एनोटेशन के लिए तो क्या आपने उसका कंसेंट लिया था जिसका डेटा आप दे रहे हैं so health can no longer be viewed in silos. There is a one health approach which needs to be followed, which recognizes the deep interconnection between environmental conditions, and the broader ecological factors. It is becoming increasingly important, and the answer to this lies in the cultures, the ancient cultures of the world. When we talk of oneness of body and mind, there is a concept in Japanese which is called Shikishin Fumi. Shiki is body and Shin is mind, and Fumi is Shiki, Shin, Funi. Body and mind are not true, which also reverberates what the Indian culture tells us regarding yoga, where yoga is actually a what Angrezi wala yoga bolte hain, it's yoga. But yoga what? It's the union of the body and the mind to achieve harmony. So how can we use this backing this cultural legacy that we have to deliver a one health approach is something that we will also deliberate in this discussion. Thank you so much. I will want the MC to now introduce the speakers.
Thank you very much, ma'am. I'm very happy to, see that some focus on health approach as well, because that is my department's key focus these days. I will now invite Shri Madhukar Bhagat, who is Joint Secretary for e-health in the Government of India. Sir will be delivering his keynote address. And simultaneously, I will also like to invite Dr. Lakshmanan S., who is MD NHM Assam, and Shri P. Uday Kumar, who is Chief Executive Officer for Arogya Healthcare Trust, Telangana, Shri Anant Dwivedi, CEO, State Health Agency, Jammu and Kashmir, and also MD ABDM, J&K, Professor C.M. Singh, Director, RM Institute, Aditya Vivek Patekar, Director and CEO of Plus 91 Technologies, and Dr. Ajay Singh, Vice Chancellor, CEPI.
Very good afternoon to all of you. I'm here again, and we are again talking about the same topic, but the focus this time is going to be different. The focus is now on the harnessing the power of AI for the emerging new challenges. So I have already discussed in the previous session. I hope most of you were over there. That look in the central government, we had this MOU with Wadhwani AI almost 5 years back. We were one of the earliest to establish 3 centers of and we were able to work on certain areas of emerging challenges. Now, if my presentation is ready, no problem. So, how did we go about that? I've already discussed what's the road ahead, some of the lessons that the states can take. We have already mentioned about the significance of the standards, about the ethical guidelines, the approvals, as well as the cybersecurity. But now the focus is that what are the challenges which can be sorted out? Here, my focus will be on the experience of AI in health, in central government, and some of the challenges. But these will be only generic in nature, indicating that there are many other challenges of similar nature which can be sorted out, which can be helped by AI applications in the field of health. So, as far as if we see this particular slide, here I'm talking about that we have the e-Sanjeevani platform and we have the integrated health information platform, we have the diabetic retinopathy solution, we have the ICSA solution. Now, the e-Sanjeevani platform, we have launched a clinical diagnosis support system. About e-Sanjeevani platform, this is a telemedicine platform which was launched pre-COVID and post-COVID. There were 2 modules in this, and it is the world's largest telemedicine system, which has provided consultancy to online system of more than 43.5 crore patients in the last 5 years. Every day, almost 4 lakh patients across all districts of the country are being consulted on the Sanjeevani platform. UP is the biggest centers given the highest population. And therefore, AI riding on that can be a game changer. Now, what does this clinical diagnosis support system do? And therefore, to a category of AI solutions, which will be the CDSS based on the symptoms which are being given to the ASHA workers at the spoke level. The data is being fed in the system, and that data is going to the AI systems. And at the head hub level, the doctor can see based on those symptomatic presentations what are the probable diagnosis or the differential diagnosis, and it gives three possible solutions, three possible diagnoses. And therefore, in a way, it is keeping uh, in check what is the possible diagnosis that the health service provider is actually giving. We have gone ahead with a survey, bring out the efficacy of it. At outset, this solution may appear what is the need of it, right? However, it shows that there is a reliance of the health service providers as far as CDSS is concerned, and therefore this brings to you one category of solution which is an analytical solution. By an analytical solution, what AI is doing, it is picking the data, it is capturing the assets, it is comparing with the existing data sets, and it is based on the diseases which have been presented, trained on the diseases which have been presented on that platform, which is the eSanjeevani platform. If I look at the second solution, media surveillance of the disease, it is a crawler. Now, what it's doing is that every day it is crawling through the data, and it is picking up through AI-based algorithm which are the terms which are relevant to me, and then it is bringing out the relevant news items. That news item is being fed at the integrated health information portal of the government of India, and that information about the disease outbreaks is being consumed by all the states. Now today, based on that, I prepare every day, my team prepares every day a small digest which I circulate to the National Medical College Network. And what is of significance as of yesterday today is that at AIIMS Kalyani in West Bengal, two Nipah cases have been detected. And therefore, it brings us very quickly that particular relevant information which would have taken time to travel, and where acting very quickly is extremely important for the epidemic outbreaks, for the pandemics, or for the local disease outbreaks which may be taking place. For teams of doctors to immediately rush to, for the center to be activated, for the state solutions to be activated, and therefore it presents another category of AI solution which is based on crawling. If I have a look at the diabetic retinopathy solution, which Dr. Pradeep in the previous solution made, then this is an image-based solution. Where the AI has been trained to learn a particular image, a characteristics, and then to look at whatever image is being presented to me, that okay, is the characteristics matching? And in the Nikshay, we have got three platforms. First is the line probe assay, which is helping in diagnosis, which is again an image-based. Cuff against TV. This is sound-based. So AI is learning the sound, and from that algorithm, trying to predict that if the cuff is like this, then is there is a possibility of the person suffering from TB. So what I've tried to give over here through this single slide is that how across the spectrum of diseases ranging from information, insight, policy making, early detection of outbreaks of pandemics and diseases, to finding solutions pertaining to triaging as in case of Nikshay, as in case of diabetic retinopathy, AI can play a very important role. Time is of essence. There is not many other solutions. I can keep on talking, but it's important that we go ahead. Thank you so much.
Thank you, sir. And now I will request Sneha Jain, moderator, to take the session forward.
Hello. Thank you. Thank you so much, sir, for your keynote. And I will get back to you with more questions. But we have Professor Dr. Ajay Singh with us, who is the Vice Chancellor of Uttar Pradesh University of Medical Sciences, CEFI. And he has to go somewhere, so I'll just ask, because he draws a lot of experience and it's one of the opportunities that we have. In what ways, if I may ask you a question, continuing from the keynote where I started, from the background that I started, and in what ways do you think, from your experience, can AI support early warning systems for non-traditional health threats, such as जैसे अभी heat stress हो रहा है, air pollution, vector shifts. So, your thoughts on that?
Thank you very much. At the outset, I'm grateful for this opportunity and sharing my views. You have raised a very relevant and significant question, and it is very, very relevant in the present scenario because we are talking about more of human health, and we are forgetting that we are in the era of One Health. And One Health is a broader concept in which we are not only talking about the human lives and the diseases which are affecting the human beings, but also how our life, our health problems are being affected by other factors of the environment, including the air, soil, and water pollution, as well as what about the conditions which are affecting by these pollution as we are having the grains which we have to consume, our animals has to consume, and how the interaction in the villages, rural India, the human beings and the animals are living in the same place, and we are having many, many things which are common and affecting each other. If we are not talking about all these things, then maybe we are not in a comprehensive mode as far as our AI concept is there. So I'm really happy that you have included this concept to this session, and AI has to provide some solution, if not the solution, at least the sensitization we have to produce as far as the interaction of various aspects of the environment are concerned. And it should be a surveillance, overall AI-based surveillance. What about the pollution, how much pollution we are having, what is the garbage parking area, how it is affecting our underwater solution, and how the air pollution is being affected by all these garbage. Because it is not only the physical garbage, but it is also the e-garbage which we are creating so much in our day-to-day life. So their effect, in long-term effect, would be something which we need research. We have to do more projects on this so that our understanding can improve. As a CEO and director, I'm happy to share that we have conducted a few projects which were based on the effect of air pollution on the human life as far as the workers who are working in the mines. And we conducted these things around the border between the Madhya Pradesh and the Uttar Pradesh. And we saw there is a different pattern of the problems which were occurring in the UP and which were occurring in the Madhya Pradesh. So there is something unexplored connection between the environment which are changing from place to place. So I think there is AI would be a very useful tool if we are focusing on that, and this will be only effective if we will start doing research on these aspects, and after the research, we can do the implementation. So early data preservation, data finding, registration of the data, all these are very, very important. We must recognize the problem and we must recognize the gap we are having in the existing.
So I would request to give the memento to sir because he has to leave.
Yes, so I'll request them to bring the memento because the Jason sir has to leave for safe. And thank you very much, sir, for your participation and your time. Thank you.
Hello. Yeah. So I'm not going to follow any order of seniority, and I'll just ask randomly. So I think everybody should be just prepared for what questions may come your way. But I would want to start with the person who's on my left, Anand, because he's the youngest and the most promising 21 batch of IS. Am I right? And he's leading the state health authority. सही बोला मैंने? State health agency, and he's the MD ABDM in Jammu and Kashmir. So he's traveled all the way. And will you please talk about how we talk about underserved areas? So what is the role of healthcare and how it can contribute in order to improve access to healthcare in the remotest areas? And what are the threats around privacy, sovereignty? What is your understanding of it? And since you are also leading two very important agencies which have a plethora of data, like both SHA and APA have a plethora of data. So how do you see that this data can help us gather any insights for future prediction in the new and emerging healthcare challenges?
Thank you, ma'am, for inviting me, and it's been a great learning experience for the past 2 days, listening to all the renowned speakers sharing their expertise and experiences. If you see the AI as has been repeated on multiple occasions, that it's an enabler. For example, there are two perspectives from which we can review AI. AI could provide us the solution to the problems that are existing, particularly, for example, serving the healthcare services in the remote areas, underserved areas, ensuring healthcare resilience. And on the other hand, it also provides us the opportunities moving ahead. So, for example, if we start with the problems that which the AI can serve in the areas that are not easily accessible, some of the major issues that we see in some areas would be related to the availability of the healthcare persons, availability of the healthcare services. Second, are those services accessible? Then the other issue would be the accuracy of the, for example, the reports that are being analyzed. For example, the burden that we have on the radiologists who are serving in remote areas. Then there is an issue with respect to the turnaround time. In what duration are those reports accessible? Are people able to understand? So AI has solutions to some of these issues which are primarily related to the delays in the healthcare service delivery. For example, the use of AI-enabled handheld X-ray machines, they serve as a tool whereby the X-ray services can be easily provided in the remote areas, and people do not have to move to urban centers. That also reduces the cost of healthcare service delivery at one place, and also it also leads to process these the X-ray handheld devices are AI enabled. So in that case, there's also a predictive sort of a reporting which is there. So the radiologist at one end can provide solutions is aided by the AI, the kind of what are the inputs the AI provides, and then also it leads to, so for example, if the radiologist has to go through all these scans which are available, as opposed to the use of AI, then the scans can be prioritized. Which of these scans is something which has to be dealt on a very emergency basis, as opposed to the other scans which can be dealt at a probably so which would lead to a lower turnaround time in the emergency service. Similarly, for example, even in the radiology, which is in the state in the UP of J&K, there are around 76 institutions which have been connected with radiology. For example, all of these places which are not having a radiologist, now these are able to send those scans and get an expert opinion from the radiologist through the use of AI-enabled radiology mechanisms. Moving ahead, for example, there was also a pilot study which was done with respect to the AI ECG platform. So all of those ECG scans, if they are having the aid of the AI mechanism, in that case, what could be a predictive sort of a analysis? These are the potential cases which require more emphasis. So AI in all of these situations serves as a tool which aids the at one end it reduces the burden to the already sparse healthcare professionals, and then it also improves the accuracy, reducing the turnaround time. On the other hand, if you see the opportunities which come from the perspective of use of AI, there's a lot of electronic health records which are being generated as part of the Ayushman Bharat and as part of the PMJY. So if in the longer run, all of these records be utilized, for example, it could be utilized for predictive healthcare patterns for individuals as well as community level. For example, if somebody here has been, based on the data that we have, based on the prescriptions that that person has gone through, it can raise alerts with respect to certain ailments that the person might be susceptible in the later age. And also from the perspective of the community health, for example, if there is some other incidence of disease which might be leading to we incorporate also the parameters such as the geographical conditions, the heat, stress, the temperature variance. So all of these data could be collated and then serve as a very good model for predicting what could be the potential risks related to the health crisis at a community level also. So AI in all of these situations can be used as a tool both at the individual and at the community level to be able to provide better healthcare services at reduced cost to get greater accuracy. So these are some of the things that I think AI can do. Thank you.
Thank you. Insightful and a lot of inputs around teleradiology and EHR. So now I'll move from the bureaucratic setup to the medical setup. So I'll request Professor Dr. C.M. Singh, who's the director of Manohar Lohia Institute of Medical Sciences of Lucknow, very prominent institute of Lucknow. Uh, Sir, because you have a medical college under you, what are the key, and also a hospital, very prominent. What are the key workforce role shifts required as AI begins to handle predictive analytics and coordination tasks? So AI इतना सारा आ रहा है, तो इंसान का क्या रोल में शिफ्ट रहेगा? Sir, if I can get some inputs from you based on your experience.
थैंक यू मैम, बहुत इम्पोर्टेंट क्वेश्चन पूछा आपने। मैं इसका आंसर दो एग्जांपल के साथ रियल टाइम एग्जांपल के साथ देता हूँ। हम जानते हैं अभी कोविड आया हुआ था। बाय द वे एट दैट टाइम आई वाज वर्किंग एज अ मेडिकल सुपरिटेंडेंट ऑफ ऑल इंडिया इंस्टीट्यूट ऑफ मेडिकल साइंसेज एट पटना, and AIMS Patna was 500 bedded COVID hospital having 100 bedded of ICU and 500 normal bed. First time I worked as a medical student of 5 years and total 12 years I worked in AIMS Patna. First time I saw a patient committing suicide in hospital while he was admitted. तीन सुसाइड हुए थे उस पटना में। मैंने उसके पहले कभी नहीं देखा ना बाद में देखा। उसका रीजन क्या था? उसका रीजन ये था क्योंकि हम लोगों ने रिस्ट्रिक्ट किया था उनके अटेंडेंट को उनसे मिलने के लिए। सिर्फ हेल्थ केयर प्रोफेशनल ही उनका इनसाइड केयर कर रहे थे, क्योंकि तमाम चीज़ें थी कि हम उनके जो नियर डियर है उनको ट्रांसमिट ना हो पाए कोविड, उससे बचाने के लिए। तो उस समय 3 सुसाइड हुए थे। तो जो ये रोल शिफ्ट की बात है मैडम, रोल शिफ्ट की बात तो है कि एआई के आने की वजह से बहुत सारा काम एआई हमारा कर देगा, खास करके जो हमारे रिपीटिटिव वर्क है, जैसे कि हमारे नर्सिंग ऑफिसर खूब सारे डेटा भरते रहते हैं, पर्टिकुलरली फॉर अगर NABH accredited हॉस्पिटल है लाइक हमारा हॉस्पिटल लोहिया इंस्टीट्यूट ऑफ मेडिकल साइंस है, lot of data and that require lot of time and lot of important time. Now with availability of AI, these kind of routine and repetitive work can be handled by AI, and healthcare workers can focus more on decision making and planning and patient care. Second thing is what I wanted to say by that first example कि उनके जब नियर डियर नहीं थे तो पेशेंट की जो मेंटल पीस है, पेशेंट को जो उसको लगता है कि उसको कोई केयर कर रहा है, वो मिसिंग था। दैट्स व्हाई दे कमिटेड सुसाइड। दूसरा एक एग्जांपल और उसी के समय देना था कि जब पेशेंट उस समय एडमिट होता था हॉस्पिटल में, तो हम सब जानते थे कि सब लोग पीपीई किट पहने हुए थे। तो स्टार्ट फ्रॉम वार्ड बॉय टू प्रोफेसर सब सेम पीपीई किट पहनते थे। रिपीटेड कॉल वार्ड से आती थी हमारे पास कि सर वो डॉक्टर साहब को देखे नहीं, हम कैसे ठीक। तो वो जो ह्यूमन टच है वो बहुत जरूरी है। तो एआई रोल तो शिफ्ट कर रहा है, और रोल शिफ्ट करने से फायदा हमें ये होगा कि डॉक्टर जो है अपना ज़्यादा क्रिटिकल थिंकिंग को यूज करेगा, अपना समय दे पाएगा और पेशेंट को। तो ये एक रोल शिफ्ट होगा। दूसरा रोल शिफ्ट में हमें जो करना है हेल्थ केयर प्रोफेशनल्स को, अगर मैं हेल्थ की खाली बात करूँ तो, कि सबको एआई लर्न करने की ज़रूरत है। फ्रॉम वेरी बेसिक लेवल में फ्रंटलाइन वर्कर टू पॉलिसी मेकर ऑल्सो, क्योंकि हम उसको लर्न अगर करेंगे तभी हम उसको अपने सिस्टम में यूज करके बेहतर डिसीजन मेकिंग और बेहतर पेशेंट केयर प्रोवाइड कर पाएंगे। तो सिंपली यही है मैडम, हमारा रोल तो चेंज हो रहा है और एआई हमें बहुत हेल्प करने जा रहा है रिपीटिव वर्क से, डेटा जनरेशन से, टुवर्ड्स पॉलिसी मेकिंग, पेशेंट केयर एंड more applying the more wisdom and knowledge to the treatment of the patient. Thank you.
Wonderful. So you mentioned a very important aspect of empathy in medical care. In fact, ये बात होती है आप लोग में से जो डॉक्टर्स हैं, फैमिली में डॉक्टर्स हैं, कई बार बहुत अच्छा डॉक्टर होता है, 15 दवाइयाँ लिख के दे देता है और एक भी मिनट पेशेंट से बात नहीं करता, वो तो बहुत ही बेकार डॉक्टर है। और कोई एक डॉक्टर होगा जो कि आपको बैठ के सुनेगा 5 मिनट, गिव यू टाइम, to your problem, आधी बीमारी ऐसे ही सही हो जाती है। तो all the doctors out there, first please take care of your own mental health, and then please, you know, once your glass is full, please outpour it to your patient. That is my request, sir. Because we spoke about COVID time, and then when we heard of COVID, then there were all these issues around multi-morbidity. So my next question will again go to the bureaucrat in the room, which is Dr. Lakshmanan S. Iris, and he's come all the way from Assam. So I think one round of applause for the very diverse panel that we have, representative from Government of India, J&K, Assam, Lucknow itself, and maybe probably some more states will also come in. So, sir, what role can AI play in addressing multi-morbidity and complex care needs that cut across programs and departments? Thank you.
First of all, thank you so much for the opportunity and 2 wonderful days. Lot of discussions, amazing insights, and of course, new thoughts and doubts. It was really 2 good days here. And one important point, what all the people were talking about is what is the impact and reach of AI. Basically, what I practically see is that we are at advanced level of data analytics, but we are still touching the very periphery of AI. Basically, we are now seeing more details about one patient and same details for many patients. Both these type of aspects are happening. For example, TB, we are seeing lot of patients, their X-rays are taken, similarities and differences are analyzed, and some kind of common diagnostic points are evolved. And now it becomes easier that we take the X-ray digitally somewhere, we send it to an AI center. It suggests that most likely it is TB or not TB. But when we come to a singular person, it is not that easy. Just for example, suppose a 50, 60-year-old person is coming, he is having an infection. Let us say pneumonia kind of infection. The first and easiest thing is to start an antibiotic. So the first chance is for that. But then, of course, medical diagnosis is like a thriller. Suppose the same person says that, okay, I have been having diabetes for last 10 years, 20 years, then simply giving an antibiotics is not enough. Management of diabetes also becomes a problem. Now, what next? Suppose the patient says that because of diabetes, I am having a renal function trouble as well. Then the antibiotics which is to be given considering renal clearance. So in that case, suddenly it becomes more easier to advise a injectable antibiotics than an oral antibiotic. So simply because of the multi-morbidity condition, and naturally with the increasing lifespan, most of the people have some of the non-communicable diseases which are of long term, and simple management of any case, any disease is not the usual thing now. Just for example, coming to TB, in the Nikshay portal, one important thing what we are using now is for differential diagnosis, where we see whether the patient having TB is already affected by another comorbidity, mostly diabetes, or say HIV, or say other chronic issues like alcoholism or smoking. And then the management of that patient changes drastically. And that means a very focused treatment for a singular person is possible with the application of AI. And at the same time, large scale planning for a larger community depending upon the outcome. So that is why I was saying initially that we are actually at a very advanced level of data analytics, but uh, this data analytics to AI, that gap is still, I think, under exploration. I'm sure these 2 days conference have thrown a lot of light towards that, and we'll be able to come up with solutions which really address multi-morbidity management and also give us a larger vision of the spectrum of issues which we have to resolve. Thanks.
Thank you, sir. Your deliberation reminds me of one important principle in AI, which is called objective function maximization. So AI may when you give and that's why AI is not as good as human intelligence because हम किसी को देखते हैं तो उसकी आवाज से हम उसकी mental health समझ जाते हैं. हम बहुत सारी और चीजें पेशेंट को देख के ही समझ जाते हैं जो आपको स्टेथोस्कोप लगाने की भी जरूरत नहीं पड़ती बिकॉज उसको ही डायग्नोसिस होती बट आपने डेटा कितना दिया उसके आधार पे आपका आउटकम आएगा दैट्स व्हाई ह्यूमन इंटेलिजेंस इज very important and we are talking of human centric AI development. Human in the loop is becoming important. So आप लोग की सबकी job secure है. You just have to upskill yourself a bit. So that's why multi-morbidity type of conditions because patient ने disclosure किया है कि नहीं किया है. That also becomes very important. कोई patient was not told that it is an AIDS patient, right? Secrecy रखने के लिए. But उससे कितना और उसका immune system weak हो जा रहा है. That those are things which maybe AI will not able to be solved directly in the first phase, but maybe as we mature, we draw from our input. So from the bureaucrat interview to the startup interview, I don't know whether Plus 91 is a startup with its varied experiences in both state of Bihar with the Bhavya platform and with their experiences in Africa. Can I invite Mr. Aditya Patkar, who is the co-founder and director of Plus 91 Technology? At Plus 91 is the their code, right? Plus one. I believe that you must be doing something in telemedicine. That's why you have this name, but I would want to hear from you. But the question is, how can AI help integrate health data with non-health data, like climate, morbidity, nutrition, environmental data, with the health data to inform better decisions?
Thank you, ma'am. So we work in AI in two fields. One is looking upward, which is AI helps us solve non-linear multi-factor problems like disease surveillance. The other is clinical decision compression, which is basically allowing doctors and frontline workers to make faster decisions given the resource crunch that is there. Uh, Health outcomes mostly don't start in the hospital. I think that's something that everybody understands and knows. It depends on what I'm eating, what air pollution I had to walk through today to get to work, what did I have to wait through water because there was heavy rainfall while getting to work late today. So all these factors are important, and AI helps us map these factors to health data that is already there to come out with insights. It's a pattern problem, and AI works best over there. Some examples in Nigeria, we worked with KNCV and TB Lawn, where we actually mapped out historical data for TB and current cases that were being reported to find spots where TB was not being tested and where was a high chance that there were TB patients there. And we actually saw progress from them being surprised to them planning better to them actually taking then proactive steps to avoid these populations from coming. In another African country where malaria was of high precedence, we took temperature and humidity data historically, along with our symptoms coming out of the public facility HMIS that we had, and actually started predicting trends, which allowed early decision making in terms of there is going to be a spike in malaria possibly now. It allowed them to buy medications early, which generally at the last minute it cost more to pick up in bulk, and obviously then outreach to help prevent things. The idea is to shift from post ad hoc reporting to actually early prediction of the problem. In Bihar, we have just started scratching the surface. We are getting data from about 12,000 facilities, 80,000 odd ASHA workers, as well as number of state and national level programs. We picked some simple problems to solve first. The first being tagging high pregnancy patients in rural areas and actually alerting the ASHA workers or the health sub centers to take better care of them. Anemia is a big problem in terms of pregnancy, especially in rural Bihar. Another problem, more on the administrative side, was actually taking rosters of doctors and optimizing them. It was not a clinical problem, but this was a major problem. And I know in one of the presentations it was mentioned that the time period went from 60 minutes to 45 minutes. That was in the second year. In the first year, it went down from 2 hours to almost an hour simply by auto-optimizing the doctor rosters that were there. Uh, Another use case was finding out places where diagnosis and the drugs being prescribed and then dispensed, what were the gaps? We saw a lot of cases which would come out in smaller pockets where the diagnosis was different and what was actually being dispensed was different, and highlighting them to cases where fraud might be happening. So these are all the cases. And in case of Bihar, I think there's a lot more that obviously we can do, provided the clarity of thought and mandate from the state. Thank you.
Wonderful. Thank you. So I'll move to the our keynote speaker. Sir, there is a lot of dilemma around क्या करना चाहिए policy makers को. How can AI assist policy makers in prioritizing investment when resources are constrained and the needs are rapidly evolving? So we know conference के बाद कि AI का हम लोग अच्छा application कर सकते हैं. कहाँ करें? That is the question which I think is running in the heads of everybody. Thank you.
So this is a very right area of dilemma. And as I mentioned in my first talk, that we have to see that there is, first of all, the challenge of availability, the challenge of accessibility, the challenge of affordability. And can AI be used to solve these challenges? For example, let me explain how these three challenges can, and quality challenges can be met through an AI. We are doing a project in AI for rural cancer detection through the visual inspection method through the lesions. And can we train AI? Yes, we are training AI for the purposes of detection. This project is being done by PGMIR Chandigarh along with AIMS Delhi. It's in a fairly advanced stage. I also showed it in one of my slides. We know that in Northeast, there is a lot of cancer cases pertaining to oral cancer because of their habits, which is pertaining to the betel nut consumption, etc. And the terrain is such that it is very difficult to access. The doctors are not available, so accessibility is a problem. If they want to come out of that, then affordability of medicine, that becomes a problem because they have to travel with the attendant to another medical center, and which may or may not be happening. And the third thing is that they will be coming to the doctor only at the fairly advanced stage of the disease. Lesion, okay, it will heal. Let's apply some local medicine, and maybe in a few weeks' time or a month's time, when it does not heal, it becomes a real challenge. Then they need to travel to a town. From that town, they go to Guwahati, they land at AIMS or at Shillong, etc. And by that time, the disease has progressed. Now, supposing we have those healthcare workers, we have got the mobile vans which are moving around. And here I'm talking about the vision pertaining to integration of various sorts of technology along with AI. And then there's the ASHA worker or there is a healthcare practitioner who's not even a doctor. I'm not saying that the doctor has been able to reach the patient. The patient complains that, okay, I have got a lesion in the mouth. And through the help of the camera, the image is taken. And through the eSanjeevani module, which is already present, and which can easily be provided on any portable device, whether it's a mobile device or a laptop, it is sent to a hub doctor. Now, the hub doctor may not be an expert. He cannot tell from the basis of the image that whether this is a case of cancer or not, right? And therefore, our eSanjeevani platform is also proposed to be integrated with these AI solutions. And therefore, he clicks for that particular image to be consumed in the AI solution pertaining to the oral health, pertaining to the cancer detection. And therefore, that particular image is being sent over to the servers where the algorithms of cancer detection are there. And the solutions is examined and the results are immediately given, whether the person was suffering or not suffering to a certain degree of problem. Now, if I see that, then it solves all my three problems. The first problem is availability of the doctor. The doctor may be present in Delhi, the doctor may be in Guwahati, the doctor may be in Shillong, but through the telemedicine solution, it has been able to look at the image. Two, the doctor may not be an expert as far as cancer is concerned. However, as far as the initial triaging with the AI-based solution is concerned, the doctor has. And three, based on that, there is an early detection and there is a larger probability of cure. And through the telemedicine solution systems, where we are going for expert consultation, maybe in the future an appointment can also. So trying to give a concrete example for the states, and it's for the states how they want.
I have a list of questions, and I'm sure the audience also has questions. But since we are running short
Running
of
short of
time
time.
and just
And they're
pre-lunch,
waiting for the lunch also.
yeah. So, but I will, ask all of you to make closing remarks because the topic is harnessing AI for new and emerging healthcare challenges. What, according to all of you, and we start from Anand, are I'll give it this time. What, according to you, is the most challenging need? What is it that you see कि कौन सा सबसे pressing need है in the new and emerging healthcare challenges? Which AI should focus on? Like the use of thought or your vision of thought from each of you.
Ma'am, with respect to AI, the utilization of AI, primarily we see from two perspectives. First is AI is based on the data that we have and how do we train it. So, for example, with respect to the population for which the data is there. So the first problem would be identifying the health issues, susceptible health issues, which that particular population might be susceptible to. The second would be population for which we do not have the health data, but we have other parameters such as the geographical data or certain other historical data that we have with respect to those populations. So with respect to all both of these issues, for example, lifestyle diseases, for example, with respect to maternal health, so all of these issues, so there might be some data which might be there with respect to the how much of the physical activity that person is doing, if there is some other electronic health record. So all of AI could be utilized for collating all this data and identifying patterns with probably which is element that this particular person is susceptible to either longer than. So with respect to the second problem, for example, with respect to the population for which do not have the data for. With respect to that population, based on the geographical parameters or other whatever data that we have, the AI model could be utilized for identifying that which is, for example, in the rainy season, we are the area is most susceptible to rainy incidents. So, for example, all of these issues can be highlighted through AI, and then based on these prompts that we get, we can have intensified health campaigns, intensified identification of diseases to be more camps to be very health adequate. So AI could probably enable the coverage of health services in a more effective manner. Thank you.
लक्ष्मण सर बस 1 minute गागर पे सागर भर दीजिए with your mic.
Basically, I would like to comment upon one point that the solution what AI offers has a few challenges. More like earlier we used to exchange in cash. I give cash, you give some service or product to me. That exchange has happened. Now, the last few years, we are now doing it on mobile-based payment system. We do not actually deal with cash, but we are happy with the numbers that somewhere some money has come to my account, and we are all happy with that transaction. Whether if I get an advice from AI, I will take with the same satisfaction, the same conviction that yes, my case, my information, my symptoms, my signs have been examined by somebody, and the doctor, the nurse have given me the right treatment. Whether that trust comes in would be a challenge, and it is perhaps the responsibility of all of us to make people believe that okay, the AI is giving one of the best solutions, may not be the only solution, but one of the best solutions, as Sir rightly told, at an affordable, at an easy pace and timely manner. Perhaps all our efforts should be towards that. Thank you.
Ritik, have it with you.
टाइम कम है तो अगर मैं सिर्फ दो चीज कहूँ जहाँ पे सबसे ज्यादा हमें एआई की तुरंत जरूरत है, दैट इज प्राइमोर्डियल प्रिवेंशन, मींस कि वी हैव टू एआई शुड हेल्प in emergence of risk factor in our society. That is primordial prevention. And second most important area is primary prevention. We have to see how we can work on this, we can prevent the disease at the level of as a primordial and prevention. Second thing, the role of this AI in diagnostic. Diagnostic means radiological and pathological both. Since we know there is a scarcity of radiologists, particularly in remote area, so in diagnostic, radiological diagnostic, AI can do wonders. Thank you. Thank you.
Very quickly, adding to what Lakshman sir said and what I heard from a surgeon last week at an ABDM workshop about, I spend my time on e-surgery 1 2 hours, 1 hour or 2 hours a week, and I get patients who are not related to my field. I think resource planning, given the resource crunch, is a very important area that AI needs to can solve for, without actually causing a problem. Whether is a doctor knowing me or checking me, making sure that the right care coordination workflow happens is probably the biggest challenge that AI can solve quickly today.
Hearing from you.
Thanks a lot. So I would just sum it up that from the government perspective, there are three words which are important: expert, expertise, and triaging. There is a dearth of experts in the system, that is for sure. It's not going to be solved very quickly, especially in the rural areas, as Singh was also saying. Expertise. The level of AI is reaching similar to the expertise levels we are of human expertise. We see that specificity and certainty is reaching 88, 89, 90, 91%. So we are reaching that, and it's going to increase. And triaging. Triaging here means that making and mass applications where we can use the technology because we have huge volumes and huge. Thank you.
Thank you so much. The esteemed panel has really wrapped it up in time. So I will want to give that opportunity to the audience. If you have any questions, any last, any hunger for knowledge is bigger than hunger for food. अगर एक हाथ उठा है
ज़्यादातर चिकित्सक हैं, कंज्यूमर प्रोटेक्शन एक्ट भी लागू है, इसमें कहीं कुछ हम लोग को समाधान करने में या न्यायिक प्रक्रिया में कुछ कंफ्यूजन हो सकता है, या ऐसा कोई विचार किया सकता है क्या?
सर क्वेश्चन आपका थोड़ा सा स्पष्ट नहीं है और किससे पूछ रहे हैं अगर आप बता दें।
मैं किसी व्यक्तिगत रूप से नहीं पूछ रहा हूँ, शंका है, सवाल शंका के समाधान के लिए है।
अच्छा,
ये
ठीक है।
विज्ञान है,
तो सर
चिकित्सा।
आप नेटवर्क करिएगा, शंका का समाधान बहुत सारे लोगों से पता है कि आपको मिलेगा, बिकॉज या फिर एनीबॉडी ऑन द पैनल वुड वांट टू टेक अप।
मेरा कहने का मतलब एक दृष्टिकोण है कोपरा का, जिससे एआई हो गया चिकित्सा के सामने, कंज्यूमर प्रोटेक्शन एक्ट में डिसीजन लेने में न्यायपालिका को कि हमेशा जो हो जाती है, हम समझते हैं तब ध्यान आता है पहले, ये कोई एक दृष्टिकोण है, कोई एक कॉर्नर रिव्यू विचार करने लायक है, उसको कैसे किया जाए।
बहुत
संज्ञान में लाना था, बिंदु संज्ञान में लाना था मेरा।
आपने बताया कि बहुत विचार और दृष्टिकोण की आवश्यकता है। एनी क्वेश्चन फ्रॉम दिस साइड? ओके, आई थिंक एवरीबॉडी इज हंग्री फॉर रियल फूड। जैसे कि एआई ह्यूमन टच और ह्यूमन प्रेजेंस को रिप्लेस नहीं कर सकता, खाने को भी नहीं रिप्लेस कर सकता, तो आई थिंक वी शुड गिव दैट प्रायोरिटी।
और देवियों सज्जनों, सबसे पहले तो मैं चाहूंगी एक जोरदार तालियां हो जाए हमारी मॉडरेटर के लिए, मिस नेहा जैन, as she has moderated in the best way. Ladies and gentlemen, देवियों सज्जनों, कार्यक्रम को आगे बढ़ाते हुए हमारे अनएस्टीम्ड स्पीकर्स को सम्मानित करने का समय आ गया है। मैं सबसे पहले निवेदन करना चाहूंगी इस सेशन की मॉडरेटर मिस नेहा जैन मैम से कि वो सम्मानित करें, और इस मौके पर मैं चाहूंगी एक जोरदार तालियां हो जाए श्री मधुकर भगत, जॉइंट सेक्रेटरी ई हेल्थ, मिनिस्ट्री ऑफ हेल्थ एंड फैमिली वेलफेयर, गवर्नमेंट ऑफ इंडिया। बहुत बहुत धन्यवाद करना चाहूंगी सर, इस कार्यक्रम में आपने अपना कीमती समय दिया। इस मौके पर मैं चाहूंगी जोरदार तालियां हो जाए डॉक्टर लक्ष्मणन SIS, दी नेशनल हेल्थ मिशन, NHM असम। थैंक यू सो मच सर, बहुत बहुत धन्यवाद इस कार्यक्रम में अपनी उपस्थिति देने के लिए। साथ ही साथ सम्मानित करेंगे श्री अनंत द्विवेदी, IAS चीफ ऑफिसर, CEO, स्टेट हेल्थ एजेंसी, जम्मू एंड कश्मीर, MD, APGM, JNK। Thank you so much for joining us. एक जोरदार तालियां हो जाए प्रोफेसर डॉक्टर CM सिंह, डायरेक्टर डॉक्टर राम मनोहर लोहिया इंस्टीट्यूट ऑफ मेडिकल साइंसेज, लखनऊ, उत्तर प्रदेश। बहुत बहुत धन्यवाद सर इस कार्यक्रम में अपनी उपस्थिति देने के लिए। देवियों सज्जनों, में चाहूंगी एक जोरदार तालियां हो जाए श्री आदित्य विवेक पाटकर, डायरेक्टर एंड CEO ऑफ +91 टेक्नोलॉजीज प्राइवेट लिमिटेड। बहुत बहुत धन्यवाद इस कार्यक्रम में अपनी उपस्थिति देने के लिए। और अब बारी है इस सेशन के मॉडरेटर को सम्मानित करने की। मैं निवेदन करना चाहूंगी डॉक्टर विकास सिंधु अग्रवाल, स्टेट सर्विलेंस ऑफिसर उत्तर प्रदेश, की वो मंच पर आए और सम्मानित करें इस सेशन की मॉडरेटर मिस नेहा जैन, आईएएस स्पेशल सेक्रेटरी, डिपार्टमेंट ऑफ आईटी एंड इलेक्ट्रॉनिक्स, एमबी यूपी डेस्को, गवर्नमेंट ऑफ उत्तर प्रदेश। एक जोरदार तालियां हो जाए। मंच पर उपस्थित सभी अतिथिगण से निवेदन करना चाहूंगी कि आप सभी लोग आगे आ जाएं एक ग्रुप फोटोग्राफ के लिए। और देवी और सज्जनों, इससे पहले कि हम कार्यक्रम को आगे बढ़ाएं, आप सभी को सूचना देना चाहूंगी कि लंच कुछ देर में स्टार्ट हो जाएगा, अगले 2 से 3 मिनट में। मंच पर उपस्थित अन्य अतिथिगण से के लिए निवेदन है जोरदार तालियां हो जाए। आप सभी को सूचित करना चाहूंगी कि आप सभी लोग 2:45 तक वापस आ जाएं। हमारा एक प्रेजेंटेशन है, एग्जीबिशन वॉक एंड इंडस्ट्रियल प्रेजेंटेशन ऑन जीन हेल्थ केयर। 3 बजे मैं आप सभी से निवेदन करूंगी कि वापस से आ जाएं फॉर द प्रेजेंटेशन एंड देन वी विल स्टार्ट फॉर द। और आप सभी को सूचित करना चाहूंगी कि हमारे राइट साइड में भी लंच है एंड लेफ्ट साइड एक्सपो के बैक साइड में भी लंच अवेलेबल है। तो यहाँ उपस्थित सभी अतिथिगण से निवेदन करूंगी कि आप सभी लोग डिवाइड हो सकते हैं और अपना लंच पूरा कर सकते हैं। सो एट द राइट साइड ऑल्सो वी हैव द लंच एंड द लेफ्ट साइड एट द बैक साइड ऑफ द एक्सपो वी हैव द लंच। और यहाँ उपस्थित सभी स्पीकर्स के लिए lunch is at the 3rd floor at the Dum Restaurant. So all these speakers are requested to please join us to the restaurant area. Thank you so much. This is the special announcement for the speakers, the esteemed speakers. I request the speakers to please join us at the restaurant area at the 3rd floor. Thank you so much. I request you all to please be back by 3. आप सभी से निवेदन है कि 3 बजे तक वापस से इस कार्यक्रम में शामिल हो जाएं ताकि हम कार्यक्रम को आगे बढ़ा पाए। हमारा एक प्रेजेंटेशन है एंड देन we'll start off with a very important session with our esteemed panelists and guests for the next session. Thank you so much.
In districts to cloud-scale innovation labs. The state is creating one of the world's most ambitious AI-driven health ecosystems, connecting citizens, clinicians, startups, and global innovators. At a time when India is leading the global conversation on responsible, inclusive, and actionable artificial intelligence, shaping how AI serves humanity, Uttar Pradesh is translating that national AI impact vision into real-world healthcare transformation. Global leaders in the entire AI ecosystem, governments, companies, researchers, educators, startups, and students will come together in New Delhi. The goal is simple: to understand how this powerful technology can be used for the good of humanity. The India AI Impact Summit will be inaugurated by the Honorable Prime Minister, Shri Narendra Modi, and will move forward with a clear vision, people, planet, and progress. People, where AI empowers every citizen and ensures that no one is left behind in this AI transformation. Now, the future converges at one stage. Uttar Pradesh AI and Health Innovation Conference, a landmark gathering of policymakers, health leaders, medtech pioneers, investors, and AI disruptors to shape the next decade of intelligent healthcare.
अगर उत्तर प्रदेश की ही मैं बात करता हूँ, पिछले 8 साढ़े 8 वर्ष में हम लोगों ने उत्तर प्रदेश में 42 नए मेडिकल कॉलेजेस बनाए हैं, 2 एम्स बने हैं जो सफलतापूर्वक संचालित हैं, सुपर स्पेशलिटी के तमाम नए संस्थान उत्तर प्रदेश में इस दौरान स्थापित हुए हैं, जिसके माध्यम से उत्तर प्रदेश के 25 करोड़ से अधिक नागरिकों को बेहतरीन स्वास्थ्य सुविधाएं उपलब्ध हो सके।
Explore breakthrough AI frameworks, cybersecurity for health data, digital therapeutics, smart manufacturing, medical robotics, and UPS blueprint for seamless digital healthcare ecosystem. Health, technology, intelligence. Uttar Pradesh is rewriting the future, and the world is watching. Uttar Pradesh AI and Health Innovation Conference, Lucknow. This landmark journey will be inaugurated by the Honorable Chief Minister of Uttar Pradesh, Shri Yogi Adityanath, whose leadership is steering the state toward becoming a global hub for AI-driven healthcare innovation.
कौन सोच सकता था कैश के बिना पेमेंट हो जाएगा? कौन सोच सकता था एक टैप में पूरी दुनिया हाथ में आ जाएगी? इंडिया ने ये कर दिखाया। और अब नेक्स्ट बिग लीप एआई। पर एक सवाल है, एआई सिर्फ एक्सपर्ट्स के लिए, सिर्फ कोडर्स के लिए? बिल्कुल नहीं। माननीय प्रधानमंत्री श्री नरेंद्र मोदी जी के विजन से शुरू हो रही है एक नेशन वाइड मूवमेंट जहां एआई सीखेगा हर भारतीय।
हमारे लिए एआई सिर्फ एक टेक्नोलॉजी नहीं है, बल्कि भारत के युवाओं के लिए अवसरों का एक नया द्वार। भारत ने इंडिया एआई मिशन शुरू किया। भारत हर सेक्टर में एआई का उपयोग बढ़ा रहा है। हम दुनिया को भी बेहतर एआई सॉल्यूशंस देने में जुटे हैं।
बच्चे, युवा, प्रोफेशनल्स, हर शहर, हर गांव। इस मिशन का पहला स्टेप है युवा एआई फॉर ऑल। सिर्फ 4 घंटे का कोर्स, सिंपल, प्रैक्टिकल, पावरफुल। सीखिए एआई क्या है, कैसे काम करता है और कैसे एआई को रिस्पॉन्सिबली यूज करके अपनी पढ़ाई, काम और आइडियाज को नेक्स्ट लेवल ले जा सकते हैं। सब कुछ बिल्कुल फ्री, घर बैठे। कोर्स कंप्लीट करें और पाएं गवर्नमेंट ऑफ इंडिया का सर्टिफिकेट। लाखों इंडियंस को एआई रेडी बनाने का टारगेट है। और हाँ, इस फ्यूचर का हिस्सा बनना ऑप्शनल नहीं, इस फ्यूचर को शेप करना अब आपके हाथ में है। अभी एनरोल करें युवा एआई फॉर ऑल futureskillsprime.in क्यूआर कोड स्कैन करें और एआई के साथ विकसित भारत के सफर में जुड़ जाएं। सोचिए, बनाइए एआई के साथ। जय हिंद।
A new era of healthcare is rising, where hospitals think faster, where health data becomes diagnosis and intelligence becomes care.
हेल्थ केयर हो, एजुकेशन हो, स्टार्टअप्स हो, भारत हर सेक्टर में एआई का उपयोग बढ़ा रहा है।
Uttar Pradesh is not just witnessing the AI revolution, it is building it. From India's largest health data backbone to predictive disease intelligence, from AI-powered diagnostics in districts to cloud-scale innovation labs, the state is creating one of the world's most ambitious AI-driven health ecosystems, connecting citizens, clinicians, startups, and global innovators. At a time when India is leading the global conversation on responsible, inclusive, and actionable artificial intelligence, shaping how AI serves humanity, Uttar Pradesh is translating that national AI impact vision into real-world healthcare transformation. Global leaders and the entire AI ecosystem, governments, companies, researchers, educators, startups, and students will come together in New Delhi. The goal is simple: to understand how this powerful technology can be used for the good of humanity. The India AI Impact Summit will be inaugurated by the Honorable Prime Minister, Shri Narendra Modi, and will move forward with a clear vision: people, planet, and progress. People, where AI empowers every citizen and ensures that no one is left behind in this AI transformation. Now, the future converges at one stage. Uttar Pradesh AI and Health Innovation Conference, a landmark gathering of policymakers, health leaders, medtech pioneers, investors, and AI disruptors to shape the next decade of intelligent healthcare.
अगर उत्तर प्रदेश की ही मैं बात करता हूँ, पिछले 8 साढ़े 8 वर्ष में हम लोगों ने उत्तर प्रदेश में 42 नए मेडिकल कॉलेजेस बनाए हैं, 2 एम्स बने हैं जो सफलतापूर्वक संचालित हैं। सुपर स्पेशलिटी के तमाम नए संस्थान उत्तर प्रदेश में इस दौरान स्थापित हुए हैं, जिसके माध्यम से उत्तर प्रदेश के 25 करोड़ से अधिक नागरिकों को बेहतरीन स्वास्थ्य सुविधाएं उपलब्ध हो सके।
Explore breakthrough AI framework, cybersecurity for health data, digital therapeutics, smart manufacturing, medical robotics, and UPS blueprint for seamless digital healthcare ecosystem. Health, technology, intelligence. Uttar Pradesh is rewriting the future, and the world is watching. Uttar Pradesh AI and Health Innovation Conference, Lucknow. This landmark journey will be inaugurated by the Honorable Chief Minister of Uttar Pradesh, Shri Yogi Adityanath, whose leadership is steering the state toward becoming a global hub for AI-driven healthcare innovation.
कौन सोच सकता था कैश के बिना पेमेंट हो जाएगा? कौन सोच सकता था एक टैप में पूरी दुनिया हाथ में आ जाएगी? इंडिया ये कर दिखाया। और अब नेक्स्ट बिग लीप पर एक सवाल है, वो सिर्फ एक्सपर्ट्स के लिए, सिर्फ कोडर्स के लिए? बिल्कुल। माननीय प्रधानमंत्री श्री नरेंद्र मोदी जी के विजन से शुरू हो रही है एक नेशन वाइड मूवमेंट जहां एआई सीखेगा हर भारतीय।
हमारे लिए एआई सिर्फ एक टेक्नोलॉजी नहीं है, बल्कि भारत के युवाओं के लिए अवसरों का एक नया द्वार। भारत ने इंडिया एआई मिशन शुरू किया। भारत हर सेक्टर में एआई का उपयोग बढ़ा रहा है। हम दुनिया को भी बेहतर एआई देने में जुटे हैं।
बच्चे, युवा, प्रोफेशनल्स, हर शहर, हर गांव। इस मिशन का पहला स्टेप है युवा एआई फॉर ऑल। सिर्फ 4 घंटे का कोर्स, सिंपल, प्रैक्टिकल, पावरफुल। सीखिए एआई क्या है, कैसे काम करता है और कैसे एआई को रिस्पॉन्सिबली यूज करके अपनी पढ़ाई, काम और आइडियाज को नेक्स्ट लेवल ले जा सकते हैं। सब कुछ बिल्कुल फ्री, घर बैठे। कोर्स कंप्लीट करें और पाएं गवर्नमेंट ऑफ इंडिया का सर्टिफिकेट। लाखों इंडियंस को एआई रेडी बनाने का टारगेट है। और हाँ, इस फ्यूचर का हिस्सा बनना ऑप्शनल नहीं, इस फ्यूचर को शेप करना अब आपके हाथ में।
Most of the time, you air. Most of the time, you don't even notice it's there. But when you can see it, Air. Most of the time, you don't even notice it's there. But when
Agri University, hosted India AI Convergence 2026, a premier national forum for AI innovation and impact.
I congratulate Chandigarh University of Uttar Pradesh for taking this remarkable initiative in organizing.
Check. All right. Ladies and gentlemen, I would like to request you all to please get settled down as we are about to begin with the second half of this event. Once again, I, Swati Chandra, would like to extend a warm welcome to each one of you. Hope you all had lunch. And I request each one of you to please be seated and get settled down. Thank you. देवी और सज्जनों और यहाँ उपस्थित सभी अतिथिगण से मैं निवेदन करना चाहूंगी कि आप सभी लोग अपना अपना स्थान ग्रहण कर लें। हम हमारे सेकंड हाफ की शुरुआत करने जा रहे हैं। आप सभी से निवेदन है कि आप सभी लोग अपना अपना स्थान ग्रहण कर लें। धन्यवाद। Once again, I request each one of you to please be seated and get settled down as we are about to begin with the second half and we'll be starting out with the presentation. So I request each one of you to please be seated. Thank you so much. देवी और सज्जनों और यहाँ उपस्थित सभी अतिथिगण से मैं निवेदन करना चाहूंगी कि आप सभी लोग अपना अपना स्थान ग्रहण कर लें। हम कार्यक्रम की शुरुआत करते हुए के साथ शुरू करने जा रहे हैं। आप सभी से निवेदन है कि आप सभी लोग अपना अपना स्थान ग्रहण कर लें। धन्यवाद। All right, ladies and gentlemen, as we begin, we have the presentation of healthcare, where the topic is latest trends in artificial intelligence. Mr. Imaging, as I would like to invite North India GE Healthcare Product Manager, Mr. Saurav Singh, to please join us on stage. दिव्य सज्जनों, एक जोरदार तालियों के साथ मैं आमंत्रित करना चाहूंगी मिस्टर सौरभ सिंह, प्रोडक्ट मैनेजर नॉर्थ इंडिया जी हेल्थ केयर, कि वो मंच पर आए और आज के टॉपिक लेटेस्ट ट्रेंड्स इन एआई उस पर प्रेजेंटेशन दें. आई वुड लाइक टू रिक्वेस्ट हिम टू प्लीज जॉइन अस ऑन स्टेज. अ वेरी वार्म वेलकम टू यू. Let's have a big round of applause, ladies and gentlemen.
Thank you so much. Good afternoon, everyone. I would like to thank Department of Health and Family Welfare and Department of Information Technology for organizing this event and allowing us as a GE Healthcare to represent what, as a company, global company, we are doing in terms of artificial intelligence and how it is helping in terms of diagnostic, especially diagnostic radiology segment, in a MRI segment, and how it can help the government, public, and we are standing, I would say, in a state where we are catering the largest population, so as the largest patient base, where a lot of dependency on the diagnostic radiology equipment is there, and there is a lot of turnaround time, waiting times, and how GE Healthcare is achieving or helping in that to reduce it and to make it more effective and help radiologists and technologists to leverage these technologies. Next slide, please. So I'm going to talk about our artificial intelligence, that is known as applied intelligence. Next slide, please. One of the famous AI scientists, Mr. Andrew, he works at Stanford. He has said that just as electricity has transformed almost every, I would say, 100 years ago, today I actually have a hard time thinking of an industry that I don't think AI will transform in the next several years. So basically, just like electricity has transformed and it has entered in every household and it is a necessity of all electronic equipments we are catering, in the same way, AI is going to help to, enter into our lives in terms of making it more easier, more useful, and make our workload faster. Next slide, please. So overall, I am going to talk about what artificial intelligence is today, how analytics and applied intelligence is working, how are scanners in terms of diagnostic radiology equipment, it is going to be more like becoming more intelligent, and how AI with deep learning in MRI is helping the patient clinicians as well as the end users, hospitals, governments in that term. So next slide, please. So if I talk about AI, in terms of data, if you'll see, it is actually growing by 48% per year. And if you'll see, every hospital in that term is actually using 50 petabytes of data, starting from basic imaging, where we were using kind of data in kilobytes. Now we are using high resolution imaging in terms of genome mapping to videos and 3D images, which is taking more than gigabytes of data. So to handle these data into an informative way, how actually AI is transforming. Next slide, please. So if you'll see, before we started, artificial intelligence is an intelligence demonstrated by the machines in contrast to the natural intelligence. And AI is applied when a machine mimics your cognitive functions that humans associate with other human minds. That actually what we do as a learning and problem solving skills. In that term, actually it's not a very new term in terms of, if I talk about diagnostic radiology, it was started in 1956 when we started applying artificial intelligence in terms of x-rays to count, to measure, to report few of the options. So it's not something new. It got stopped, then again it got an hype, and we are working furthermore in that direction. Next slide, please. So if I have to summarize in today's terms, in terms of AI, so it is actually a combination of deep learning, machine learning, as well as the artificial intelligence, where AI is the ability to mimic human intelligence, and machine learning is something where we feed the data and it learns from the data and it gives an output to you. In terms of deep learning, what it has come, it has got a data, it has got something called neural network, whether you call it a DNN or ANN, artificial neural network, that mimics the way human brain actually is processing the information as it learns. So it is something kind of a generative AI. We are in the age that where we are going into. Next slide, please. So in GE Healthcare, we call it applied intelligence with artificial intelligence, where we are putting up efforts into our scanners. Next slide, please. So in terms of applied intelligence, why call it? We call it because it is the analytics, it is the brain actually that powers many GE Healthcare scanners and applications and devices. That is why we call it as an applied intelligence. Next slide, please. If you'll see, in today's term, what we have done as globally, as a global GE company, we have largest devices approved in terms of artificial intelligence, that is approved by FDA, and we are proud to say that we have more than 100 devices, including from the softwares, from the hardware, as well as the services solutions. We have incorporated into all our imaging equipment in terms of starting from the X-rays, ultrasound, whether you take CT, MR, PET CTs, and cath labs, we have incorporated in every way possible, where it can help the clinicians, the cardiologists, the radiologists to gain more confidence, and the patient can get benefited by lesser scanning time, as well as hospital can be benefited by doing more throughput or achieving more throughput in a day, so that we don't the waiting time or the turnaround time gets reduced in that term. Next slide, please. So now in the way, that is how it is going. Precision health, the personalized care is going to be the future, where we are working in that direction, that every patient has certain amount of data which will be having a personalized kind of imaging, and it will evolve into multiple scanners and multiple kind of imaging or multiple therapies. So it all is going to be utilized in a personalized kind of care. Next slide, please. So what we believe in terms of imaging, actually imaging starts when the patient arrives in your department. So from the patient's arrival till the patient delivery, we are working on all three spaces. One is called something called pre-scanning when the patient arrives. Then there is something called scanning space. Then there's something called post-scanning space where reading, reporting, as well as collaboration is there. So we are working in all three directions with our equipment, with our software. Next slide, please. So if I'll talk about especially about MRI, here I want to emphasize on MRI because it is the, I would say in terms of radiology, it is the only modality which takes a lot of time in terms of doing the scans. And moreover, the AI in terms of reducing the scan time is required so that to achieve more and more number of patients in a day where we have a lot of waiting time, especially in the government scenario. So our MRI systems are all in terms of software and applications are enabled in given to the services and consulting. Next slide, please. So we are working in clinical, operational, and financial, all three directions. Next slide, please. Now, in terms of to summarize it, what we are offering as a company, in terms of we have called air coils, we have got air workflow softwares, we have got in terms of image quality recognition and deep learning algorithms that is reducing the scan time by 50%. So in a way, if you are doing 50 cases in a day, we can achieve at least 100 patients a day, and we can reduce the turnaround time in that, especially in the cases of MRI. Next slide, please. So these are actually the air coils, which are very lighter, around 90% of the lighter weight, and it is so easy to place on the patient's body that it does not feel too much weight, and it also increases the image quality in terms whenever we are scanning the MRI imaging. Next slide, please. So this is how we have built it. This is the one of kind of an MRI coil which have got an award in 2019 from Mont Mini. And earlier ones were very hard. It is very thin wire, very lighter weight, and it also offers low carbon footprint in terms of scanning and requires less electricity consumption in a way. Next slide, please. There are things called air touch where with the help of air coils, there is a patient comfort with 37% table time reduction, and there are improved workflow which saves around 59% of your setup time. Next slide, please. ARX is something we get a different variety of patient, different kind of patients where it helps in terms of positioning. It reduces actually the technologist errors. What either by knowing or unknowingly it happens. So it reduces the clicks, the clicks of the mouse is what we generally do. So it is it makes the workflow very faster. Next slide, please. This is a very groundbreaking technology in terms of deep learning, what GE Healthcare has done in the last 2 decades. It is something which will, make your images quality around 4 times higher. Your conventional reconstruction time reduces up to 60%, and your total scan time reduces up to 50%. Next slide, please. Play this video, please. Next clip, yeah. Last one. Thank you so much. You have been a great audience. Thank you so much.
थैंक यू सो मच मिस्टर सौरभ. लेडीज एंड जेंटलमैन, देवी सज्जनों, कार्यक्रम को आगे बढ़ाते हुए अब हम शुरू करने जा रहे हैं हैकाथॉन फिनाले एंड स्टार्टअप पिच सेशन बाय चंडीगढ़ यूनिवर्सिटी स्टूडेंट्स. सो इसके बारे में और ज्यादा जानकारी देने के लिए हमारे बीच में उपस्थित हैं डायरेक्टर इनोवेशन चंडीगढ़ यूनिवर्सिटी मिसेस अर्चिता नंदी. So ladies and gentlemen, without any further delay, please put your hands together for Mrs. Archita Nandi, Director Innovation, Chandigarh University. एक जोरदार तालियों के साथ स्वागत और अभिनंदन करेंगे. A very warm welcome to you, ma'am.
Very good afternoon, visitors. Special thanks to Ministry of Health and Family Welfare, Ministry of Electronics and Communications, and its related companies to give us this opportunity to drive
Landmark
noble
milestones
cause
in
across
India's
the nation.
AI journey. Two
So
national
we had been
initiatives,
vested
Quantums for
with the
Bharat and
responsibility
AI for All.
to pick up the brightest ideas related to AI solutions for health and medtech, medical industry. So, being the innovation head of Chandigarh University, Uttar Pradesh, we took that opportunity in a very bright way. And last 1.5 months, we had been struggling to reach out to our target audience, to every colleges, every campus, to get our brightest ideas who are working on technology solutions for this medical industry. So there are WHO, ICMR, PGI, AIMS, AICTE, DPIIT, so Niti Aayog, all the stakeholders were connected, consulted, and 5 tracks with an open innovation track was designed, and a dedicated portal got framed, and we got a humongous response of 5,000 plus applications from all across the nation. So this is a, you can say, one of our achievements to drive this entire hackathon across the nation. So a quick introduction to my university and my department. So Chandigarh University is one of the first private university to get, for 3 years, we are the #1 QS ranking in Asia. And we had been last 13 years functioning in Mohali. And this year we got operational in Uttar Pradesh at Unnao campus. So we have a technology business incubator, Government of India supported Department of Science and Technology NSTDB scheme. And we have our private incubation brand as well called Center for Universal Business and Entrepreneurship. Can we get one quick snap of the recent AI biggest summit in Uttar Pradesh that we can we have that video, please? Just a glimpse, audience. So,
Landmark milestones in India's AI journey. Two national initiatives, Quantums for Bharat and AI for All launched. As India sets to host the India AI Impact Summit 2026, Chandigarh University, Uttar Pradesh, India's first AI augmented multidisciplinary university, hosted India AI Convergence 2026, a premier national forum for AI innovation and impact.
I congratulate Chandigarh University, Uttar Pradesh, for taking this remarkable initiative in organizing India AI Convergence 2026 for accelerating India's journey toward impactful AI solutions.
Two national initiatives, Quantum for Bharat and AI for All, were launched at this official pre-event for India AI Impact Summit 2026 to advance the India AI mission and the National Quantum Mission.
The focus of this campus, as I've been told, is on AI, right? And whatever little I could interact today with startups and other ecosystem players, I could clearly see that these people have that hunger to do something for the public good.
This national forum converged distinguished dignitaries from across India, including senior functionaries from the Government of India and the Government of Uttar Pradesh, industry leaders, entrepreneurs, AI experts, researchers, academicians, students from top tier institutions, collectively propelling India's AI momentum.
We already see this. There is a lot of focus for student development here. The leadership of the university understands deeply that the future is going to be shaped so much by AI. So this ecosystem building has to happen, and that is what Chandigarh University is doing.
With 6 panel discourses, the convergence steered India's system toward responsible, scalable, and inclusive growth.
Chandigarh University in Uttar Pradesh, I think, is taking a great lead in that area, and this will help in creating lot of entrepreneurs, and also help in bringing ecosystem and raising the lives of the people here in UP as well as in India.
With high impact panel discussions, exhibitions of startups, interactive fireside chats with founders and investors, and sector focused dialogues.
Chandigarh University is taking such a big leap with respect to this event that is taking place, the Convergence India AI. And it's great to see that policymakers, faculties, students, industry leaders, people from various backgrounds coming together and working out in this area, which is a big thing.
India AI Convergence 2026 laid the foundation for an AI ecosystem that serves the nation, empowers its people, and drives sustainable growth.
So this is all under the visionary leadership and guidance of our Honorable Chancellor, Sir Shri Satnam Singh Sandhuji, Member Rajya Sabha Parliament. So now there would be the presentation and a panel discussion on whatever the learnings we had through the hackathon. We have our top 3 teams who have been evaluated and been congratulated by the government as well. We have a certification, a small certification distribution ceremony as well. So before that, there would be a panel discussion, and we have right now a quick snapshot of the hackathon that we have run. So I would like to invite Yash Tyagi to have one hackathon presentation, a bit small, one slide presentation on how this entire hackathon got conducted and what exactly are the objectives to achieve through this initiative. Thank you so much.
Good afternoon to all the dignitaries present here. My name is Yash Tyagi, and our ideologies was quite simple actually when we were starting this hackathon. Let's just build something that people can actually invest money on. As an incubator and investor, my background that I've learned, I belong from Vertex Venture Singapore, and the thing I only learned is you should make capital and money, but at the same time, it should create impact. With the vision of Bharat, our clear priorities with this hackathon was quite simple. Let's create and indulge products that is using healthcare, but using AI just as an infra layer, not as a buzzword. So we started with that simple thing. It's been 3 months. We started this cohort. We collected more than 50 plus investors from Fluid Ventures to all across Chirate and everyone. We inculcated from Fortis, directly from ICMR to every single dignitary present here, all the problem statements. What's the result that came across? 5,000 good ideas that we received over the 1.5 months of time from all over, from Pune to Delhi to Bengal. We received a lot of ideas and then we started evaluating. So that is what we do. That's what the cohort is all about. I would definitely give a more glimpse on it after when we are definitely showing the products. But thank you a lot.
Now we have a panel discussion on AI-powered healthcare accessibility, bridging rural-urban divide through innovation. For that, we have amongst us, ladies and gentlemen, Dr. Ashu Grover, Scientist G and Head Delivery Research, Indian Council of Medical Research. Ma'am, I would like to come on stage. I would like to invite you on stage. Then we have Dr. Vikas Gupta, State Senior Medical Officer, WHO NPSN, Lucknow. Vikas ji, would like to request you to come on stage. Then we have Dr. Rahul Dikshit, Founder and Director, Sangra Innovations Private Limited, Kanpur. We have Mr. Sham Kumar, Chief Operating Officer, STPI, MedTech Center of Excellence in Lucknow. So Dr. Ashu Grover, ma'am, with 20 plus years of expertise in implementation, research, health systems, and health technology assessment, she leads India's national initiatives in translating research into evidence-based healthcare delivery solutions and has established multidisciplinary research units across 90 medical colleges nationwide to undertake research on non-communicable diseases and health innovations. Dr. Vikas Gupta, as State SMO for the National Polio Surveillance Network under the Ministry of Health and Family Welfare, Government of India. Based in Lucknow, he brings 20 plus years of public health expertise in disease surveillance, immunization programs, and ground level healthcare delivery challenges across UP and India. Dr. Rahul Dikshit is the founder and director of Sangra Innovations, a UP-based medtech startup incubated through CSJMU Innovation Foundation. The company's specializations in innovative, affordable, and high-quality medical device solutions designed to make advanced healthcare equipment accessible to undeserved populations in India. Sham Kumar ji is the Chief Operating Officer of STPI Medical Tech Center of Excellence in Lucknow, overseeing Medi Electronics and Health Informatics startup incubation and acceleration programs. With extensive experience in startup ecosystems, biotech development, financial inclusion, and operations management, Sham Kumar brings hands-on experience in scaling innovation through government-backed incubation infra and mentor networks. Thank you so much. I would like to request Asha ma'am to take the panel forward. Thank you, ma'am.
Thank you so much. Very good afternoon to everyone. First of all, thank you, Government of India, Ministry of Health and Family Welfare, mighty Government of Uttar Pradesh, and Chandigarh University for hosting this wonderful panel discussion on AI solutions for healthcare. And I think this is the right time that we have started talking about artificial intelligence versus natural intelligence, as well as analytical intelligence as well. So, and then we have the precision medicine also adding on to what AI solutions are. Before coming to the exact, discussion among my esteemed co-panelists, I would like to put forth a couple of scenarios what is happening at the Government of India level. I am working with Indian Council of Medical Research for around 2.5 decades, and this is the largest and the only funding agency within India, and this is the oldest in the world funding agency for undertaking the health in undertaking the research in health arenas. Uh, Prior to, if we talk about 10 to 15 years ago, the research areas which were mainly focusing on, we used to find out that how much is the burden in our country. Used to know that how the different disease conditions are, prevalent, the incidence, to find out how much is our problem of anemia, the malnutrition, the tuberculosis. Now we have the conditions which is coming up as non-communicable diseases. So there is a dynamicity in various factors, not only the disease outcomes, but also the risk factors are also changing. So we used to have, earlier conditions more related to infectious diseases because of various poor practices or not availability of the safe drinking water. But now we have, not, I mean, I can't say that after an episode of Indore and other conditions that we have safe drinking water, but still we have developed so many, good solutions wherein we are able to curtail some of the communicable diseases. But the more we are able to control the communicable diseases, but non-communicable diseases are also rising. And not only NCDs, look at the mental health conditions which are continuously rising. So when we are struggling all together with the data which is being done at a Nirman Bhavan, which is Ministry of Health and Family Welfare, we used to have all the records which were coming up from different hospital sectors, from the private and the public healthcare facilities. And we're all struggling counting the I mean, my panelist is there from the polio surveillance. How many polio cases are there? How many got the dosages of the immunization program? So everything was used to be, counting mechanism in a different mode. But now, if you see, most of the programs are now being converted into e-platforms. If you think of our digitization of the things and the records, everything almost has become the digitization, and it has its pros and cons in both ways. More are the pros, less are the cons, because uh, cons are there because there are different factors. Somebody doesn't want to do. If you go to the ASHA workers to give the information on that tablet, to give the information on any computer or the tablet, there is some kind of a resistance. Same is among the medical officers also. But nonetheless, whatever we have moved to the digitization, e-platforms, e-Sanjeevani, e-Aadhaar card, e-passport, it has given us a lot of ease also and comforts also in our everybody's life. So when we say that, of course, we are moving towards digitization, we are moving towards simpler solutions, we are moving towards quick solutions, transparent solutions. We must adopt it, we must adapt it, and we must embrace these newer technologies as far as the medical science is concerned. So in ICMR, of course, we also have started, taking AI and machine learning as one of the priority area for research. A couple of projects which are ongoing in ICMR are that for the anemia Mukt Bharat campaign, there is a kind of, we have to put up those estimation of the hemoglobin. Just prick method was there, but now there are some digital solutions which have come up. For cancer diagnosis, we have to have, some of the digital solutions which are already there in the form of, the lady used to have the pap smear, but now with AI technologies, with the, images, we can easily come out to solutions which can be helpful in easily, prevention and start of the treatment for the common conditions like cervical cancer, the breast cancer, and the oral cancer. Nonetheless, if we come to the area of mental health, yes, of course, we have the Telemanas program, which is again a AI-based model, but we need to understand the child psychology. We need to understand what is happening to the adult. We need to understand what is happening to the mother in the reproductive age group. So these AI-based tools which really give up you some of the solutions for prevention, early diagnosis, screening, and starting the treatment part, they cannot be ignored. However, we cannot replace the doctors in one say, but still the questions persist in our everybody's mind that how far, how long will it be a successful? Will we be able to, come at a pace where the entire country is moving towards? So I think the previous presentation when we saw that even for the diagnosis, the kind of a precision, I remember in the previous ultrasonography methods, the fetal ultrasonograph was there. If somebody obstetrician over here or those who are working in this MRI and ultrasonography newer methods, but now with the very simpler AI tools, we can definitely put up the baby as a low birth weight or a premature baby with the finding of the fetal length or the femur length or the head circumference or various mechanisms, whether the position of the baby. So point is that artificial intelligence and the machine learning will have a long way for us to come up with the prompt solutions, and we really come forward with the innovators and the incubators to attend this summit and listen to us for further solutions. So with us, we have, the panelists with us. Would like to embark upon and open the panel discussion among the august audience. That, my question would be to Dr. Vikas. So you have been working with the polio surveillance network at long. So how do you feel that, if we have these solutions available, if they are evidence based, if they are research based, if there are some data driven, would these solutions be have a long lasting effect, and what will be the challenges to get it adapted into the program? Your thought on it?
Thank you, ma'am. Definitely, what things have been going on. If we are having a AI-driven, which is a scientific backed program with us in the hands of a doctor, in the hands of a frontline worker, definitely it will going to change the time of response, the time of judgment, the time of where we can control the diseases, where we can intervene from the district level or block level or from the state level, we can resource mobilization can be done. We can reallocate our medicines and vaccines to that particular area, and we should embrace the AI. We cannot reject it straightforward, but we have to adapt it. And pros and cons are there. And the most significant is the data quality. If data quality is there, we will have a correct predictions from our data, from the AI models, which we will train on the data. And that is the data which is our locally adaptable, locally data should be available. We cannot have a modeling data of Western country trained data, as discussed in the earlier deliberations also.
I think thank you, Vikas. You have, definitely emphasized the presence of that AI in every solutions, and we cannot get away with it. And there are lot many solutions which exist. So I would like to, maybe invite Dr. Rahul, who are working with the Sangraha Innovations at
Yes,
IIT
yes, ma'am.
Private Limited, Kanpur.
Yes.
And you have a medtech startup, and which is incubated with the CSJMU Innovation Foundation. So I would just like to put forth with you that when you have your foundation, so how do you decide that which is the priority which will go into your innovation hub, and how do you decide that I should develop this innovation? Will the government will be ready to take up this scale up, or will I have to do a kind of a whole lot of the cyclic trend that you have to go for the marketing, then the surveillance, then innovation developer, and taking up by the government. So how do you come up with those solutions? So priority setting as well as uptake from the government perspective. So what are your views and journey or challenges you must have come across?
मैम कोरोना का टाइम था जब हमने अपनी मेडिकल फील्ड में जर्नी स्टार्ट की एंड 2021 में हमने एक महीने में एक लकड़ी के ढांचे पे ऑक्सीजन कॉन्सेंट्रेटर बनाया था, वो भी अपने ड्राइंग रूम को एक वर्कशॉप में कन्वर्ट करते विद अ टीम ऑफ 3-4 इंजीनियरिंग स्टूडेंट्स जो कि अंडर ग्रेजुएट्स थे, एंड विद माई वाइफ डॉक्टर अपर्णा हु इज अ प्रोफेसर ऑफ फिजिक्स, and our technical guru, Dr. Shriram Dojati, who's IIT Bombay ex. He is living in Rochester, USA. So we had a good mentor, we had a good team. इन सबको लेके हमने ये चीज़ तैयार की और उसको फिर हमने अगले 1 साल 1.5 साल में अपग्रेड किया। इस दौरान प्रोडक्ट डेवलप करने के बाद उसको सोसाइटी में कैसे लाया जाए, ये एक बड़ा क्वेश्चन था। So आपका जो अभी क्वेरी था with regard to that, we approached Software Technology Park of India, Lucknow, in PGI, and we also approached the Startup India Startup UP program run by Government of UP. So we got a 5 lakh initial funding from Government of UP under Start in UP program, and we also got incubated in Software Technology Park of India, Lucknow. We were co-incubated at Kanpur University also later on. तो अभी जैसा आपने पूछा कि चैलेंजेस क्या थे और प्रायोरिटीज क्या थी, तो पहले मैं प्रायोरिटी पे आऊँगा। प्रायोरिटी में पहले हमारा ये था कि ये प्रोडक्ट हमारा ट्रायल्स एंड टेस्टिंग में आ जाए, सो दैट जितनी जल्द हो सके इसको नॉर्मल पब्लिक के लिए, खासतौर पे गांव में, जो हमारे लगभग आपको मालूम होगा कि उत्तर प्रदेश में लगभग 1 लाख गांव हैं, जो कि पूरे इंडिया में सबसे ज़्यादा हैं, और हमारी आज 2025 की सेंसस के हिसाब से लगभग 24 करोड़ पॉपुलेशन है उत्तर प्रदेश की, लार्जेस्ट पॉपुलेशन इन इंडिया, विद आउट ऑफ दैट अराउंड 18 करोड़ पीपल, आउट ऑफ 24, 18 करोड़ पीपल आर लिविंग इन रूरल एरिया, गाँव में रहते हैं। और गांव में COPD, ILD जैसी प्रॉब्लम बहुत ज़्यादा है, बिकॉज जो आपका धुआं है, जो आपका धूल है, वो हमारे गांव के जो लोग हैं, किसान हैं, उनके फेफड़ों में, लंग्स में जाती रहती है। उन्हें मालूम नहीं पड़ता, उनको आदत पड़ चुकी होती है शायद, बट उनका जो लाइफ साइकिल है वो काफ़ी रिड्यूस हो जाता है बिकॉज ऑफ नॉट वेरी गुड एनवायरनमेंट। उसकी वजह से क्या होता है कि उन्हें ये मालूम नहीं होता और वो नियरेस्ट हॉस्पिटल पे भी नहीं जा पाते। तो हमने STPI में प्रायोरिटी पे ये रखा कि सर पहले तो हमारा ट्रायल एंड टेस्टिंग हम लोग को शुरू करना है, जो कि हमने डॉक्टर संजय गंभीर जो वहाँ पे डॉक्टर हैं उनके गाइडेंस में शुरू किया। और साथ में हमने कार्डियोलॉजी इंस्टीट्यूट जो कानपुर में है, वन ऑफ द लार्जेस्ट कार्डियोलॉजी इंस्टीट्यूट्स इन उत्तर प्रदेश, और एक हैलेट हॉस्पिटल है विच इज़ वन ऑफ द लार्जेस्ट हॉस्पिटल्स ऑफ इंडिया इन कानपुर, वहाँ पे हमने ट्रायल्स एंड टेस्टिंग अंडर डॉक्टर यशवंत राव और प्रिंसिपल मेडिकल कॉलेज जो डॉक्टर काले हैं उनके अंडर सुपरविजन में हमने शुरू किया। वो सक्सेसफुली हमने इस ट्रायल्स को कंडक्ट किया, 6 महीने चलाया उसको। उसके बाद वापस PGI में जब हम लोग चला रहे थे, सो देयर वाज अ थॉट प्रोसेस कि क्यों ना हम UP में एक कमांड सेंटर बनाएं PGI में, विच शुड बी लिंक टू हॉस्पिटल्स लाइक डॉक्टर राम मनोहर लोहिया, KGMU, जहाँ पे जो पेशेंट फुटफॉल हो रहा है उसको हम रिकॉर्ड करें, और उनको क्या लंग्स से रिलेटेड प्रॉब्लम्स हैं, उस OPD या जो भी चीज़ें हैं वहाँ पे उनकी जो रिपोर्ट्स हैं वो एक सेंट्रलाइज डेटा के रूप में कमांड सेंटर PGI में जाके वो डेटा सेट के रूप में, स्टैक के रूप में वो वहाँ पे बनती जाए। तो ये जो प्रायोरिटी टेस्टिंग एंड ट्रायल से शुरू हुई, वो एक कदम आगे गई कि अगर हमको AI इनेबल्ड एनवायरनमेंट या इकोसिस्टम 2 साल बाद बनाना पड़े, या लेट से 3 साल बाद बनाना पड़े, और गवर्नमेंट ऑफ इंडिया और गवर्नमेंट ऑफ UP कहती है कि नहीं साहब आपको बनाना है ये AI इनेबल्ड सॉफ्टवेयर, तो हमारे पास डेटा सेट तो है ही नहीं। तो उसमें मैंने श्याम कुमार सर और डॉक्टर प्रवीण देवी जी जो STPI को हेड करते हैं UP में और लखनऊ में, हमने एक मीटिंग की, उसमें हमने ये डिसाइड किया कि अगर हो सका तो आने वाले समय में विद द हेल्प ऑफ मिनिस्ट्री ऑफ फैमिली वेलफेयर एंड मेडिकल हेल्थ ऑफ उत्तर प्रदेश, हम हर गांव में, सेट ऑफ गांव में, ग्राम पंचायत पे एक जो मशीन हमने बनाई है COPD रेस्पिरेटर, उसमें हम एक IoT सिस्टम बनाएंगे जो कि डेटा को रियल टाइम में सेंड करेगा टू द नियरेस्ट डिस्ट्रिक्ट हॉस्पिटल और मे बी टू द नियरेस्ट PHC ऑल्सो। एंड वो डेटा जो है कोलेक्ट होगा, कलेक्ट होगा, तो उससे हमें ये मालूम रहेगा कि 5 साल में एक किसान A, किसान B, किसान C ने जो COPD रिलेटेड प्रॉब्लम्स थी वो हमारी मशीन के थ्रू रियल टाइम में वहाँ पे आई, और उसमें क्या क्या बदलाव हुआ है जिसको हम डॉक्टर्स स्टडी कर सकते हैं। दूसरा, एक रूरल एम्प्लॉयमेंट भी जनरेट हो रहा था, जो कि वहाँ के लोकल टैलेंट को हायर करके हम उन मशीन्स पे भी रख सकते थे, और जो अभी मनरेगा जिसका नाम अब रीनेम हो गया है उसके अंतर्गत उनको हम वहाँ पे बैठा सकते थे। सो देयर वाज अ लॉट ऑफ इंटर रिलेटेड थिंग्स जिसमें हम 2-3 मिनिस्ट्रीज उत्तर प्रदेश की इन्वॉल्व कर सकते थे टू ब्रिंग दी रूरल पॉपुलेशन, उनकी जो हेल्थ प्रॉब्लम्स हैं उनको हम एक कमांड सेंटर पे लाएं, और एक मिशन, एक कंट्रोल मिशन जैसे कहते हैं, उसमें हम उसको रखें, जस्ट लाइक इसरो का होता है, एयरलाइंस का होता है, उस तरह से।
Thank you, Dr. Rahul. And I think exactly my next question was to Dr. Shyam in this direction, that how did you, if you have to engage multiple stakeholders, right? You don't have to only target the Ministry of Health and Family Welfare, but there are other agencies who can become a partner with it. So maybe engineering, the health, other relevant agencies. तो उसको सबको इकट्ठा करने में भी तो मतलब उसका कितनी हर एक की कितनी कितनी भागीदारी रह सकती है, उस पे आप कुछ मे बी वेरी स्मॉल शॉर्ट व्यू आप कुछ अपना दे सकते हैं, बिकॉज आई एम गेटिंग some hints to wind up the session as quickly as possible. Very good.
Thank you so much, ma'am. First, I would like to give thanks to UP State Government who organized such a beautiful program here on AI. And thank you, Chandigarh University, who curated such panel, because ICMR is here, WHO is here, one startup is here, and from the incubator. So under this one panel, you get all the pointers from different perspective on this subject. So yes, we being a STPI, a Software Technology Parks of India, is having a medical center of excellence in the premises of SGPGI that was started in late 2021 in collaboration with MIT, Minister of Electronics and Information Technology, UP State Government, SGPGI, and STPI. Parallelly, we collaborated with IMET, which is an association of Indian medical devices, and AMTZ, which is one of the key knowledge partner to us because located in Visakhapatnam, thanks to Dr. Jitin Sharma sir. So that was a key partners to us. Parallelly, when we started, we tried to float problem statement, and through problem statement, we tried to index the startups. They're pitching to us a panel, and through that process, we incubated. And when they got selected, incubated with us, we provide such soft support and hard support, the incubation facilities that we have. Coming to the question, ma'am, yes, we have multiple stakeholders, institutions like SGPGI, IMAT, AMTZ, and many others institutions, venture capital, angel investors. So we first analyze what is actually startup needed. As per the need of the startup, we try to reach out to multiple stakeholders, how we can fulfill the requirement of the startups. And whatever the challenges comes, we try to discuss and try to formulate that. And I'm very happy to say that most of our stakeholders, we try to support our startups. In SGPGI, we got the clinical part. There's a good clinical brain with doctors who are assisting our startups, providing clinical mentoring. And if they need some, the mature startups is talking about, they're up to a scale, those who are in the, applied for the compliances like CDSO is a very important phase in their process. So thanks to ICMR and CDSO having launched a portal called MedTech Mitra, many such medical devices startups who are developing such thing, they reach out to them, they resolving the queries, and I mean like that way we are proceeding as an incubator. Apart from this is there is one other phase called funding, because we understand that in medical industry, the fund that investors actually are looking for the good gain. So initial round of funding is very challenging, but thanks to the government who and ICMR basically who time to time launch the calls, trying to support the innovation. Startup India Seed Fund is there. Start UP is having their own policy to support the startups. Mighty is having their own schemes, Nidhi Prayas, Genesis, some of the schemes. So all these stakeholders are trying to pushing hard to support the startups, and it's the responsibility of everyone in this ecosystem to come together as an ally, and we can create a good ecosystem in youth. Thank you.
Yeah, so thank you, Shyam, and you have really enlightened that how all the stakeholders can join together, ICMR, clinical validation partner like SGPJ and all that. So I think quickly, I would just like to put forth some of the initiatives again, which reminded me Shyam has done from Indian Council of Medical Research. Yes, we have many solutions, but before these solutions go into the program, we have many innovators, many incubators, and many organizations who have joined here. And I will utilize this panel to tell all of them that we have two big initiatives. The Government of India, one is MedTech Mitra, another is the Patent Mitra, which will help you out that whatever solutions you have, if you want to take it some to the surveillance level or to the marketing level or to the program level, so these two programs are totally online and you can approach through these. Another portal, another bigger initiative is our health technology assessment. Okay, so this health technology assessment is in the tune of what NICE UK has and HITEP Thailand has. So whatever innovations, whatever newer guidelines, process, products, diagnostics, methods go into the program, if they are HTA, they straight away go to the program. Okay, so they are the economic evaluation. For example, the solutions that all of you told for quick diagnosis, for quick, medication and all that. So if they need to be economically evaluated, if they are cost effective, they are cost benefit. So all those things, if they are done through HTA, easy to take up into the program. And lastly, through my division, through implementation research with the Indian Council of Medical Research Agency under the extramural program, if we have to take those solutions to the national program of NCD, national program of anemia, national program of mental health, those can be easily taken up by funding through the implementation research program, and which is not less, we can go up to, our extramural grant is somewhere around 1400 crore per annum, and it is very not less grant. But of course, we have various collaborations which are going on. But thanks to the AI and ML and gathering all this panel discussion with such a wonderful audience all together, and hopefully we will be able to take up some of the recommendations from this panel to a larger audience. So I will just end this panel discussion over here, and I think there will be takeaways which will be put up as a record to the proceedings. Thank you all.
Thank you for sharing all the insightful takeaways, ma'am. Now, moving forward with the felicitation ceremony, I would request Dr. Archita Nandi, Director Innovation and Innovation, Chandigarh University, to felicitate our esteemed panelists. Now, Dr. Ashu Grover, Scientist G and Head Delivery Research, Indian Council of Medical Research. Dr. Vikas Gupta, State Senior Medical Officer, WHO, NPSN, Lucknow. Dr. Rahul Dikshit, Founder and Director, Sangra Innovations Private Limited, Kanpur. Sham Kumar Ji, Chief Operating Officer, STPI MedTech Center of Excellence, Lucknow. Thank you. Now moving ahead with what we are building in the cohort, right? Can I have a website that we have built for the cohort, right? Okay. So what you're seeing right now is the website of AI in Healthcare Build Cohort Plus Hackathon. So the idea is quite simple, bringing healthcare problems into an industry validated MVP ready solutions. If I just start with the support, who we are building, the idea is quite simple. As I told you, AI in Healthcare Build Cohort, where builders, developers, entrepreneurs have come together to build AI solutions and their healthcare problems. And the matter is how we are doing it. So the hackathon. Our selection process is quite simple. We select a hackathon and showcase through method in which everyone can earn their showcase ticket through their way. We look at the founder story as a main priority and then start selecting. The second, selection of the healthcare and build cohort, in which we select top 10 ideas in every 6 months, the fall and the summer, in which our focus is to give them Kickstarter amount, let them come into the industry, have them mentorship from the best mentors, and then finally, starting up with definitely the mentorship and product building, and then the demo day. The demo day is quite a simple thing. A lot of investors, a lot of venture capitalists sitting, and then you can ask for funds. It happens every 3 months, right? The recent one will be happening in Sandbox as well. So that's what the demo day stage we create for every single founder out there. Talking about the government support, definitely we have a lot thanks to this place. The main thing is who is backing us, right? Because every single good idea is somewhere packaged and backed by some good people. So here as well, we have been backed by Fortis, Bayor, a lot of different universities also jumped up to help us in finding good healthcare AI solutions. A lot of mentors as well. I would request the technical team to just show some of the mentors if it's possible. We would love to actually go there, right? So we have Ashish Guleria ji, we have Arish Lakani, Cloud Eagle AI from directly from Y Combinator. Then we have multiple people on board, right? So that's just one of the glimpse of it. If I just show you the timelines, what we are bringing up, now the hackathon and tracks, jumping on what tracks we are solving, right? Can we have a description of tracks, ma'am? Right. So here it is, open innovation, what we call. So what is open innovation? It's quite simple by the words itself. Anyone who wants to build anything, they can just apply with their own idea. The one thing, right? Second is industry set problem statements. If I just jump into it, ma'am, kindly please have a click on industry set problem statements. The ID team, I request. Industry set problem statements, kindly click. Right. So when you click on the industry set problem statements, you will find problem statements from Tynor, from ICMR, from Fortis, and multiple people who are working with us. And definitely then the 4 pillars that we are working on. It's medical devices, IoT, healthcare, telemedicine, and clinical decision support, and women's health and maternal and child support. One of the 4 important pillars that we are looking out this hackathon. And that's what it is. That's what the medical hackathon is. We are trying to launch out really good ideas with the help of Demo Day and with the help of a lot of mentors like you present here. So starting with that, I would request permission from ma'am to just call on the stage the startups, first of all, who is